very much. Good afternoon, everybody. I want to welcome everybody to this joint committee by the City Council Committees on Children and Youth and Education on this important conversation on school reopening. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing and is as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, the Philadelphia Inquirer, and Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come. Mr. Spiva, will you please call the roll to take attendance? Members that are in attendance, will you please indicate that you are present when your name is called? Also, if you can say a few brief words when responding so that your image can be displayed on screen when you speak.
Thank you. Councilmember Thomas.
Good afternoon, Madam Chairs. Good afternoon to all of the witnesses and to the listening public. Happy to be here today.
Councilmember Brooks.
Good morning, Madam Chair. Good morning, colleagues. Good morning, listening public.
Good morning. Good afternoon.
Councilmember Gautier.
Good morning to the chairs. Good morning, colleagues. Good morning. Oh, good afternoon to everyone present.
Good afternoon.
Councilmember Johnson. Councilmember Squillen.
Good afternoon, Madam Chairs and colleagues.
Good afternoon.
Councilmember O.
Good afternoon, Madam Chair. Good afternoon, colleagues.
Councilmember Quinones Sanchez.
Good afternoon, colleagues and members of the viewing public.
Chairperson Ginn.
I am present. Good afternoon, everybody, and I want to welcome everybody to this hearing. I recognize that a quorum of the committee is currently present, and this hearing is now called to order. This is a public hearing of the Committees on Children and Youth and Education regarding resolution number 200630. Mr. Spiva, will you please read the title of the resolution?
Yes. Resolution 200630, resolution authorizing the Committees on Children and Youth and Education to conduct joint hearings on protocols and decision-making processes in place to protect the health and safety of young people as the School District of Philadelphia navigates a return to in-person learning during the COVID-19 pandemic and the city's role in bridging the digital.
Public hearing is being recorded. Because the hearing is public, participants and the viewers have no reasonable expectation of privacy. By continuing to be in this meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. And in order to comply with the Sunshine Act, the chat feature must only be used by City Council members and solely for this purpose. I want to just, we have with us today a number of testifiers, and we look forward to hearing from them. We do have limited testimony, a limited time with one of our testifiers who is up first, Dr. David Rubin. So in the interest of time, we're actually going to move into having Dr. Rubin testify so that he has the maximum amount of time with our members. And then we will take some opening remarks from City Council members before moving into the rest of the testimony, which includes Superintendent Hite and the rest of the panels who are included today. So I want to welcome everybody to this very important conversation on school reopening. We are going to begin now with Dr. David Rubin from CHOP. Dr. Rubin, thank you so much for being on. Just want to make sure that your sound is able to be heard.
Can you hear me now?
Absolutely. Thank you.
Well, hello, my name is Dave Rubin. I serve as the Director of Policy Lab, a research center at Children's Hospital Philadelphia, as well as a general pediatrician in the CHOP Primary Care Network, and as a director for our population health program at CHOP. I'm also a professor of pediatrics at the University of Pennsylvania Perelman School of Medicine. I want to thank you for inviting me to testify before City Council today to update you on the emerging science around COVID-19 and the safe functioning of schools offering in-person instruction. I would start by saying that this has been a difficult year for our children, their parents and guardians, and our teachers and staff in the schools, as many schools have welcomed at least some elementary, middle, and high schools into classrooms, and as they plan to resume full in-school instruction later this spring in many areas just around our region here. Our large urban school districts have experienced unique challenges due to disproportionate risk that their school communities, particularly families of color, have faced since the onset of this pandemic. Therefore, it's understandable that people want to know whether multi-layered school safety plans that include some combination of universal masking, distancing of students, good hygiene practices, and strict sick policies to reduce the potential for in-school COVID-19 exposure can reliably protect individuals in buildings with such a high volume of students. We are learning more about the disease each and every day, and we're also learning more about the efficacy of our school safety plans. And we are in a place of strength with the availability of new tools such as testing and vaccination that can provide extra layers of protection against infection. A number of schools in this region have returned to or are returning more children to school based on confidence in their own multi-layered safety plans, which now include access to more regular testing and vaccines. They're doing so in the context of declining COVID-19 cases nationwide. And our COVID-19 forecasting model at Policy Lab shows that suspects that transmission will continue to decrease as we head towards spring, not just in our region, but across the country. To help inform your own decision making, I'm here to share what we know from the evidence and experience of other districts to provide information to all stakeholders who are grappling with this difficult decision. I'm here as a doctor and a researcher from CHOP to provide you with the best information available based on what we know from the science. I'm also here as the son of an elementary school teacher who spent her career in New York City in the public school system, so I'm able to put the concerns of school communities, both families and staff, into the context of whether I would have felt comfortable sending my own mother back into her classroom, and whether I would have sent the children across the diverse communities of Philadelphia, like her school community, back into schools with the confidence that they would be safe. Over the past year, I've had the privilege and opportunity to share insights born from our research with leaders throughout Philadelphia, across the region, and the country to help them make decisions based on what the science is telling us. These are leaders like you who have grappled with a number of very difficult questions. Our research teams at Policy Lab at CHOP have contributed to the emerging science on COVID-19 transmission. We've carefully reviewed the emerging science on school safety, and we've produced and then modified health and safety guidance to school administrators to reflect how this emerging science has changed over the course of the pandemic. We have collected, reviewed, and followed the increasing evidence that multi-layered school safety plans rooted in universal masking, distancing of students, good hygiene practices, and strict sick policies can significantly minimize the likelihood of transmission occurring during the school day. We were greatly encouraged by the evidence that even large districts like New York City have had very infrequent transmission when they opened their elementary schools in the fall using strong multi-layered safety protocols. In our own region, reported link transmission in schools has been infrequent, and student-to-staff transmission has been even more rare, occurring mostly at the height of the pandemic in November and December. We have accumulating evidence that in the presence of good safety protocols, transmission has also been infrequent at daycares, summer camp programs, and virtual access centers for children in Philadelphia. Finally, our confidence is increased by the growing evidence from multiple states and countries indicating schools can be safe for in-school instruction during the pandemic, assuming the presence of strong multi-layered plans like the ones we have articulated in our Policy Lab guidance and which have been consistent with the new Centers for Disease Control and Prevention guidelines released just this week. We come to this conclusion while mindful that we are among those who encouraged a brief pause in in-school instruction just before the holidays in late 2020, given the rapidly accelerating disease transmission in the region and concern that scientific studies demonstrating the safety of schools could not fully extend to the grave situation our region and country faced on the precipice of holiday gatherings. During a webinar for Philadelphia school staff in November, we encouraged the district to delay the resumption of in-school instruction until the worst of the pandemic was behind us. As difficult as it was to reach that conclusion in November, when regional transmission rates were so high that we felt they placed in jeopardy the safety of students and staff for in-school instruction, we are now in a much different situation today. Additional studies have published examining transmission risk well into the fall and early winter, which demonstrate how well school safety plans held up at much higher levels of community transmission. Community transmission rates in our region are also rapidly decreasing now, and by spring will likely fall below rates we have not seen since early fall when many schools opened safely for in-school instruction. Critically, CHOP is offering a robust assurance testing program known as Project ACIT, assisting childhood education through increased testing, that will be initiated in Philadelphia schools once in-person instruction resumes, providing weekly testing of all school staff and high-risk students. This is in addition to the testing that CHOP is providing in the community already. Other schools have found assurance testing or routine testing to detect asymptomatic cases can quickly remove potentially contagious individuals from schools while they are asymptomatic, keeping other students and staff in the building safe. Such programs have also been credited with greatly reducing the presence of COVID-19 across college campuses throughout the pandemic. Our early experience with school districts in the region through Project ACIT has also affirmed just how infrequently school staff and students have infection. When we have found cases, we have been able to act on that knowledge quickly. However, the infrequency of positive asymptomatic COVID-19 tests has alleviated anxiety and created an additional degree of confidence that school safety plans are working. While no strategy can entirely eliminate risk, I would be remiss not to mention that Policy Lab has been engaged for over 10 years in research and work on the ground related to health disparities that affect children across the country, including here in Philadelphia. We are following the research and evidence about the accumulating consequences of school reopening delays on the physical and emotional health of our children and what it will mean to widening gaps in educational attainment. All told, the conclusion that we have reached in the face of falling transmission, strong safety plans, and the addition of a strong assurance testing program is that the window of opportunity has opened for returning more children to the classroom, particularly in our large cities, and that it can be done quite safely, even as CHOP will begin to vaccinate school staff as early as next week. Pursuant to the CDC guidelines, we are likely to reach thresholds of community transmission in the coming months that would allow us to return even more youth as the spring unfolds. Thank you for the opportunity to testify today, and I'd be happy to answer your questions.
Thank you. Thank you so much, Dr. Rubin. And, I want to underscore how much we appreciate the expertise that CHOP and Policy Lab in particular brings to what we know is a very challenging debate about school reopening. I had a few questions, and then I did want to pass them on to some of my council members. The CDC just very recently talked about new guidelines, and I'm wondering how you are incorporating those into the advice that you're giving more broadly to school districts across Pennsylvania and here.
Sure. It was good to see the CDC try to accumulate the evidence. The CDC is providing a template, I think, for schools of very different schools throughout the region in the country to kind of appraise how to make the next steps in spring. We have a lot of schools that are already open, that are already planning to resume full in-school instruction. Then we have a lot of schools like, in the city of Philadelphia that are struggling to get their doors open. I think they affirm some very important principles, and we discussed this in our blog today, and I would encourage folks to read our blog, which should be out later today, where we review the guidelines. The first is that elementary schools can open. And we've seen a lot of safety in terms of elementary schools opening with good safety protocols during the pandemic. And across all their thresholds that they identified, they recognize that. They also offer a path to returning more middle and high school students to the classroom as case transmission continues to fall. They affirm the value of assurance testing, like the program we are doing in the Philadelphia region and offering now to the Philadelphia School District. And they also affirmed that we're excited about vaccinations, and Shirley Chop is excited to provide them, but that we've reached a safety threshold through our plans and the evidence we've accumulated that vaccines should not be a precondition to opening our schools.
Thank you. Could you speak a little bit about what you are thinking about or watching for in terms of if there's any risk created by new variants that might be more contagious and how that's factoring into how we should be thinking and planning?
Yeah, I talked a lot about the variants, and certainly we've done that on our website as well, too. I think there's a lot of concern about the variants. I think there's evidence that particularly the strain from the United Kingdom may be more transmissible and potentially have a somewhat increased rate of severity. But when you look at the innate transmissibility of the strain itself, that's one factor that plays into the overall transmission of the virus in a region. And you can think about the transmission and the direction of the pandemic, as a bunch of forces acting all at once. And certainly if we were just simply looking at the innate property of these strains as they start to accumulate in the United States, we would be worried. But we now have forces acting against transmission in the region and in the country that seem to be outweighing any innate increased transmissibility, because even as these strains grow as a proportion of the virus isolates that we see in the country, case incidence is falling, and it's falling rapidly everywhere. And that what we are now seeing is the strong seasonality of this virus emerge. We had known since spring, as we'd done our early analysis and published our work around this virus, that most public health experts like ourselves were very worried about the winter. We knew that there was going to be a strong resurgence in the winter, and everything we did in fall and the caution we exercised in fall was try to slow this down so that we wouldn't overwhelm our region in the winter. Our recommendations in the winter to take a pause were also to try to help ensure that we would not exceed healthcare capacity and that as few people would have tragedy in their families as possible. But we're now on the backside of that, and the same seasonality is now contributing towards longer days, warmer temperatures coming, and we're seeing rapidly declining transmission that's being aided by the immunologic protection that's afforded by natural and acquired immunity. And all of that is really pushing back and overwhelming any sort of native capability of these strains to really take over. We're watching it closely, and certainly we'll be the first ones to say if we see otherwise, but we are seeing declining incidence now in every county in our model. And so that is a very strong, powerful message that the worst seems to be behind us, and I think there are better days ahead.
Thank you very much. The other two areas that I just wanted to check in on is areas that CHOP has partnered with the district on, and in particular, it's about if you could speak a little bit to the value of testing, especially given the asymptomatic or pre-symptomatic transmission, and also more recently, the CDC's emphasis on the value of contact tracing. We've struggled a little bit with this on the city level. Interested in hearing from you about how, if you have any of the specifics about how you could see that unfurl here locally in Philadelphia, if you are able to, but more broadly, how you're advising districts around testing and contact tracing.
Well, I think, in November, as challenging that time was, we pivoted to bring a testing program that I think rivals any testing program in the country to the Philadelphia region. We knew it was going to, we knew that these safety plans could provide a large degree of protection, and to add another layer of reducing the potential infectious risk in the schools was an important layer. And it's what we call going on offense against this virus, right? Our basic, we're using a testing program, and first we're providing rapid tests, which can be done on site in schools. So people don't have to travel and they don't have to wait for results. We have confirmation testing with rapid tests as well that are molecular tests that are really sensitive. And we have, our uses are for, number one, the individual who comes to school feeling well, whether a staff member or a student, who may start feeling unwell during the day. And we can rapidly test that child or staff member before they go home to activate a process that quickly responds, but also not to alleviate anxiety, because some of those may just be a garden variety cold and are not COVID. And particularly as the incidence of COVID goes down, many more of those situations are unlikely to be COVID. And so that helps alleviate anxiety, helps people make decisions quickly at the nurse's office. And then there's our weekly assurance testing program that I described. The idea is full participation. COVID response is a team sport. Everyone's testing to protect each other. And particularly, we're testing the highest risk individuals. And the highest risk individuals are adults, because that's where we've seen most infections. And it's to, number one, to test everyone to figure out who might be asymptomatic but contagious with early COVID-19 infection, and remove them, and remove a potential infectious risk in the school. We're focusing on children in low incident classrooms, children who can't mask or distance effectively, to protect both them and the staff that care for them in close proximity. We're focusing on our athletes in many regions, and to provide them the type of testing that players in the NBA and the NFL had, and to allow them to participate in the extracurricular activities that are so important to their lives, but do it safely with the knowledge that they can protect their families and their grandparents at the same time. And we're also looking to use it to help test kids who may be in quarantine, as we move later into the year, to help kids come back a little bit earlier if they remain asymptomatic for a period of time pursuant to the CDC guidelines, that we can provide a test to help get those kids back to the classroom, or a staff member back to the classroom as soon as possible.
Thank you. And just for clarity, could you clarify that the testing will apply to extracurriculars as well?
I don't know what the plan is for the district right now. We have offered it in many districts across the region. As of now, I don't believe the testing of athletes is included in the school district plan, but I would have to defer to others as to the nature of that reason.
Okay. It sounds like we have some interference.
For joining the meeting, can you just make sure that you're muted and that your video is off until your panel is participating? Thank you.
Thank you.
But we're also, Councilwoman Gim, we're also now starting to offer it for school programs. I'm also mindful of the arts, music, theater, choir, right? And our singing groups. That's an important heritage in our city as well, too. And we're offering it in those situations as well. Similar to our, it's really our high contact sports and arts programs, and to allow kids, events and these activities are so important in their lives that if we can provide the additional layer of safety through a testing program that helps them, we're willing to do it.
Thank you very much. I'll pass this over to some of my colleagues who have questions. So I think Council Member Quinones Sanchez.
Thank you, Dr. Rubin, and thank you to CHOP for all of your partnership, guidance, and leadership. We are reminded about the healthcare renowned institutions we have in the city of Philadelphia, and there's something about your monotone that makes me feel a little better, so thank you. I wanted to follow that line of questioning from Councilmember Gim around the testing, because we've had some varying opinions, and I know doctors can now be like lawyers. You're going to have different opinions around this asymptomatic, pre-symptomatic testing. Can you speak to how long, as we're vaccinating people and working, how long do you think we need to keep this in the system if we want to assure and create that kind of sense of security given the how asymptomatic and pre-symptomatic people are a major threat to all of us returning to whatever the new normal is?
Sure, I think it depends on the incidence levels in the community. I think the CDC guidelines affirm that. While we're still sort of at these higher levels, we're not achieving viral elimination, but on top of the safety plans, which have been extremely safe, if I can remove 2/3 of the individuals for the building who might be pre-symptomatic, that on top of these safety plans is just another layer. And we talk about these layers as being multiplicative on top of each other. And so to me, it's a really nice layer. But as you move forward deeper into the spring, as rates go down, there may come a time later in spring that, as the CDC guidelines, where you stop testing students and you focus just on the staff. You may, if we're fortunate enough that they go low enough, you can pull back on the testing program and just focus on your high risk moments or events when people are gathering. We're starting with some regions to talk about graduations and how we might do that safely. These are important events in children's lives. And so I think we're nimble to adjust to the conditions on the ground. And that's what's been really hard for people to understand is that the same opinion the same discussion we might have in November is very different now in February and as we approach March, and it's based on the conditions on the ground and the emerging evidence. But having those tests and having a certain inventory of tests, a really strong procedure to do this, and the ability to do this in a way that doesn't interfere with the education that's occurring in school, to be able to do it quickly. I can tell you the report back from staff throughout the region that are now implementing this in dozens of school districts is that they're happy to have it. And there's an excitement. They feel comfortable that they're protecting each other, and and the infrequency of the positive results that we are seeing is giving people even greater confidence in the safety plans that they've deployed.
And then finally, how does this also, again, you're talking about a layer approach. What's your feeling on masks? I know there's been some discussion of double mask, and how long do you foresee us having to utilize this in this process? Because this becomes a concern as it gets warmer, people get more comfortable, you're doing testing. Like, how do we ensure that the layers are important and they work and they're more effective when all of them are in play? So what would you say around the mask?
Well, rather than, I'm more of a fan of making sure masks are worn appropriately. And I think that we're having teachers and staff work with each other and work with their students to ensure that they're wearing them correctly, to avoid the use of bandanas and gaiters, which I don't think work very well. I'm a big fan of the 3-ply surgical masks. And, to me, that's a wise investment with the wire bridge. There's some really nice videos. I thought the CDC did a really nice job of summarizing a lot of really terrific ways to think about masks. And if you did one thing and one thing well, it would be to make sure that everyone is wearing a mask, covering up their nose really well, making sure that they're covering those open pockets on the side of their face. And I would focus a lot of attention on that based on the knowledge of how this virus transmits.
Thank you. Thank you, Dr. Rubin. Thank you.
Thank you, Madam Councilwoman. Councilmember O.
Thank you very much, Chairwoman. Almost all of my questions have been answered, Doctor, just in the course of the. But since you are here, let me just ask you. There are schools that are open, even here in Philadelphia and our surrounding counties, and what. So I'm just imagining that obviously you've incorporated that data into your conclusions. Is there information regarding issues around children who do not return to the classroom?
Well, I think we shouldn't be quick to assume that all those. People, families have decisions to make, and I know that some kids have done well. Actually, we've had lots of reports that have done well, and it's made us think. I think it opens up the value of virtual instruction and tailoring education to the individual needs of families. But that said, we also know that a lot of kids have struggled. We know that our middle and high schoolers in particular have struggled, a lot of mental health issues, born by social isolation. School is not the panacea for social isolation in that age group, but it helps. And a lot of other kids who can't learn well remotely. And so to me, the goal, as you weigh where our knowledge of the safety threshold, and I believe that's been met at this point with the accumulating evidence, against the competing effects in terms of adverse outcomes of kids, it becomes compelling the need to allow kids to start returning for in-school instruction.
Okay, I'm going to ask my last question just on that point. I imagine, and I'm asking you, does the data indicate that children who have issues with poverty, perhaps not, the available parents at home, the support structure, do they do better or worse, or is there no difference, no data about remote learning?
Problem is, by the time we'll have that data, we'll be long past this pandemic. And I think we have to assume, based on our knowledge of how things are going, the reports of administrators, the reports of kids dropping out, of not coming to class, that, and the concerns about educational attainment, that there are real concerns that are likely to be justified and affirmed once this pandemic is over. And that's constantly something that you have to weigh. But I think, for me, I'm here to speak about safety today and whether you've met a safety threshold. And I believe with declining case incidents in the emerging science, that threshold has been met. And you have layers here for the Philadelphia school system that I think other school systems don't have. And I believe that there's an environment and the possibility now to really start returning kids to the classroom and do it safely, with the knowledge that school families can be safe and our staff can be safe as well.
Thank you very much, Doctor. Thank you, Chairwoman.
Thank you very much, Councilmember. Councilmember Gautier?
Thank you, Madam Chair. Hi, Dr. Rubin. Thanks for being with us. Can you confirm whether testing will be available to all students, teachers, and staff? And can you also talk about if there'll be sort of testing centers at each school?
I'm not aware of the specific plans in each school building, but we're planning to offer testing in each school building. And you have to refer to the district in terms of their plans of how they're operationalizing this. The goal is to provide access to tests for all staff, not just teachers. And we're encouraging full participation because that's how this works. And then to focus on high-risk students, not all students right now. If we're finding evidence of risk that's unforeseen and we need to grow the program, we have relationships with HHS to request additional tests to do that, but we have now focused on those students with the highest contact risk. Those are, and offering the testing for those groups, and then relying on the district along with other folks in the city to decide on their priorities, because this is a discussion and ultimately an operational plan of the district alongside the health department in the city.
So the expectation or the recommendation is that there be testing at every school on site, and the district has to figure out how to make that happen. Is that what you're saying?
Yeah, those plans are being made. We've been involved in those discussions because we're providing the allocation of tests and instruments and the training, so that planning is occurring, and our anticipation is this program will begin as students return to school.
Thank you so much.
Thank you very much, Councilmember Gautier. So could you clarify, Dr. Rubin, what you mean by high-risk students and testing?
Well, we talked about that in terms of, we talked about symptomatic testing for those who come to school well. We're not encouraging sick children to come to school. We have testing locations from CHOP. We can facilitate referral for children who are sick at home or staff who are sick at home. But for the asymptomatic weekly assurance testing, you focus on those who have a high degree of contact in close proximity and have been shown through our previous work around contact tracing and the nature of transmission in children to be at higher risk. Those are kids in youth sports, and particularly high contact youth sports. They are special needs students who may be in classrooms where you can't distance effectively or they can't wear masks effectively, high contact. They may have special needs as well too. Children in the arts, or band, choir, and so you can see the nature of those activities. They create extra risk above normal in terms of a normal school day, but those activities are important to families. They're important to the kids, and we're positioning testing to ensure a degree of safety that prioritizes in-school instruction.
Thank you. If we could pivot a little bit outside the immediacy of COVID, CHOP has done significant work, especially you've been a great partner on key public health issues facing children overall, for example, asthma. And, even before COVID, I think you've had an important role to play about making sure that the health conditions overall for children are better than what they have been. And so many of our aging school buildings, housing can contribute to some of these health issues. Congress is considering a massive federal relief package by President Biden, which could send cities like Philadelphia significant amounts of infrastructure money to modernize school buildings. Can you speak at all to what the value is of investing in modernizing school buildings overall as a public health matter?
Oh, absolutely. I mean, I'd be remiss to note, I know the concerns about ventilation in the district, in some of the buildings in the district, and the condition of the buildings are serious concerns. And there are many experts far more knowledgeable than myself who can weigh in on that. And I think that clearly modernization, as we think about lessons from the pandemic, modernization of our schools is going to be extremely important. But I do want to make a specific point, Councilwoman. If I focus simply on the transmission and the science of this, and I think it's important to note here in terms of positioning those issues with respect to getting our kids back to school. Our knowledge of how this virus transmits is it largely transmits as a large droplet, which has led to these recommendations about 6 feet and masking, because the primary mode of transmission is close proximity with sustained contact, particularly if you're unmasked. While there have been anecdotal reports of aerosolization of this virus that have brought up the issue of ventilation in our schools, they remain rare and the exception. And we just have not seen that in the context of other schools and school districts that have opened with older buildings, just like Philadelphia. Our opinion then is that, ventilation is helpful. Ventilatory changes can be helpful if you can do that. Even simple stuff like opening a window, putting fans in a room, keeping the door to a classroom open. But the primary interventions for COVID prevention are really masking and distancing and hygiene and keeping sick kids out of school and sick staff out of school. And in that context, I just want to make sure, because the issues around the condition of school buildings are extremely important, but with regards to COVID transmission and your COVID layered plan, don't mistake that your primary interventions are really the masking, the distancing, the sick policy, hygiene, and then certainly the addition of these testing programs, and soon the addition of vaccination.
Yeah, no, I appreciate that. I think, one thing that's been helpful is to make clear the difference around how medicine is seeing ventilation and building conditions as being to what extent they contribute to COVID transmission versus the fact that it's a serious health issue separate from that,
Absolutely, and I don't want to discount those concerns; those are real. And but I speaking on the science of COVID transmission, I just want to place it in perspective. All right.
Yeah. No, thank you, Councilmember Brooks.
Actually, he answered my question, so thank you.
I did have one an additional question, which is, one area of concern, and I appreciate that you've been speaking to this significantly, has been the question about how we can better support mental health issues among young people. I know that at CHOP, you've been working with many young people across many different spectrums related to their overall health and well-being. And do you have advice or perspectives about what city and school districts can do to better support the mental health of young people, whether they are learning remotely or whether they are in person in the classroom?
This is a big area, and is deserving of its own conversation. I will say to start, just somewhat optimistically, I think that there will be silver linings in terms of the relationships that have been built during this pandemic, and hopefully as we get our schools open in Philadelphia, which is the relationships between healthcare, public health, and our schools, and the true recognition of what a strong school health program can do. And certainly we think about that with an assurance testing program, with, how we're working with our school nurses now in Philadelphia. But, this is also in the future about influenza and preparation for flu seasons, about other school health issues like asthma. And then what is our daunting crisis right now, which is a mental health crisis that began before the pandemic and has been accelerated by the social isolation of this pandemic. And I think we should be mindful that as we modernize our buildings, part of our modernization will be to rethink what we do in terms of school health. And that includes mental health. And I think we need to build back and recognize the extreme importance of building robust school-based mental health programs, not just ambulatory providers that families can go to outside of school, but positioning that within the school day.
Well, we really look forward to working with you on that. I think that'll be a really important aspect, no matter what form of school learning we're in. This has been a clear call from our community, from our youth communities even before, and it will be needed more than ever. Councilmember Brooks, I think you might have now had a question.
Would you agree that making sure that parents and families and workers have access to paid leave, sick leave during this time is important for keeping our schools and communities safe?
I think actually, we have talked a lot about sick leave, and I believe that sick leave is an important strategy in terms of recognizing the situation that we're in, and acknowledging that the challenges that we need to ensure that people who do go out sick or have family members who are sick are adequately protected during this time.
Thank you so much.
Thank you so much. Are there any other questions that we have for Dr. Rubin? Seeing none, again, Dr. Rubin, we want to thank you for your tremendous work at CHOP Policy Lab. I think one of the more difficult things is that there is a lot of uncertainty, and what parents and community members we find need the most are an ability to have some questions answered. Some of them are very basic and some of them are extremely complicated, and we really appreciate your time and CHOP Policy Lab's efforts to really not only ensure the health of our region, but improve the knowledge base of our communities to better take care of themselves as well as their children. So thank you very much.
Good luck, everyone.
Thank you.
Bye now.
Well, I want to thank, we wanted to have as much time as we could with Dr. Rubin. And now as we head into, the majority of our panels that are upcoming, I just wanted a chance for all of us, for those who were interested, to make some initial opening remarks about the importance of this conversation. I want to, most of all, again, just welcome the public to this very important conversation on school reopening. Reopening schools responsibly and safely is our top priority. It is an urgent matter, but it is also in many ways a fraught one. There is significant division and passion surrounding this issue. And today, Council seeks to provide a forum for the respectful engagement of Philadelphians with diverse viewpoints. Our goal for today is very clear. We want to arrive at a place where our constituents feel heard, respected, and responded to. This conversation is a national one. Without decades of underfunding and the racist neglect of our schools, the conversation about reopening and ventilation would be so much different. Had the previous federal administration provided us with any semblance of a national plan or comprehensive guidance from the CDC, this discussion would also be so different. We're not going to be able to undo that. but we can acknowledge it and chart a path forward. I also want to recognize the immense stress and burden that everyone has been under in this past year. Our students, our families, teachers, principals, school staff, our administrators, many of us as city officials have had many sleepless nights over this issue and the care and keeping of our youth and our families. We're grateful for your service throughout all these profound challenges, and that is why we want to make sure that your voices are centered and that we are listening. But today is most importantly about the issue of communication and trust. We want to build towards a full reopening of schools. The district's announcement of a delay in a potential school reopening is a testament to the importance that we have, the opportunity that we have right now to build collaborative processes for public engagement and public trust. It allows us today to both hear and respond to legitimate and longstanding concerns raised by communities all across the city, especially Black and Brown communities, which have not only been hardest hit by the COVID pandemic, they've been hardest hit by legacy of racism and of educational disparities long neglected by our city and state. Today, we have more than 50 testifiers. We probably have a dozen people who have submitted written testimony in addition, and a survey of close to 300 parents, students, teachers, and school staff who laid out their priorities and concerns. The respondents represented 41 of Philadelphia's 77 zip codes. A large majority of parents expressed concerns about the current reopening proposal and timeline, but more importantly, they identified a desire to get answers and key questions that they still have about the district's plans. Their questions run the gamut. Their top issues are about ventilation, access to vaccines, how to maintain social distancing, testing and contact tracing protocols to ensure the health and care of communities because COVID does not start or end at the schoolhouse doors. Respondents shared harrowing stories of children struggling emotionally at home, deep fears about the health and safety of vulnerable family members, as well, and we have to be honest about this, a deep distrust about the health plans of the district to keep students and families safe. Teachers who know both the strongest and weakest aspects of our schools overwhelmingly express concerns about safety and strong concerns about returning to buildings that need to be better than they were before. So today, we are hearing from all of our stakeholders, from parents and teachers, principals, food service workers, in addition to our school district and health experts like Dr. Rubin from CHOP Policy Lab. We must commit to do better than what we have done before. We are not going to a new normal. We are going to something better, and that must be a priority. I'll be sharing the complete survey results with my council colleagues and district leadership, and I hope that as we engage today, we can stay focused on what's needed for that full reopening of schools that brings a majority of our young people back. Our ultimate goal must be to bring our young people, our school staff and communities back to schools that are safer, that are healthier, and that are more equipped to support our young people than they ever were before. I also want to give a chance for my council co-chair of the Education Committee, Council Member Quinones Sanchez, to make a few opening remarks as well.
Thank you, Councilmember Gim, and I want to echo your sentiments, and I thank you for setting the tone about the importance of coming out of here with folks being respected and heard, and with a plan of action and assurance that all of us are committed to a common goal. I want to thank the advocates. You know, we started off last year with a lot of excitement around what local control meant for the schools. And, you know, just a couple of weeks ago, we had an annual meeting. And just last week, we gave an initial support to 3 very dynamic leaders, community leaders, former students of the school district, willing to step up and serve on the school board. This time last year, the irony is that we weren't talking about opening up schools. We were actually talking about closing schools. And I think of McClure, and I know you're going to hear from our fearless leader, Principal Marino, later on in this presentation. The debate around safety in school is one that, as you've highlighted, is very complicated. And the institutional racism that my community has faced, the historical disinvestment takes place and takes precedence over where we have been and where we need to go. I'm reminded of that McClure experience because I went to a lot of meetings and heard from a lot of frustrated parents, teachers, and I'm reminded that was in a mix of the Education Caucus and PFT election and all those, and there was so much passion. And I want to thank Principal Marino because I think she set a tone about what I hope becomes a better practice and process as we move forward around these very complicated school-by-school based issues. Principal Marino, Shepherd, school district folks, leadership, teachers, parents, concerned community residents, and together they worked at identifying not only the problems, but demanding the solutions. And McClure safely opened up. But through that process, I saw parents grappling with what information was correct, grappling with what they needed to know about asbestos and lead. And you know what? It was so unfair to them. And that's why I'm happy that in this process, we do have third-person validators. Our parents should not be caught in the middle of the debate between school district and the lack of trust that some of our stakeholders have with what has happened to them in the process. Third-person validator gives us an opportunity for parents to make decisions. As we reopen schools, parents will always and should always have the option of remaining virtual or slowly transitioning into schools when they feel it is safe. So I want to thank all the school-based workers, many who have not left school buildings and have fed people and provided access for special ed and special programming in the summer and our access people. I've personally watched young family members and neighbors struggle with the technology. I want to recognize Philly Connect and all of the partners and all of the advocacy that helped us get to a place where we could ensure digital learning and access to folks. There's a lot more work to be done, but advocacy did help, and people stepped up to the plate, and technology was offered, and access to digital technology was offered to our children, and we still have to work at how do we make that a permanent part of what we do. I'm glad that you brought Dr. Rubin, and as I said, the issue of of COVID testing and asymptomatic testing has always been a huge concern of mine, and contract tracing has always been a concern of mine, and having that in place as long as it's necessary for people to feel comfortable absolutely has to be part of it. When the CDC released its plan last week, it reminded me that in Philadelphia, we have, as you said, Councilmember Kim, we have not had good federal partners. In fact, some would say that the state has failed us, as the lawsuit that is pending outlines. But here in Philadelphia, City Council, we've stepped up to the plate and will continue to step up to the plate because our kids deserve that and more. Now we can have a conversation where social justice and equity really means us understanding that reparations means acknowledging what we haven't done in the past, but investing differently as we move in the forward to level out the playing field and access for all children. So I thank you, Madam Chair, for facilitating this discussion. I look forward to the conversation and look forward to being part of the solution. I want to recognize CHOP and for its vaccination plan. As you know, the Education Committee was really strong advocates with the administration because this was an area that Dr. Hite and the school district could not control. And I want to thank the administration for stepping up to the plate and giving us predictability. And I thank our federal partners who are advocating for more vaccines and encourage our state partners to join us in asking for Governor Wolf to allow us to prioritize teachers and school-based staff as quickly as possible. Thank you.
Thank you very much. Are there any other members of the committee who would like to make any opening remarks? And before we begin, I just want to acknowledge the presence of Councilmember Alan Dom. Good afternoon.
Good afternoon. Thank you.
Councilmember, I believe you're on mute currently.
Yes, Councilmember Thomas.
Madam Chair, can you hear me?
Yes.
Okay, I'm sorry. I've been having internet trouble all day. Good afternoon, everybody. Good afternoon to the listening public. I just want to say thank you to both of the chairs and everybody involved in the work that's been done as it relates to supporting our schools and helping try to get this situation right. You know, I just want to take a moment to just say, in the midst of all the work that's been done, I just appreciate having colleagues and council members who've been willing to step up the plate and honestly go over and beyond the call of duty. I don't think that a lot of people in the public really recognize how much work is done by the council members behind the scenes, not because it's our legislative obligation or because of anything like that. Number one, we feel like it's our moral obligation, but number two, we genuinely care about our children, our families, our staff, and all stakeholders involved. So I just wanted to take a minute before the hearing to start to let all of my colleagues know that I appreciate the work that they've done. And I look forward to this conversation so we can continue to do our part as it relates to trying to find a happy medium and figure out what is best for our children, our families, our staff, and everybody involved. So thank you to both of our chairs, and thank you to all of my colleagues as well as all parties involved.
Thank you very much. I also just want to recognize the presence of Council Member Catherine Gilmore Richardson. Good afternoon, Council Member.
Good afternoon, Madam Chair. Thank you so much.
Thank you.
Madam Chair, I believe.
Councilmember, you're on mute.
Mr. Spiva, will you please call the first panel and second witness that we have for this afternoon?
Yes, Dr. William Hite, Superintendent, School District of Philadelphia.
Thank you, and good afternoon, council co-chairs or committee co-chairs and members of City Council. And thank you for the opportunity to come before you again to talk about the reopening of schools for in-person learning. I too want to thank you for pulling together this public hearing today and talking about something that's very important to all of us. And I want to thank you for also having and inviting Dr. Rubin on to really talk through how they see this from the medical community and from the science that they have also been studying throughout this process. First, I want to start by acknowledging the strain that our
Dr.
teachers.
Hite,
yes.
I apologize. Could we just, for the purposes of the record, ask you to state your name for the public record and then to proceed with your testimony? Thank you so much.
I'm so sorry, Councilwoman Gim. I knew that. My name is William Hite, Superintendent, School District of Philadelphia. So first, I want to start by acknowledging the strain that our teachers and support staff have experienced for almost a year now as they've worked heroically to support our students during these unprecedented times. I'm deeply grateful for the many teachers and staff who have continued to provide instruction, participate in training, and fulfill their duties in support of our students. We all appreciate that we must keep our eye on the continuity for our students in this difficult time, and that is evident across all of our schools. I also want to acknowledge the thousands of district employees who have been reporting to work in person since the onset of the pandemic. Facilities and food service staff, school climate staff, principals, IT employees, payroll and talent employees, security staff, and hundreds of others. Thank you for helping us to get to this point. Additionally, I would like to express my gratitude to council members, and I could not agree with Council Member Thomas more that individuals may not recognize the tremendous amount of effort that council members have put in to this question and this process, to the council members who joined us for building walkthroughs in order to experience firsthand many of the safety protocols that we have put in place. So thank you to all of the council members. Originally, I was planning to use my time today to go through the numerous reasons why it is important to reopen their schools for in-person learning. I was going to discuss academic regression that we now know for a fact is happening, particularly with our youngest learners. We know right now that our kindergartners and first graders and second graders are behind where they were at the same time last year, with both kindergarten and first grade having the greatest regression of that age group. was going to highlight the trauma our students are struggling with and talk about all the work we have done to make sure our buildings support a safe and healthy return for students and staff. But then I opened an email from a parent who shared the following, and I quote, "Let's stop with the reasons why we can't and look more at the larger pile of reasons why we can." I agree with this parent that we should focus on a number of reasons why we need to reopen. But in arguing about the whys or the why nots, we're simply talking past each other. So I want to focus instead on talking with each other and how we can find common ground to begin reopening schools as quickly and as safely as possible. We have a great deal of work to do together. Two, on issues like how we address outstanding concerns about some of our buildings, or how we rebuild the community's trust in the district to deliver a thorough education in a safe and healthy learning environment. So instead of going through my presentation and focusing on the reasons why we need to return, I want to use this time to talk about this reality. All sides in this debate are people of good faith, and we all want the same thing. Ladies and gentlemen, in service to our children, it is time to start working together to return them to classrooms safely. I know no one doubts the urgency of getting children back in school. Here in Philadelphia, one of the poorest big cities in America, the pandemic has devastated communities in poverty. The effect of closing schools due to the pandemic in these communities has been especially damaging. The research shows that children of color have suffered the most, falling behind academically and risking their futures in the process. I know we all agree, families, teachers, staff members of school district, and elected officials, advocates, on the importance of reopening public schools. Our disagreement, however, has focused on how to do it safely. These are legitimate concerns, and we need to address them with their parents and students and with their teachers and staff. Today, I want to make clear that we at the district are committed to continuing our work with the Philadelphia Federation of Teachers and the Philadelphia Department of Public Health, and CHOP and any other institution that is available and willing to help to facilitate the safe return of teachers and students through the following measures. First, we announced earlier today, and Dr. Rubin talked about this, that the Children's Hospital of Philadelphia has secured ample supplies of rapid testing kits, and we will make rapid testing available to all teachers and staff working in our schools to help detect positive COVID-19 cases and prevent the spread of the virus. Dr. Rubin talked about the plan to actually have those and implement those, but we will essentially be asking all staff members, not just teachers, to be tested once a week. And tests will be then available for all of those individuals, and that would be done by a group that would then travel to schools at various times, maybe at different days, but everyone, all staff members would be tested once a week. In addition to that, all students who would return, a percentage of those students would also be tested for asymptomatic testing as well. Second, we also announced today that in partnership with CHOP and PDPH, we will begin rolling out COVID-19 vaccine appointments, starting first with staff who have already been working in their school buildings and those who are set to return to support our pre-K through second grade students. Invitations for appointments started going out to some of those staff members in that category today. Third, the district has developed a process to actively support PDPH's contact tracing efforts, which will help mitigate the spread of the virus in school communities. Fourth, we've spent over $250 million to make schools safe for teachers and students to return. We're committed to following the guidance of health experts to keep our students and staff safe. We appreciate legitimate concerns about building safety, and we agree that no one should be asked to return to a school unless it's safe to do so. And finally, we know that the best way to enhance the health and safety of all is to have multiple layers of safety. We have put in place extensive health and safety protocols for students and adults. We have extensive inventories of PPE for staff and students to support mandatory mask wearing and facial covering in schools, as well as new classroom and bathroom setups to ensure social distancing, touchless hand sanitizer stations in all hallways, cleaning supply stations in classrooms, maximum occupancy signs outside each room, safety signage throughout schools, and enhanced cleaning protocols using EPA-approved cleaning products. Last week, the Centers for Disease Control and Prevention released guidelines for safely reopening schools, and I can confidently say that the School District of Philadelphia is in full compliance. But it's not an all or nothing proposition. So let's find some common ground on building safety. We seek to return approximately 9,000 pre-K through second graders for 2 days a week at approximately 150 school buildings. The conditions of these buildings vary, often depending on their age, and the district believes that all are safe for reopening. But surely, we can all agree that at least some of the buildings are safe. And so let's find common ground to prioritize the reopening of these buildings so that children can return as soon as possible. Finally, for our returning families, we want them to come to school and see for themselves the work that has been done to ensure the safety of your children. Just like we did with council, and we hosted the tours for council members, we will host open houses that comply with their health and safety protocols at each and every school we seek to reopen, where we will detail the steps we've taken and address questions and concerns. I know that all of us recognize the importance of reopening schools, and I believe all sides have the best interests of our children at heart. I just submit as I close, let's continue to work. Let's work together to resolve our differences, and let's all make this happen. So, Madam Chair, that concludes my remarks and available for questions that any council members may have.
Thank you very much, Dr. Hite, and we do appreciate a lot of the work that we understand has been put in. This week has seen a number of very fast-moving developments, everything from the announcement around the vaccine access to the new testing regimen to, actually very new news about the contact tracing. I'd like to walk through some of these components about the things that you mentioned in your testimony regarding safe reopening and to confirm some key details, because I do think that there are broad areas. And I think what we are seeing a lot in our concerns around it have been around how they actually get implemented, not from 440, but, from every street block corner and by, everyone from the principals to your school nurses to school staff. But before we started, I did want to ask you to speak a little bit to this issue of public trust. We talked a little bit about the national backdrop, but there is also a local backdrop to many of the concerns that families have raised. And I want to say that, when we did the survey of many different parents and staff, the repeated question that was, kind of lingering in the back of all these detailed, pushing and questioning is the consistent articulation of a deep-seated lack of trust that the district has not made itself immediately available to ordinary families. Who do people talk to about questions about plans and safety protocols if the principal themselves cannot answer them? Is there a centralized place, a hotline to answer some of these questions, and can there be? So if we could just start a little bit around, the public trust and acknowledgement that this is an area that we need to overcome, even as we kind of nail down all the specifics on the CDC guidelines, the plans, and the science and medicine of it all.
Yeah, thank you for that question, Councilwoman Gim. And I could not agree more. I do think that that's an issue that we have struggled with as a school district since we have been out. And a lot of things have changed, in some cases very quickly. Some of the information hasn't always been consistent, especially with the previous administration. And so things were changing very rapidly, and we were trying to get information out as best we could. But we also know that we were dealing with a dynamic that's been very different for the district. And I say that because we know that the best way to communicate with families is directly through schools and teachers, particularly when children are with teachers. And that's how we get the best information out, right? And so if the past 11 months have made this difficult as we operate in a digital world. And so what we have tried to do was to construct those things that would normally be sent home by either the teacher or through the school, that we've been trying to do that centrally, and trying to do that across 227 buildings then becomes extremely, it's been difficult. But we've done a couple of things. And I think one thing that's really important is that we have a hotline, and I want to once again talk about that hotline, because the hotline was used a lot at the beginning, not so much here more recently. And so the hotline is available in English and 9 other languages, but parents can call the hotline Monday through Friday, and the number is 215-400-5300. And as I indicated, there also, we have separate hotlines in 9 other languages as well. In addition, we have places on our website where individuals can get concerns. It's called concern resolution, and that is the place on our website. And I can provide all of that information to all of the council members as well as to the public. But we asked individuals to start with their school community. We've been trying to do things that push it.
Stand over by the heater.
We've been trying to do things that push information out differently, in terms of trying to use platforms that families and parents had indicated that they use, trying to use more social media, created a Facebook Live session that is broadcast and watched by, on average, about 16,000 individuals. Tried to go on the radio, and then sending information out to families, and once again, in multiple languages. But I will also add, the difficulty with this has been, we are trying at the district to communicate to all of our communities through like one process that then doesn't always take into context the best way to communicate within certain communities. And so we're going to continue to do that work. It's one reason why we're doing the open houses, so that individuals can go into schools and see for themselves. But there's so much information on that website about the reopening plans that I think it has now become overwhelming. And we have to begin paring that down so that individuals have the questions that they need answered, responded to.
And has that hotline been advertised before? Is this new?
No, it has. It has. And so we do have that hotline, and we also have a counseling hotline as well, where individuals can call to have access to behavioral health services or professional counseling. And that is a different hotline that is run in partnership with the Center for Grieving Children, and that is 1-833-PHL-HOPE. And that's a hotline for counseling services as well.
And when did the COVID hotline launch?
We started that early on in the process. I don't know exactly when, but that was one of the first things that we started, simply because we were getting questions. And then we added the languages to that hotline, because we heard from various communities that it needed to be supportive of the languages, the primary languages that were spoken.
And if you could you give that number once again? And as you do, just let us know again, are people able to get an answer? Who are they talking to, or are they leaving a message?
In some cases, they are talking to individuals. It depends on what we're dealing with at the time. I know when we were dealing with technology and we were dealing with the EBT cards, they were getting a lot of calls, and those calls then people were having to leave messages, and then we were having to respond to individuals. Sometimes we were more responsive than not in some cases, and in other cases we're not as responsive as we probably could have been. But individuals can leave messages or talk if someone answers the line. And if not, we also have places for individuals to write in, or they could email us on several websites. In addition, we have continued the Family Academy courses and training so that parents can actually attend live workshops. And those live workshops are designed to help them with digital learning, to answer questions, and to support their student success. And that's off of our Family and Community Engagement website at philasd.org/face/FACT. That hotline again is 215-400-5300.
And, you know, we are talking very specifically about COVID safety. And so the individuals who are on the other line can actually answer some of the questions, because I know some of the questions that we received are pretty complicated. And, you know, it speaks to the testament of the importance of having, support for schools at the school level. Whether there have been, even school-based town halls or discussion groups that maybe you've had to talk with parents about school reopening, school by school, communities by communities, whether it's you specifically or whether it's others. But it seems like a lot of people need support and they're not getting responses back. I know, like, for example, for us, we've tried to work with the district for weeks to get some answers to questions such as, like, which schools don't actually have the mechanical ventilation system. So we're still waiting for that. And I'm trying to understand, like, as families have all these questions, are they actually getting the responses back?
Yeah, so the hotline launched in April, to answer your original question, so was able to get that. And then it is individuals are referred to people who have greater information about their topic. So if it's a ventilation question, it goes to our Office of Environmental, as an example. And the other thing that we have done in this space, Councilwoman, is we've actually created what we call a playbook, and a playbook for all administrators that has a lot of this information, almost to a technical level. And we sent that to all principals so that they could also have a lot of the information that was earlier on being referred to someone else. And so that playbook, something that we devised for principals, and principals actually helped us develop the book. And it's really about questions that principals were being asked about, things like, how would children eat lunch? What would a schedule look like? I mean, how do children enter and exit the building? And so those are some questions that we were getting on the hotline that could be answered by principals. And so we were able to get that information to principals as well.
Yeah. Well, I know that in the engagement that we have around public trust, they're just, as I said, COVID is a terrifying situation that's happened to a lot of communities and families. Many of the communities and families who've been most ravaged have also been largely left out of much of the care. They're often the last to be tested. They have not been well represented in the vaccinations that have already unrolled, and we're laboring as a city to reach out to them. So for us, a lot about the public trust with the district is the back and forth. I know a lot of time is spent on, detailing everything out, putting everything onto websites. But what we find that, especially with health issues and with concerns that families have about their children, those things are very fluid. They don't respond naturally to a Q&A that's been printed out, from X number of weeks ago. And what families need and want is this engagement. And I would argue also for our school staff. So I know that there's much to be discussed here, but I think what we are pressing for is an ability for this back and forth to get questions answered from the district, and what real plan, can we have to ensure that there's both a place where those questions can be asked and then a means for them to be answered. I know we've struggled a little bit as a council body to get some of our questions answered.
Yeah, I mean, and one thing that's been very helpful is the work that we've done with the Education Committee. Then it's a lot of the structures that we have now evolved have been from recommendations that we were getting from you and your colleagues who were hearing from their constituencies. And so those were recommendations that were helpful, and we were able to put those in place. And so I think the more we can do that in terms of trying to be responsive in a situation where everybody is remote, the better. I mean, and as we hear of these things, we can do more and more of these. We did have town halls. We had town halls very early on, and we have one each month now with principals. And then we have one that we have invited staff to, and then we have different town halls for families, both at the school level and at the district level. And we've had those, including staff like Dr. Rubin has been on town halls, and other staff from the medical community or the health department. And then we could then respond to questions that individuals had about things that they were either hearing or concerned about in their buildings.
Yeah, I mean, I know the district has done some. I do hope that as we move forward again, that we can reemphasize and rededicate just the outreach, I think, is so key here. And again, that hotline is 215-400-5300. Is that right?
That's correct.
Okay. So I had a few more questions, on the vaccines issues. We're really glad to see the vaccinations come together, and they will begin next week. And I know that this is an important element for any reopening plan. At the end of the day, it will be probably the one thing that assures people significantly that once a majority of our folks can get vaccinated, I think, we'll have to deal with the school issues piece by piece. But could you explain a little bit more detail? How long do you think it will take for the majority of your K-2 staff to get vaccinated? How much is it being allocated weekly? And can you confirm that all school-based staff will be included? I think you said this in your testimony, but you're starting with the staff in the building. So, we're talking very specifically about food service workers and building maintenance workers, as well as teachers, principals, and paraprofessionals and other staff.
Yes, I mean, I think that's an important point. And all staff, starting with individuals who have been in buildings and individuals who would be returning to support the pre-K through second grade students, would be the first batch of individuals. And that number is about 10,000 individuals that we would need vaccines for. And that's the first group. Madam Chairwoman, this is it would be based on the vaccine supply that is made available to the district. And we'll start at a site that CHOP is hosting, and then it will expand to school sites, both school sites in the city of Philadelphia, school district buildings, as well as other educational institutions. I think one is a Archdiocesan school, and another is in the Northeast. And then I think we also have one of the private schools would be hosting it as well. And educators would be able to go to any of these sites to be vaccinated. But our group will start with all individuals who are supporting children and those individuals who've already been in schools to date.
So that's 10,000 overall across K-2. How many do you expect to start with are being allocated for starting next week? Do you know the number?
I don't know the answer to that, right? So I don't know what the supply would look like. And we sent out notices that they would be contacted to receive appointments to the first group of 10,000. So of that 10,000, that's the group that then CHOP would use to contact to begin making the appointments.
We'll follow up with you on that as it continues, but I think most of us feel like that's an important amount of news. So we don't know how long it may take for 10,000.
We do not know, and it will be based on the supply.
Mm-hmm. So with regard to testing, again, I think it's so important to hear, because of the CDC guidelines, testing and contact tracing have been laid out pretty clearly as important safety measures for school reopening. Experts have identified the importance of widespread surveillance testing as the key to safe reopening. And yet there are still lots of questions on the school level, again, about how this gets executed. So could you provide some specific details about the planned frequency? On the district's website, it looks, for example, like there's an initial testing that's mandatory, but then it's not clear after that what kind of testing will occur. And then if you could talk about maybe some of the children that Dr. Rubin described as high risk and how you are identifying them.
Great, thank you. And if you don't mind, Councilwoman, I'm going to ask Larissa Shambo to respond to this question, as she is the person that is heading up the testing as well as the vaccine the work that is happening here in the school district. Larissa?
Good afternoon. Larissa Shambo, the Chief Talent Officer for the district. Councilwoman, to answer your question about testing, it is our goal that when students return to buildings, that all staff in buildings will be tested once a week. So that will be mandatory in order for you to be on site, and that is all staff, not just teachers, but anyone who would be working in our buildings with students. And our bus garages as well, so that you would have people come on site to the location so that they don't have to travel to be able to be tested once per week. We are also going to be setting up sites, I think there's 5 sites that will be opening around the city for symptomatic testing, because we assume staff will not be going into buildings when they have symptoms based on our protocols. And so we want to make sure that there's also access for employees for voluntary symptomatic testing as well.
So that's helpful. Do you know how many children are going to be tested and how frequently?
So as I oversee staff testing, I'm happy to give you a high level overview, but would definitely cede to others who are working on the student testing piece. I believe there would be 20% of students that are tested every week. So while it's every staff person every week, it would be about 20% of students that would be tested using the same rapid response test every week.
And do you have an identification or how you're looking at children who have been, as Dr. Rubin said, high risk?
So I don't think I'm the best person to answer that question. So there, I see Karen Lynch has joined, so I'll tag team it with her.
Thanks so much. So taking Dr. Rubin's advice and the advice, Councilwoman, that came from CHOP, we are looking at those students that might have difficulty with, it's a nasal swab. It's the front of the nasal cavity. So it's not a very, very difficult test. But for those children that are not able to wear a mask, those children that are not able to socially distance, those children who have perhaps other difficulties would be those children that David Rubin identified for that category. We also recognize that there are going to be some children who, because of physical difficulties, disabilities, and or medical or psychological disabilities, might not be able to be tested. So there's also an opportunity for an exemption. It's a model that other jurisdictions have implemented. It's not just one that will be used in Philadelphia. And so it's been tested in other locations. The model has.
So is it 20% of all kids every week plus the high-risk kids, or is it only the high-risk kids that you're talking about?
It's the high-risk kids, but it's also 20% of the students that are in the school.
Okay.
And it's right, will be tested. But that's not every week. The frequency is not every week. Every week, a group of 20% will be tested.
Okay. Again, I think this importance of the asymptomatic surveillance testing, doing it as widely and frequently as possible, it seems like this is very clearly what the CDC is saying as being important. And especially, again, there is no timeline for the vaccination of teachers. So the testing, the surveillance is going to be even more key, but it is good to hear that the testing announcement is being made. We just would love to, if you could get back to us with, as we roll out on this, just how this is going and some clarity for families, I think is really important right now.
Well, I can share with you just as an indication, we rolled it out in our regional centers. Parents brought their children to the regional centers for assessment for special education services. And our nurses at that location did the adults in the building as well as the staff adults in the building as well as the students. And it rolled out extremely well. That gave us an opportunity to really test to see how children would respond. Again, these are children who were coming with an appointment, with a purpose, and parents were really, really grateful for the opportunity to have their child tested. We were able to see which children would react in which ways, and staff were pretty grateful for the opportunity as well.
Yeah, thank you. We've had a lot of questions about this. And my last question is around contact tracing for this round. Again, I think the announcement that the school district will be working with the city on contact tracing is a positive step. I think what we're trying to understand on the council, and knowing that the city itself has only limited ability to actually do a significant amount of contact tracing, is what specific details you can share about your partnership with the city on the contact tracing aspect of this.
Well, I can share with you that the city has the abilities that go beyond ours. They capture the information. They know who has been in contact with whom. They're keeping a database there. And so when we give them the information, we might have one person, that person may have contacted lots of other people, and through their database, they're able to see what kind of contact has taken place. And so from the very beginning, I would say since last January, February this time, we've been highly reliant on the health department here in Philadelphia to do all contact tracing.
Mm-hmm. And then just for clarity, are you committing to contact tracing all positive test results with the city, and you'll be able, it's your understanding that somebody from the district will actually be identifying and then referring it over to the city? Is that how it works?
For the testing, that's how it works, but that's how it works in general. We give them whatever it is that we find. The way that the testing has been set up is that we add the information to a database that's been provided by CHOP, and that information is also given to the health department. So they have that.
And I would also add that I think per what Karen was saying is that we obviously have had staff. We have probably about 3,000 staff members working in buildings right now. And there are individuals who do test positive after working in our buildings. And so we have an established protocol that we've been using with PDPH, but also a key element also of sharing that information back with the school community, notifying the staff if there is a positive test case, and following that same protocol for at least about 8 months now.
Okay, so when there's a positive test found within a school community, the school community is notified?
Correct. Both the entire school community is notified by the school leader, and then individuals who must quarantine are also notified separately that they must either quarantine or isolate.
Okay. I know that there's just been a lot of confusion about that because there's been complaints from school communities that actually they don't know when there's a positive case identified. I do want to note, and I think that this is for our council to kind of go back and double check on, is that when, we have seen a significant decline in our transmission rates for sure. But when the transmission rates were very high within the city and there was a positive test case, it didn't seem that the city was able to actually do contact tracing. So somehow, I don't know if the change allows us to do more contact tracing. Oftentimes people were alerted that they weren't able to contact trace. And so, they were urged to, I don't know. But we've struggled around this. So I do hope that as we kind of lay out this, that the district will push the city for more clarity on plans. I think we will ask more questions of our city health department about the contact tracing, again, because it's laid out in the CDC guidelines. I think it's an important area for us to continue to push on. I want to give a chance for my colleagues to ask some questions. I see that Councilmember Brooks and Gautier have questions, and so they'll be first up. So Councilmember Brooks.
Thank you so much, Madam Chair. I have a few questions. The first question is, considering that Dr. Rubin just testified that the most effective intervention to prevent this is wearing a mask and practicing social distancing, can you speak to how the district plans to overcome the challenges of having younger children abide by mask mandates and social distancing recommendations. And I'm thinking particularly about the current plan to reopen pre-K to second grade, schools first, and what strategies and protocols will the district put in place? Because you mentioned it generally in your testimony, but do you have any specifics on what that would look like?
Yes, Councilwoman Brooks. And so one of the things that we have done is first, we're supplying all masks for many children. We have lots of PPE for young people. And what we have found in looking at the daycares that have been open, the early childhood centers, that with few exceptions, the children are actually very good with maintaining or keeping their mask on. I know some schools are already beginning to ask children to practice wearing masks at home while they are at home and in a virtual environment as we prepare for children to return. And there will be mask breaks. And ensuring that children are no closer than 6 feet, but then also having a mask break so that they have an opportunity to either eat their breakfast or their lunch, or just have a break from the mask. But these will all be controlled based on by the teachers in the classrooms and the administrators working in those schools.
Okay, thank you for that. And I also wanted to follow up on Councilmember Gim's question about restoring public trust. I know you mentioned about the hotlines for parents, but it's my understanding that, as Councilmember Gim mentioned, many people were frustrated by the problems with the hotlines and then just stopped calling. They were being told that they would get a call back, but never received a return call. And that was troubling. As we get towards something about restoring trust and building trust, it's important that, if the systems aren't working, we're continuing to break down those trusting environments that we're building. So with that in mind, can you explain how you're measuring the success of your public engagement efforts and changing the tactics as you receive feedback?
Yeah, so one of the things is that council helped us with some of the tactics that we have changed and how we get the information out. And so if we were only putting the information out in 2 or 3 languages at first, then we heard from members of council that there were other languages that we also needed to include. I think as we begin to get individuals back into schools, and so remember, like the hotlines were utilized when no one was in schools, right? So we had no staff members other than food service staff and some security passing out lunches and breakfasts, but we had no other individuals in schools. Now, we do have individuals in schools who can be a first line of communication for families. And that first line of communication could be school staff, but nonetheless, we still have the hotlines available if in fact individuals cannot get someone or reach someone at their school. How we're measuring that success is we are looking at the numbers of calls we're receiving, the numbers of individuals who call in back. We also measure and monitor the individuals who are either calling the assistant superintendent's offices or the central administration, indicating that they cannot get to a school and have not had a call back. We are tracking that information, and where we need to, we're having to provide more support and in some cases more direction for individuals to naturally be more responsive. But that's how we're trying to measure those things. I would also say Facebook Live and some of the other things that we have used were a direct result of, once again, members of council saying, you're using one mode of communication and all people are not receiving those messages. You have to meet people kind of where they're using these technologies or these resources. And so what we've tried to do is be nimble enough to push messages out in multiple ways so that regardless of how individuals are getting those messages, we're able to push them on those platforms.
You know what? I should have started off by saying I have noticed some of the changes that the district has made in the plan with council feedback. So I just want to give you that. I do see where, changes are being implemented. But of course, it was my job as a parent activist and still my job as a council person to just continue to push for the best possible situations that we can have for returning kids to school. Also around this public trust piece, I want to kind of speak to some of the phone calls that I received from Unite Here members and 32 BJ members that were already in buildings up to this date, and how they increased after the teachers' protest for not returning to school. And the number one factor was that there were cases where administrative staff were tested positive for COVID, and it was not shared with them until the administrative team was on quarantine. So if the frontline people, I'm talking about the janitorial staff, the food service workers, or the folks that are in the front line with parents right now, don't trust the current administration in that building, the parents aren't going to trust the administration in the building. And that's definitely problematic. And I've heard this from union members in several buildings, not one particular building, that someone tested positive for COVID, and they heard it through the grapevine that someone tested positive from COVID. It wasn't spread out to the whole school community. Now, that's the information that, like I said, continues to break down trust, because more than likely those are the same people who have kids that are in public schools around the city. And they also know the building conditions. So while we're rallying for building conditions and we're rallying for public trust, we have to make sure that all workers in the school district of Philadelphia trust the leadership. And I'm seeing breakdowns and receiving phone calls about that. And they actually, like I said, they intensified after last Monday when the teachers refused to go back in the building. And that's when they started really reaching out saying, the teachers are right, but we didn't have an option to stay home. And the administration have not told us about testing. So what's the procedure? You're saying that you guys are using contact tracing and contacting the city, but if the administration isn't sharing that information, I'm not talking about you, I'm talking about building principals aren't sharing them information with the whole team, it breaks down the whole community of trust in the school district and building. So while building public trust, we have to make sure that all workers in the school district of Philadelphia trust the leadership. And I have right now receiving phone calls.
Everybody, Stephanie Marrero, I believe you're not muted. Mute yourself, please. Thank you very much.
Thank you, Councilwoman Brooks, and you are right. I mean, so contact tracing only works as well as the communication that is existing around contact tracing, and that's one of the reasons it's so important to test and to have those tests of everyone in buildings, asymptomatic test of everyone in buildings, because with the contact tracing, it's only reliant on those individuals either reporting it to their health agency and the city health department, knowing and following that information. So that's another reason why the tests that the testing that we're going to do with staff on a weekly basis becomes so important. And it's not a percentage of tests, it's all staff who will be tested each week. I'll also add that this past weekend, we also had open houses or town halls, one with 32 BJ and the other one with 634. And on one, we had Dr. Susan Coffin, the infectious disease division of CHOP was at one. And then with the other meeting, it was with our staff, our operations staff, because there were questions just like the ones you just had, and it was important for us to get the information to those individuals. And if I may, Councilwoman, I also said something earlier I want to correct because I don't want to put misinformation out. Early on, we were talking about mask breaks for children, but the importance of masking now is such that we can no longer allow mask breaks. There will be breaks for children to eat, their food, but we would ensure that they are the appropriate distances apart, 6 feet, but there will not be mask breaks at schools.
Thank you, Dr. Hite. I have one more question. So I'm really happy to hear that you guys are doing open houses around school reopening. I'm sorry that I wasn't able to attend the ones that I signed up for because I was sick. Didn't want to take any chances until I knew what was wrong with me. So my apologies for not being able to be there. But I do have a few questions. Will there be a virtual option to those open houses? And will there be translation available for the communities that need it?
Yes, on the virtual option. Yes, there will be a virtual option available if families don't necessarily feel comfortable coming into the facilities. And I have to get the response to the translation question, but just like everything else we do, we actually have to provide translation services if in fact communities call for that. So I can get that information for you. I just don't know the exact answer to that at the moment.
All right. Thank you so much, Dr. Hite.
You're welcome.
Thank you so much, Councilmember Brooks. And Dr. Hite, can you just, confirm again that, as I think that Councilmember Brooks outlined, the importance of being able to reach out to the whole school community, whether or not they participate in the open house. Can you commit that school communities have a chance to ask, in a broader town hall, questions that they may have school by school as we structure out the a potential reopening?
Yeah, I can commit to individuals having the ability to contact either their school administrator or the building team that's at that school. And then many schools have already had town halls, but I would certainly be recommending town halls at the school level. But we also want to make sure that individuals are available to do the virtual tours. The open houses for schools to show individuals those classrooms. I'll also add back to Councilwoman Brooks's question. Yes, we will do translation. So I do have the answer to that question.
And then just one other quick follow-up to Councilmember Brooks. Could you clarify what type of masks are being offered to youth and whether those have been delivered to our schools? I know that Dr. Rubin mentioned that cloth masks or gaiters or face cloths are not recommended and mentioned the 3-ply medical. So could you clarify for us what type of masks are being provided?
Yes, I want to invite Ori Munson, Larissa, who could actually share what type of mask. Oh, I'm sorry. I will.
There are cloth youth masks that were distributed in all the schools, the K through 2, the schools that are scheduled to be opening.
How many they would have gotten?
We had there. I actually don't. I'll have to get back on exactly the numbers we did. I think we had a gross amount per group, and then we also, as we do with all of our PPE right now, in addition to for supply chain reasons, we actually have an internal warehouse storehouse so that we can quickly refill as needed. We also do have disposable masks in every single school that have been there since the fall. The classic medical disposable masks that were described. And again, it has been a kind of a constantly changing guideline. So one of as many pieces available, and we have continued as to procure additional types of specialty masks for anticipation for students with either learning disabilities or other issues, clear masks, things like that, so that we continue to adjust based on recommendations we're getting from principals, from school-based staff as they look at the supplies there and think of other creative ways. So it's we have a lot in stock in the schools and backed up, and then we're continually trying to adjust as either new recommendations come from health experts, CDC, et cetera, or again, what our folks on the ground in the schools are seeing and thinking they need so we can try to procure.
And are there the same masks for teachers as for students, or do teachers have N95s? What type of masks are available to teachers at this stage?
So we have, we committed to having 5 cloth masks for every teacher in every school. Those are the classic cloth masks for every teacher. There are more disposable masks than you can imagine you've ever seen in a room that are spread across the district at the moment in schools. We do have N95 masks for nurses and for special ed classrooms, as well as gowns and additional equipment for, again, those who would be testing children who may show symptoms, nurse situations, special ed situations. So a lot of that additional equipment, which was all outlined in our protocols back in the fall, and we've been fulfilling those needs. Again, I will say for those who were in the schools over the fall, the N95 masks did not go out until last week just to make sure we can maintain the supply and security of them. So they only went out to the schools last week, but they were based again on the number of nurses and special ed classrooms.
I'll have a few more, but I know that we have council members in queue. So I want to go to Councilmember Gautier. I also do want to ask our participants, the meeting chat is solely for council members. There will be time when you testify to be able to put questions on the record. And we will make sure to strive to get them answered by the School District of Philadelphia. So if you could please reserve any questions off this chat and save them for when you have an opportunity to testify. So Councilmember Gautier and then Councilmember Thomas.
Thank you, Madam Chair. Good afternoon, Dr. Hite.
Good afternoon.
My questions are around the new CDC guidelines and how our plan is complying with them. The CDC recommends that school reopening planning should include, at a minimum, teachers, student representatives, and parent representatives. I appreciate you being here today and allowing for this, forum for the public to participate, and the forum that the district's regular meetings provides, as well as the open houses that you're planning. But what actual authority will students, teachers, principals, and parents have in the school reopening planning? Will there be a committee, for instance, where people can have, an actual say in what happens or whether a school opens or remains closed?
Yeah, so we haven't thought about having a district-wide committee of individuals to come back to school. We've been working more closely now with Federation, the Philadelphia Federation of Teachers, to provide that information. We did do surveys early on in the process to get the type of schedules that would work best with individuals and the types of information that people needed to receive. We've also sent surveys out to staff members simply because of the number of staff members. We wanted individuals to be involved in that process. And so we took all of that into account when developing our plans. And naturally, we consider all of that when we either move forward with those plans or do not. But we do feel like, based on the recommendations of the CDC, that we are meeting all of those guidelines, but we don't have a wholesale committee of individuals that you talked about, that you just described, that are decisions about what buildings open or which ones close.
I think, Councilmember Kim and Councilmember Brooks talked with you a lot about engagement and, ways of letting people know that their questions are heard and answered. I think as we go forward with this plan, we do have to have some sort feedback loop that allows people to know that their input was considered and reflected and matters. Moving on. According to that same CDC guidance, school reopening should largely consider the level of community transmission. At what community COVID positivity rate would you say first?
So they're relying on the
Have those figures remained constant? Is that being adjusted?
Yeah, so I think that the newest guidance, the figures, the case counts are well within the percentages that are recommended by the CDC. I do think for older children, the case counts presents a different challenge for us, because I do think because those percentages are much lower, then I do think that us thinking about bringing back high schoolers right now would be problematic given the case counts recommendations from the CDC.
But do we have in our mind, or do we have as a city a point at which we deem it unsafe to keep schools open, and what does that look like?
Yeah, so our recommendations are based on both the city PDPH or the state, and they actually make those determinations for us. And so whatever the case counts are, then that would mean that we would either be closing the school, closing the classroom, closing a grade level, quarantining for a while before those individuals are safe to return. But all of that's guided by the advice of the Philadelphia Health Department or the Pennsylvania Health Secretary.
Okay. And will we be making that information easily accessible and public for our parent and school community?
Yes, and we talked about thresholds at schools that would trigger what the recommendations from the health department would be, and we would have all of those things made readily available. Yes.
Okay. One of our main plans for ventilation in schools without working modern ventilation systems is opening windows, as I understand it, and utilizing fans to ventilate the rooms. However, the CDC seems to say that you should not open windows if doing so poses a health risk to students with asthma. Being as though we have so many children here who have asthma, what steps are we taking to ensure that the open windows and fans don't pose a health risk to those children?
That's a great question, Councilwoman, and I'm going to ask my operations chief, Mr. Reginald McNeil, to come on and respond to that. Reggie, are you on? He may be at another meeting, Councilwoman. So what I'll do is I'll get a response to you for that. You are right that the CDC indicates that opening a window or door or utilizing a fan when it's safe to do so, and to your point, asthma triggers. We know that there are asthma triggers for children, particularly many of the children that we serve here in the district. And we have building engineers who'll be constantly monitoring the air in the room. But I would want to get you a more specific answer or response to that from Mr. McNeil.
Thank you so much. Those are my questions, Madam Chair. Thank you.
Thank you so much, Councilmember Gautier.
And Madam Chair, if I may, and because I think Councilwoman Brooks made a really important point, and I wanted to ensure that on the record we had a way to provide individuals who suspect or have concerns about potential positive cases. We actually have an email address that those individuals can use. And it is called coronavirusreport@philasd.org. Coronavirusreport philasd.org. And that's for anyone who may have concerns about potential positive cases. And they can do that where they can do that via email. And then we research those cases. And so once again, thank you for that question. I think it was important to get that information back to you, Councilwoman Brooks.
Thank you, Dr. Hite.
Yes.
Thank you. Councilmember Thomas and then Councilmember Gilmore-Richardson.
Good afternoon, everybody. Good afternoon, Dr. Hite. Thank you for taking the time to be a part of this conversation. Thank you also to you and your team for helping us get sports off the ground. We've been going at it for a couple of weeks. It's been pieced together to the best of our ability. But either way, better than nothing. And I think it's an important prevention-based initiative for our children. I want to jump back into some of the things Councilmember Brooks talked about, as well as a few other council members as it relates to the trust side. I think that is a very, very important factor. And I think that really starts with transparency. And so one of the ways that transparency was discussed in the past, and honestly, I think today's hearing hopefully will help with some of the trust as well, too. I know we have a lot of different stakeholders listening now. One of the things that was discussed in the midst of our meetings and dialogues was this idea of school tours. Can you talk to us about the school tours? I know I've been able to go on 2 or 3. I've been able to visit, I think, maybe 3 schools. I know that there was a time when we talked about having teachers, staff, as well as parents and anyone else who wanted access to go on tours. Is that still an option? Is that still going to take place? And what is the plan for that?
It is. And so as one of the things that we have communicated out, Councilmember Thomas, is that we're calling it school readiness. And it is individuals can do it either in person or virtually. And they're tours requested by parents, from parents who have opted for hybrid learning. It's by appointment only, naturally, because we have to control the amount of traffic that is in and around schools. And one of the things that we want to show as a part of those tours are things that you saw when you were out at the schools that you visited. And the purpose is to showcase school readiness and a safe return to in-person learning. And so those will be the tours that will be taking place.
And these opportunities are available for parents as well as staff and anybody else who feels like they need to go on a tour prior to going into buildings?
Yeah, these tours specifically are for individuals who had signed to return their children to schools in the hybrid model. We want to hit those individuals first, and then we could do broader tours for everyone else. But these are for the individuals who signed up, the 9,000 children who would be returning to schools in the pre-K through 2nd grade.
Okay, so earlier, Councilmember Brooks talked a little bit about notifying staff when a case took place and there being some miscommunications. What happens, and I know this is in your plan, but I think it's important to be communicated to the public. What happens and what's the protocol that's going to be in place if a child were to be exposed to somebody who tested positive, whether that be a teacher or another student? Like what is the plan to notify parents and families? We already know that we have a number of issues as far as communication across the board. So how can we, what do we have in place there?
Yeah, so we would notify all of the individuals in that school community. And so that would be the notification.
So it would be the teachers
who are attending that school or who work in that school.
It would be the teachers that's responsible, or would it be the
No. It would be communication that goes out from the school to all of those families.
Okay, so it's not the teachers, but it would be the administration at the school.
Correct.
Okay.
Yes.
Okay, understand. Thank you.
And Councilman Thomas, that would be a form letter that actually comes from the district that is guided by, like, the health department, that tells them that gives recommendations on what individuals should do, how long they should quarantine, what they should look for in terms of symptoms. It would likely include testing if in fact those individuals have not been tested already.
Okay. And do you worry about like a gap in time as it relates to that communication coming from the district, or do you feel like the district will be able to efficiently communicate that information to parents once the confirmed case has been notified?
Yeah, we've had some experience with this, councilman, because we have we've been transporting some students to some of the archdiocese schools. There've been case counts there, and we've had to notify individuals who were on those modes on the school buses with individual in that grade or in that classroom. These pieces of communication go out almost immediately. So they would go out as soon as we would know, they would go out, and then naturally it would start a process for contact tracing and all of those things. But if in fact we have the ability to test, we could test. But if not, we would make sure that families are aware of what happened. And if it reaches a certain threshold, then either the classroom would be quarantined or put on quarantine for a number of days, the school, the grade level, the hallway. It all depends on how many individuals had come into contact,
right,
or could have come into contact.
Right. I think my concern around that is just I worry about the sense of urgency as far as like how effective the district will be able to communicate to parents and families or the administration. I don't know. I think that maybe I guess a recommendation would be to have a conversation with teachers to see if we can have them involved in some way. I'm just putting my administrator hat on. I in a former lifetime, I was a dean and an administrator in a school. And so I don't know, I just worry about the fact that people hearing that information from someone else, like, a parent telling another parent before the parent hears from the district, right? So like, oh man, that's crazy. It's 7:00 and I'm hearing from such and such mom, but I haven't heard it from anybody from the district side or anything like that. Maybe just because they were planning to send the information the next day at 9 a.m. And sometimes that's just that little bit right there is enough to kind of frustrate people. So I think, I don't know, maybe it's the old school in me that just want a phone call or something like that to kind of happen right away. Just a recommendation, I think, again, just in the spirit of trust and transparency. But kind of keeping that, I guess, former dean and disciplinarian hat on. I'm thinking about, and I know we're only talking about K through 2, but again, as a former dean, that was actually the hardest group of people for me to ever be the dean of, right? Like, so coming up with creative consequences for a kindergarten or a first grader actually gave me gray hairs before it should. And so just kind of putting that hat on, what are we doing as it relates to disciplinary action for children who just, don't want to wear a mask or kind of look at it as a prank? Because that's a fine line that we're going to have to dance right there, because they might not understand the seriousness of COVID. They come from a household where, unfortunately, they've brought into some of the misinformation that's been presented out there. So maybe, I know we talked about, getting them accustomed to wearing masks and things like that. But just, again, in the spirit of trust, and transparency, and thinking about making folks feel comfortable returning to the building. What things are in place to kind of address that scenario right there, where you're dealing with a delicate child and them not necessarily following the COVID restrictions and guidelines? Because we've had some trouble in the sports world with some of the student athletes, but again, we have that kind of carrot that we could dangle over them, right? Because they actually want to be there and they want to be participating. So we can see them that corrective action as it relates to behavior. So I'm curious to hear from you about that, and I'm sure others are too.
Yeah, no, I think that's the right question, Councilman Thomas. And I think that, as you said, in the sports world, you had that experience, but you can dangle something over them. One of the things that Ori talked about earlier, Ori Munson, a chief financial officer, talked about earlier, was the number of masks that we provide, and then those other layers of support that individuals could utilize if a child is not physically able to wear a mask. If we know children are going to lose it, we know that they're going to take them off at times, and then we will all be there to remind young people to actually put them back on. And I will once again add that it's one layer of safety. The other layer is to ensure that they are 6 feet apart. The other layer is to ensure that If in fact they are in a smaller group, that they're plexiglass, that is also there for the purpose of that small group. So there are multiple layers of safety. But I do think the challenge is real. I was at a school today, and the principal indicated that he doesn't see it as a problem, at least in his community, because many of those young people are going to daycare centers now. And at the daycare centers, they're required to mask. And that while they're not in schools, they're at these other centers or access centers, and they are already practicing the mask wearing at those centers as well. But it's not going to be lots of consequences. But if children continue to refuse, then they may lose their ability to attend in the hybrid model, and they may have to go back to remote if in fact it's impossible to get a child to keep his or her mask on. I'd also add that another challenge that's emerging are families who are at least emailing some district staff right now complaining about the requirement for children to wear masks. And so we also have that we're going to be navigating through as well. And it's important to indicate that choice is still available for those families. And if they don't choose to have children wear masks all day, then perhaps the remote, perhaps the hybrid model is not the best model for them.
Last question. Even as we're sitting on this call, the gun violence issue has been a huge problem in the city of Philadelphia. I'm pretty sure all of us are aware of it. And as representatives of government in some capacity or another, I think that we all should own some level of responsibility. Even sitting here right now, we just found out of an unfortunate mass shooting today where 7 people were shot. So, of course, first and foremost, my thoughts and prayers go out to those victims and the families there. But Dr. Hite, thinking about your role and your position in all this, and as we have conversations about returning to school, and I'll go back to my dean hat and maybe even wear my coaching hat a little bit as well, too. The mental health component is going to be a significant issue.
Yeah.
And we've had issues as long before I've got here. I know other council members have fought for this issue long before I got here as it relates to counselors and mental health support in schools. I'm wondering what plan and what do you have in place as it relates to mental health support for our young people? They're dealing with a ton of trauma, not just with the gun violence issue, but outside of the gun violence issue, just the conditions that the pandemic have only magnified. So what is the plan around mental health support for our children, even as they're not currently in buildings, as they're working remotely? How can we support? What can be done, and where can we step up even more as it relates to supporting them in this time of need?
Thank you for that question, Councilman Thomas. And one thing that we expanded, understanding going into this school year, we expanded the behavioral health services that are now available at all schools, not just at certain community schools or schools that were identified with resources that were coming from CVH, but we wanted to expand those resources into all schools. We're also working with the Department of Children and Families to ensure that we're able to provide the needed wraparound services for young people, either who have been exposed to the types of violence that you're talking about, that you described, or the trauma associated with that, particularly in school communities. There's a tremendous amount of trauma that's associated with the loss of a peer, or the awareness that another young person at that school has been impacted. To give more details on what we are more broadly doing as a district, I'm going to invite back to the conversation Karen Lynch, whose team has done a good bit of work, even serving on the city's task force around gun violence, so that she could also add some other strategies that as a school district we've been utilizing to address the needs of our young people. Karen?
Thank you, Dr. Hite. So in addition to those items that you have mentioned, I would say that this is an extremely important topic for us, and that's why we have been working with the city's anti-gun task force. We've looked at the data. We have identified locations where there is greater concern, but most importantly, from the perspective of the school district of Philadelphia, we are increasing the numbers of caseworkers that we have that can actually do supportive work with students. We are looking at the data to show what is the likelihood, the age, the grade, what type of school did they attend. So it's given us an opportunity to know where we can and should place greater emphasis on ensuring that students remain in school, that they are well equipped to deal with their issues and their concerns. And for that reason, that's why we do such things as we've got restorative practice in so many of our schools. We have PBIS, we have youth court, and these frameworks are all intended to help youth get about the process and learn the process of building relationships, getting to know one another, resolving their issues and resolving the conflicts that they have. We're finding that it has definitely reduced the incidence of fighting in our schools, of incidents of violence in our schools. And you know that our discipline numbers are extremely low because people are looking for alternatives.
Okay, well, I know we don't have, we're running low on time. Other people have questions. So I'll stop right there. I think that'll probably be one of the things that we should probably discuss in ongoing conversation, as well as some of the preventive initiatives we should do this summer, and looking at the learning gap that we know exists as well, too. I think that entire package right there is a huge conversation we have to have. Thank you, Madam Chair. I appreciate the opportunity.
Councilman, if I could, I want to answer one of the questions that was asked earlier that Dr. Hite said that he would get back to you on, if I'm able to do that.
I defer to the chair.
Madam Chair, may I?
Sure.
Okay, great. So the question was asked about how will parents find out about the results of testing? And I think the council member made reference to a quick response and how will parents find out quickly. It is the school nurse that is going to conduct that test. The school nurse will enter that information into our database system. Our parents will give us consents, and the consents will indicate their phone number, their texting, their email address. That information will be pushed out to the parent as a result of the test. So they'll get information on whether or not that their child, number one, was tested on that particular day, and the results of the test, either negative or positive. So I hope that answers.
So to clarify, Ms. Lynch, you said that the school nurse will administer the rapid test.
Yes.
Is that correct?
Yes.
And then will be responsible for contacting the family should there be a positive notification?
They will contact the school nurse, has been trained by CHOP. CHOP gave us all of the protocols, so our school nurses have been trained. They will conduct the symptomatic and asymptomatic testing as well on students. If the test, they will notify parents that on that particular day their child was tested. And if the test is negative or positive, that result will be given to the parent. So the parent will find out either way.
So, and then will they also do the staff testing as well? The school nurse? Will the school nurse also do the staff testing?
No, I'm sorry. They won't do staff testing at all. The staff testing will be done by another entity. Our school nurses are student support services, and so that's the work that they are going to engage with.
Okay. So we have two different entities doing testing within a school. The school nurse will handle students, and then an entity that is there regularly, or is there at least once a week for staff testing? Is that correct?
Yes.
Okay. And that entity will then inform the principal if there's a positive test case among staff?
And I believe what Larissa Shambo said earlier, and she should probably answer that question directly because she's staff and I'm students. And here she is.
Good afternoon again. Yes, so they won't inform the principal, they will inform our central point first, because that point of contact has to go directly to the Philadelphia Department of Public Health. So we need to funnel everything through our Office of Employee Health. We then have a protocol to feed that information back immediately to the principal, as well as just to commence the contact tracing.
And immediately means same day, immediately?
Oh, yeah.
Okay.
This, you receive the communication immediately. We would within minutes be contacting the PDPH, as well as then returning back to the principal to start that process of notification.
Okay. And then there will be clear protocols in place about who needs to quarantine, if anybody needs to quarantine. Is that correct? Or how will that, like, does somebody actually come in and advise the school at that point about who actually needs to quarantine?
So all of those are directed by the PDPH, and they set those guidelines, and there's a set of standard questions they ask about the amount of time people have been with, wearing masks, not wearing masks, within or less than 6 feet. There's sort of a standard set of questions that would then determine, if it's a building engineer who was potentially in his space and not interacting with other adults, it may be that someone tests positive, but nobody else needs to quarantine in that school. It could be that 15 people need to quarantine in that school. So really those questions would determine who does need to quarantine. There's a standard set of questions.
And who asks those questions? Is that the principal's responsibility?
It's basically gathered from the Office of Employee Health with the principal and or whoever else is working at the school site on this to be shared with the PDPH as they start their contact tracing.
So PDPH will make the recommendation on who actually has to quarantine?
Correct.
Okay. All right. So we have council members Squilla, O, and then council member Gilmore Richardson. I apologize. The committee members, and then we'll go to council member Gilmore Richardson. And just, with respect, I hope that folks who are watching today understand this is a complicated area. We're trying to ask a lot of questions and clarity. This is also, we understand with the district rapidly moving and evolving. We do have a lot of people testifying, so we just ask that we keep our questions pretty tight to the extent possible. So thank you. Councilmember Squilla.
Thank you, Madam Chair. I appreciate the time and opportunity for this hearing. Thank you, Dr. Hite, and thank you for always being able to answer our questions. It's so important, too, that not only during the hearing, but even when we send you emails or reach out, that you or your staff get back to us, and much appreciated. My question's on the line of knowing that the date has now been moved, I think, from the 22nd to March 1st. Is there a timeline when the third-party arbitrator will come back to give an idea on what they seem or deem safe at the schools?
Well, while we would want that to be as quickly as possible, we do not yet have a timeline for that, no.
All right. Is it possible that they could come back with information that may be sort of some schools that will not meet the criteria and other schools will?
I would imagine, Councilman, that could be possible, yes. But that's a subject of the mediation that's happening at the moment. And so we are awaiting both the timeline and the recommendations.
Okay, so at this point, the tentative date is March 1st, but waiting on the third-party arbitrator before a final decision can be made. Is that correct?
Well, we wanted to push back a week just to make sure that if before children return, that classes would then be ready to receive those children. We hope that whatever the timeline that the third-party mediation is occurring on is fast enough that it responds to any questions about first getting staff members back into buildings, and then the second part is students back into buildings. But we hope that all of that is done by then. But that's one doesn't depend on the other. We just pushed the date back in order to ensure that classrooms were ready.
Okay. Yeah. All right. Also, I just want to follow up on my colleague, Councilmember Thomas, is about the ability to have counselors available for the mental health and the challenges that a lot of the kids have been going through by not being at school. even though it's a hybrid type learning process and we'll have those counselors in there, are they counselors also available to the students that are at home?
Yes, the counselors are available to the students at home now. And so some young people are interacting with their counselors now, as well as some of the behavior health supports that are in schools, as well as the hotline that I talked about earlier with the 33 PHL Hope.
Yeah, because we've been hearing a lot of concerns from some of the parents and even other folks who just have how hard their kids are struggling through this process. And so I think that's something that we really need to concentrate on, whether it's a hybrid learning or virtual learning, to make sure that that's addressed. We appreciate the ongoing conversation, and we know there's a lot of questions to be asked. I want to thank you. A lot of our colleagues have asked questions that we had, and mainly about the ventilation that was answered earlier in the hearing. Do you see, once we get to a point where we can have safe openings, obviously there'll still be challenges along the way, and this will be an opportunity for us to work on some of the other school issues. Do you see the ability to still channel our maintenance to address a lot of the other concerns that are ongoing?
Absolutely, Councilman Squilla. These are buildings that need a lot of attention. And so, yes, is the answer to that question. We have to continue to do that work as well.
All right. Well, thank you for your time. And thank you, Madam Chair, for the opportunity. And other questions we'll send in writing. Much appreciated.
Thank you so much, Councilmember Squilla. Councilmember O.
And Madam Chair, before Councilman O goes, I know that the Deputy Mayor for Labor is also on and could respond probably much better to the mediation question if you so choose. So I know Rich Laser is on. If you wanted him to respond to the mediation question, he could.
Mr. Laser, are you able to answer that?
Or maybe not.
I can text him and see if he comes back on a little bit later. So, okay. All right. Councilmember O.
Thank you very much, Madam Chair. I'm going to leave my video off just for Wi-Fi purposes, Superintendent. Dr. Hite, mostly all my questions have been answered, but I just want to follow up on this question because this is a question that I get. Physical security, two issues are arising, and it seems to be a little bit kind of like there's not some agreement on this. School police. The reason I bring it up, first, as elementary schools begin to open, there's less staff. They're not there full time. The issue arises about the security of little children, when they're going to school, just to make sure the grounds, picking them up, the school itself is safe. And second of all, in light of what we have right now, which is increased homicide, gun violence, and appears to be beefs and grudges, revenge, that type of thing, which in a prior time in our city, we had a lot of gang wars, and they would find their ways outside and in the schools. I remember when we first put metal detectors, it was there were weapons in schools, there were teachers being knocked unconscious, thrown. There was a whole issue around that. I'm not sure where we are in there because I've heard different things. And so could you explain what the school is going to do, number one, when the elementary kids come back, and what is the plan of the school moving forward in terms of school police?
Thank you, Councilman O, for the question. And first and foremost, we actually are restructuring our Office of School Safety, and we no longer actually call those individuals school police officers anymore because they were never deputized officers, but instead we call them school safety officers to do a lot of what you just described, and it really is training those individuals how to resolve conflict, training individuals on efforts to maintain the safety of staff, in particular small children, and that safety, that a person in the building that's responsible for the safety of those individuals coming to and from schools. And so those individuals have been at all of the sites where we've been distributing meals, where we have been distributing technology. They will also be at every site that has pre-K through second grade students, so that we are able to provide the safety of staff and young people who would be returning. When more children come back, we will be very engaged in ensuring that we have as much information as possible. As you can only imagine, in some of these communities, particularly among our high schoolers and some middle schools, we probably have areas that are currently beefing with each other, and then those individuals will come together and see each other for the first time. So we are anticipating having to do lots of types of conflict resolution and opportunities for young people to express themselves in ways that are nonviolent when individuals get back into the routine of coming back to school. So that's our broader plan. And it's all of what you heard from Karen Lynch earlier with PBIS, youth court, restorative practices, conflict resolution, and really through a lens of having individuals talk about equity and the inequities that exist. And so we're in the process of training individuals to be able to do that. And those individuals will then become the mentors of young people. They will become the individuals that young people will be able to confide in when they're having these types of issues. And so that's our plan moving forward. But those individuals will be in schools to support the teachers and the students in the schools that would have pre-K through second graders in. And they're also at the regional centers.
Thank you so much, Dr. Hite. Councilmember, we have a Rich Laser who's on just right now for a moment.
I'm finished,
okay,
Chairwoman. Thank you.
Who can answer Councilmember Squilla's question. Councilmember Squilla, if you felt like you can ask your question, that would be great. If not, I can just ask it if he's still on.
Thank you, Madam Chair. Yes, Mr. Laser, I was just asking about the third-party mediator. If and when a timeline of when we think his decision will come or her decision will come down, and also if it's possible that the mediator can say all schools are safe to return, or there are some schools that are not safe at that time, and then decide what to do after that point.
Thank you. And Mr. Laser, if you could just identify yourself by name and then proceed.
Sure. This is Rich Laser, Deputy Mayor for Labor for the city. Good afternoon, everybody. Sorry I had to jump off. So Councilman Squilla, we have had very robust conversations with Dr. Peter Orris, who's the mediator that the city has chosen. We've been meeting with the district and their team and the PFT and their team to go over lists of concerns and just specific information that was asked from the PFT to go through schools. At this point, we're still going through that information. It is a large list, to make sure. And that's where we're at right now. I don't want to get into real specifics because I know there's data that's being, shuffled back and forth. The district has done an immense amount of work to put this information and has sent it over. And we're working with both sides with the mediator to try to go through and work together to go through the concerns of each school to make sure that everybody is on the same page and feels confident that people can return.
Okay, because the question came because of we saw the pushback of the potential start date of March 1st. Do we believe that is a fair timeline for the arbitrator to rule, or do you think it would need more time?
I'm hoping we can have a decision before then. Like I said, I think both sides are working diligently to get there. I don't want to say that I'm hoping that date is definitely doable. I know the district has chosen that date to push that back just to give parents some time. Because we don't want to, I know the district wanted to be courteous and didn't want to ask the, parents on Sunday and push it back so people can make other arrangements, whether it's keeping children in access centers or working with family members or other means for their children. But I'm hoping that date is possible. But again, we're going to diligently work with everybody to try to make that date possible. But I don't want to speak too much to it until we continue to go through the large amount of information that's been given.
All right, thank you very much. If we could provide that information to the chairs when you do get it, it would be grateful. So I appreciate your time and efforts. Thank you.
Thank you.
You're on mute, Council.
Mr. Laser, could you just clarify again, does the mediator have the power to determine whether the school reopening moves forward or not? Or is that within their scope of their scope of powers? I think that's a little bit of what Councilmember Scola was trying to understand. We're not sure what powers they have.
So the way the MOA reads is that we choose a mediator when there was disagreements with pieces of the MOA, and either party could invoke the mediation process. I think the mediator can make recommendations to whether they believe the schools are ready or not, or whether there are certain things that have to be done. They will make those recommendations, and from my knowledge, either side would, we would all live by the recommendations made by mediator. That's my understanding.
Okay. Thank you very much. Council member, thank you very much, Mr. Laser. Councilmember Gilmore Richard.
Thank you. Thank you so much, Madam Chair, for this latitude. As I'm not a member of the committee, but I had to be on this call, not only as a member of council, but as a mother of a young person in the district who's slated to return, who's in kindergarten, and also I have a 9th grader as well in the district. Thank you, Dr. Hite, and to your team for your testimony. And I know a number of the questions I had, have been previously addressed. But I really wanted to underscore the importance of communication in this process, of building trust in the process. That will be vitally important as we continue to move forward. But also thank you, too, for the commitment around the tours. And I know I talked about that when we toured the 2 schools, Nebinger and also the school in West Philadelphia, Hamilton. So thank you for your commitment to the tours for families and for teachers who opted in to return back to school. I wanted to just quickly ask a few questions and get a couple of questions on the record based on conversations that I've been having with teachers and administrators in the district who have, again, relative concern around the process. So I wanted to circle back to one of the questions one of my colleagues asked around who will be administering the test, the COVID tests in schools weekly. And I know, there was a differentiation made around, school nursing staff providing the testing to children, but there would be another separate entity testing teachers. Could you just go a little further into who will be responsible for that and more information around whether that's a contractor or what, the details around that will be?
Yes, as indicated by my colleagues, school nurses would be testing children, and they would be doing the tests for the children. We will be using another entity to test adults, and then I see Larissa Shambo on, a Chief Talent Officer, so I'll have her explain more about who those entities are and how we contracted with them.
Sure. Good afternoon again. We have 2 different entities who will be providing services to our schools to ensure that we have enough capacity to meet the needs of testing every employee once a week. One provider, Docs Health, was selected by the Philadelphia Department of Public Health for symptomatic testing, as well as we work with them for both symptomatic and asymptomatic testing. The other company is called Wellness Coaches, which was selected through work as a provider through our Independence Blue Cross provider network. And so both of those entities will be following the same process, and that they are working together on creating and finalizing the protocol so that it is the same process for employees, 2 different entities who would be providing that service.
Sure. So to quickly drill down, because I know our Madam Chair stated we don't have a lot of time, but to drill down on that, you said Docs Health and also wellness coaches, which was provided through the provider network that you have with IBX. So around those contracts, if you could just detail those contracts and what diversity or equity and inclusion, decision-making was included when you decided on those contracts? Meaning, are there any diverse organizations, MBE, WBE participation?
So I don't have that information readily available.
Okay, and let me tell you why I'm very concerned about that. Because we have to ensure that there is continued equity in this process and that we continue to address the public trust in the healthcare system, particularly for communities of color. And there's a certain level of cultural competency that's needed when you are dealing with individuals and giving them, testing and also, eventually vaccines. So I really want to drill down and get the information on the amount of those contracts and what minority participation will be included in those contracts, because we really, we have to stop this. Okay, we have to get to a point where, we are ensuring that we are supporting minority and women-owned businesses and all the decisions we make, and that is an important part of the decisions we make. So I just wanted to put that on the record. And really quickly, because I know we don't have a lot of time, I needed to get these questions on the record from my teachers who have been in contact with me. Another question was relative to the temperatures being very low in the winter time. So what other alternatives do we have for proper ventilation other than open windows and window fans? And then also there are a number of classrooms that have sinks in the classroom. So every classroom that has a sink that will be utilized, have we resolved all the issues with any, sinks that may have been out of service prior to COVID? Also, are paraprofessionals expected to teach in the hybrid setting if the teacher is not present? And lastly, and I just want to get this last question on the record, of the dollars that the University of Pennsylvania provided, how much of that will go to every school? Thank you so much, Madam Chair, and thank you, Dr. Hite. I had to get those questions on the record because in this role, I recognize we are accountable to the people that we serve, and I have to ask the questions they ask so that we can ensure we have answers on the record for them. And just as a parent and talking to our teachers and our other families, we all are very nervous about this. My baby girl, she's only 6 years old. She has not been out of the house since the start of this pandemic except a few times. So I'm also, very concerned, and you talked about the conflict resolution piece, because even in the city, when they talked about the uptick in the gun violence issues that we're seeing, they said a lot of that is around the shelter-in-place orders, and that there's been an uptick in domestic cases, meaning there's conflict in homes. Yeah. And there's no way that we can separate the conflict that we're seeing in the data from the police department from conflicts that students may be facing in their homes. So I really want to ensure that we can also talk about conflict resolution in a way that every student will be able to receive the skills to properly resolve conflict. And I don't mean the district has to be completely responsible for that, but I do think we need to figure out how we work together with other city entities to provide conflict resolution for every child in the district. I mean, it will be vitally important, particularly as they're growing in their social, emotional learning, but also returning to an in-person setting where they have to interact with other people, in a completely new and different way. So thank you, Madam Chair, for the latitude. And I just wanted to get all that on the record. And Dr. Hite, if you could address some of those things, that would be most helpful. But thank you all so much, for your continued work.
Absolutely.
Thank you, Councilwoman Gilmore Richardson. And I'll try to go the list just with the information I know. Some of these will have to get responses back to you. First and foremost, we'll get you the MBE for the testing entities. What they represent and those contracts. One, as you know, is from it's through PDPH, and then the other one is through IBX, that is our provider, our healthcare provider. The questions that you asked first about the temperatures in classrooms, yes, you are right that in some classrooms the temperatures fluctuate. Some are very hot, others are maybe very cold. And what we're trying to do is go through a process to regulate those temperatures. And if that is a room that where we have installed a fan, individuals will be coming in 4 times a day to check the temperature. And if that temperature falls below what is 68 degrees, we would then take that classroom offline and relocate that class to another area of the building that has a more appropriate climate.
Madam Chair, point of clarification.
Yes.
Yes, Dr. Hite, really quickly, I just wanted to pause there where you talked about the individuals coming in to check the classrooms. And I specifically remember when we were at Nebinger, there was a number given of the amount of individuals who can check the classrooms, I believe of 14 across all the city schools. So what my concern is if there's some type of device, some type of scientific measuring device that we can put in every single classroom that is also constantly monitoring the temperature, the airflow, the air quality, some type of device that, we will be able to, hopefully look at the CARES dollars and be able to be reimbursed for that device, so that there's also another device measuring what's happening in the classroom in real time, so that it's not so subject to human error, and that we have to wait for an individual to come and check when, what I thought I heard at Nebinger was that there were only 14 individuals that can go to every school in the district that will be open in order to perform these checks. Thank you, Madam Chair.
Yes.
Sure. Dr. Hite.
Thank you, Councilwoman. And I thank the 14 individuals. And so I want to make sure we're not confusing this with the groups that were doing the air balancing reports. Every building engineer can has a device to check temperatures. And we have building engineers in each of our buildings. Some have multiple building engineers. And so every building engineer can do temperature checks. But you asked a series of other questions as well and we can explore whether if there are devices that can be used in order to do this, that we either install in rooms, or I think at least in Chicago, they're using a device that tests the air quality in rooms, but that's also done by the building engineer. It's not a device, it's a device that was purchased for each engineer, and they use that device to check that. And we can certainly explore that as a part of our efforts moving forward. You asked about the sinks. I'll have to get that information back to you in terms of I know we checked all water stations, and we cut the water off where individuals could touch those stations and get water. So we wanted to make all of those hands-free. I do believe that also applies to sinks, but I want to make sure I get that answer to you. And I don't have the specific answer for that question. Yep, I do have it now. Yes, sinks were all repaired, and if they are those that are used in classrooms, they've also been adjusted to either not operate by hand or operate remote or operate hands-free. And I would imagine with the age of most of our sinks, we probably took those out of operation so that individuals would not be operating those by hand. You asked a series of other questions too, Councilwoman, that I'd have to get the responses back on. In fact, I can't even remember some of the others. But if you could get those to me, and then I can get responses back to all council members and to the public on those.
Yes. We just thank you very much, Councilmember Gilmore Richardson. And we just want to underscore that we'll be sending questions over on behalf of the committee, and in terms of a number of the different areas that were reached out to by individuals. And we really do need to work with the district so that we can get those answers back, not only to our committee members, but also to individuals who had raised them. So I want to thank Councilmember Gilmore Richardson for that, and just ask for a commitment from the district for these additional questions to be answered. Thank you. So I had a couple more, and I'm going to do a little bit of a rapid fire through these if we can. And then again, as I said, a majority of these are going to just have to be followed up through the broader, back and forth with the district. In terms of mental health supports, and I know Superintendent Hite, I know how seriously you feel about this issue, but could you share, are there any plans for new or additional supports to help students who are dealing, or school communities that are dealing with crisis, and what your specific priorities are for additional supports if new funding should be made available? So we know, for example, that the STEP program is not in every school. But could you articulate out any new and additional supports on mental health?
Yes, I mean, and if in fact monies flow like we think they may flow from the federal government, this is an area that is extremely important for us. And so expanding the resources that are available through some of the STEP programs that are at schools now, I think, and that's at about 30 schools. I think the STEP program is about at 30 schools, but expanding those types of resources for our young people, really focusing on the process that the board has begun around the goals and guardrails work, looking at how do we differentiate not only behavior health resources, but health resources just in general to be more responsive to those schools that are not on track, who will likely require more supports and services for things like student attendance, behavior health support, conflict resolution or counseling, or bilingual services. And so all of those things are a part of how we're looking at differentiating resources to direct more of those to particularly schools that are off track. And we'll also use data, and Karen Lynch talked about the data that we've been investigating, data around conflicts and incidents of violence that's happening within and throughout the communities, and looking at those data to also guide our efforts in terms of the behavior health supports. And I see Karen is here. So.
Yes, no, and I do appreciate Ms. Lynch, but I know this is a longer conversation.
Sure.
Would just like to underscore that I think this is an important conversation as school budgets start to come out and as we start to discuss the district's, priorities. And look, we understand that we're all pushing for the Biden administration to do a major relief package that supports the school districts, and we need the state legislature that has now an education funding plan before it from Governor Wolf to really step forward and ensure that our schools are as important as horse racing or any other industry that has been prioritized within the state budget. But I think maybe if we could, I'll move on to a few other areas. Sure. I mean, two other areas that I think have been raised to us by educators who are concerned, as we bring back young people in. One is that the inevitability that individuals will be identified as COVID positive and the need for quarantining and all of that. One of the most difficult aspects is that quarantining itself is extremely difficult. It's wearing on a family. It can impact a family member's ability. Technically, they're not supposed to go out of the house, depending on who's been exposed and for how long. And it seems like there needs to be support and advice for that family, including medical supports and questions. Again, this is beyond the district. Is partly why I think the reopening of school is so much more than just about the classroom. It is really about, for the first time, having an affirmative health outreach to many communities that have long been left behind in terms of the COVID pandemic. They've been deeply impacted, and they haven't always had access to a lot of health information, treatment opportunities, and support. So I think one of the concerns that a lot of educators have brought forward is that if a child were to be identified as COVID or to have been exposed, and then technically if their family members might have to be concerned about isolation, this can impact jobs. Are there and has there been any discussion about how the city and the district can be working together to ensure, for example, food delivery, or to address if there's a job issue that's in place, or medical help and treatment for the family of the individual who's been identified as needing to quarantine or be in isolation? I
Yes,
mean, it's overwhelming. So,
Yes, no, we continue to work with both the Office of Children and Families at the city. We have a weekly meeting with them to actually talk about how are we able to direct resources that are in response to these types of things that you just suggested. And quite frankly, Councilwoman, we haven't thought about like the quarantining. I mean, for instance, if we're focused on the child and the individuals in those classrooms quarantining, beyond that, we will need additional support and help from other agencies and other entities to support that family. We can manage we had to deliver computers. And so we delivered computers to some families, and in some cases even delivered some meals. And so we do have the ability to do that. But beyond that, I think it's going to be difficult just as a school district in and of itself to try to address some of these issues that are outside of our control, like supporting a family that needs to quarantine. I do think that's going to require a lot more than some of the resources that we have here. I'll just add, 60 schools have STEP, not 30. So we have expanded that program.
Okay, thank you. And do you know, so if we could go into a few of the more rapid fire questions, and then we'll be able to recognize that there's a lot of people who are waiting. But just had a few more rapid fire questions. Could you tell us, or are you aware of how many staff have requested accommodations because they themselves are either have high risk conditions or they live with family members who have high risk conditions, and how many of those requests have been granted?
I don't have that number. I'm sorry. I can get you that information. I do. We have that. I just don't have that number.
Okay. Yeah. That's a question that's been asked to us.
Sure.
We talked about the hotline, 215-400-5300. What are the hours of the hotline?
8 to 4:30, I believe. Let me make sure.
And there is somebody who's on the other end to answer it?
Yes.
Okay. And generally, can the district commit to a response time back to individuals who may not be able to have questions answered right away, whether it could be within 3 days' time or some sort of time frame?
Yes, we can. But I want to make sure it's as short as possible. 3 days seems long to me. But I want to talk to the group that manages that work and see how we can speed that up.
Good. I appreciate that. A question that's been asked is if an individual has to quarantine, particularly those who may be support staff, who may not have substantial benefits, is there any pay penalty for them if they take their sick days as a result of mandated quarantine or a sick day that they have to take because of exposure at school?
It has not been up to now. And Larissa's coming on. So no has been the answer. And moving forward, I don't know the answer. So I'll have Larissa share the response.
Sure. We actually, for those who are directed to quarantine by us through the PDPH or who test positive while working in our schools, are provided 10 extra days of what we call directed quarantine leave. That's district paid time in addition to whatever sick days that they might have. So we have added leave time. We've also created more flexibility so that no COVID time would have any relation to any discipline, any issues around that. But basically 10 extra days plus then you could start to use your sick time.
Thank you. Can you confirm that you'll get back to us on how many staff are expected to be vaccinated starting next week so that we have a sense of what the timeline will be for the full vaccinations?
So I can tell you a little bit about what we know is that we are sending out invitations on a rolling basis. And so we anticipate that within the next week, the first 10,000 or so will receive an invitation for an appointment over the next 3 to 4 weeks. Mm-hmm. So I don't know if that makes sense, but in essence to say the appointments are going to be open for 3 weeks. And so you can choose. There's obviously other entities, all of our private schools, charter schools, archdiocese schools that are also making appointments during that time. What we don't know is, in essence, how many of those people will take those appointments, and then being able to add additional people into that group. So being able to expand the number of invitations. So I think that's the unknown for us right now as to how many people of our first group will actually take the appointment and allow us to add in other people as we go.
Okay. It would help just to know, like, as we're keeping tabs on it, so we can understand this, the speed at which we're getting towards a fuller vaccination of the school staff and communities who are involved. That's helpful. In terms of masks, I know that there's been, discussion about the cloth masks, but as we heard from Dr. Rubin, there's been updated information about the masks themselves, and so the importance of 3-ply surgical as being a standard. And what is the district doing in terms of addressing those types of standards? And is there additional resources to ensure that the mask making, since it is such a key and identified component of addressing transmission, will be a priority?
Those are absolutely a priority. And I do think that the masks that have been purchased already meet those guidelines, Councilwoman. And so I want to verify that just to make sure.
Cloth masks? Okay.
Cloth masks, yes.
All right. Why don't we get back to us? Because it didn't sound like the cloth masks did meet the priority but you'll confirm that for us?
I'll confirm that, yes.
And then I think the last request is, can the district commit to make public the benchmark that I think was asked earlier about what would it look like to actually close the school, whether it's external community transmission rates versus, the number of cases that would be identified within a school. Could the district commit to making public what that benchmark and threshold will be in order to mandate a school closure?
Yeah, we will commit to making the information that we receive from the Philadelphia Department of Public Health around those thresholds public for everyone to see. Yes,
I appreciate that. I mean, as I think one of the things that's been difficult is that we do have multiple standards here. I think, at some points we use the CDC, at different points we use the health department, you've got internal advisors, you've got the MOA. One of the areas that's been difficult for a lot of communities and families has been that, the CDC currently, I believe, and I would like to know if what the current level is for Philadelphia in terms of the CDC community-wide transmission rate.
I'm sorry.
That's okay.
I believe it's under 5%.
It's under 5%?
Yes. Okay. For
Philadelphia?
For Philadelphia, yes.
And, earlier, I think one of the concerns that had been raised was that the CDC, I think Dr. Rubin hinted at this, that in the fall when we were discussing reopening, there was some hesitancy because obviously cases were very high. Cases have certainly declined significantly, but school reopening is occurring within all of these. So, this is another area where we're concerned and need to know that the district has the clarity about what standards they're operating under before determining a fuller school reopening.
So can you repeat the question? I'm not sure I understand the question.
I think it's understanding that the school district has previously tried to reopen during points in time when the CDC community transmission rates were extremely high. And, though the rates have declined very quickly recently, we're just maybe a week or two out of being in, if that, at being in the significant rates. And look, we want to, Dr. Rubin testified that rates are declining. This could be a seasonal virus. There's also new variants. And I understand these decisions are being made in a time when there's a lot of churning and new information that's evolving. I guess what I'm putting on the table is that what communities are struggling with is this question of, without that kind of public commitment about what the benchmark is, we're in this gray area where nothing seems to apply.
Right.
So you could talk about a reopening when CDC transmission rates would be at very high levels. And we continue to discuss it, on February 22nd, not knowing what the transmission levels will be. So again, it's just re-emphasizing the importance of this public benchmark and asking you to understand why there's been so much concern and, and some fear about the district making sure that the health standards are clear and that we adhere to them, as opposed to just, a reopening that's, based on somewhat arbitrary kinds of understandings of when we want to reopen schools partially.
Yeah, no, I think that's the right question, Councilwoman. And as I think I indicated early on, and we heard this from Dr. Rubin as well, but I mean, through the fall, like all of these things were changing. Not only were there multiple criteria, depending on where the criteria were coming from, it could have been different. So state had a website, that website had thresholds. The Philadelphia Department of Public Health had a threshold. Then we were getting information from the CDC. And then first it was taking temperatures, not taking temperatures, masking, not masking. It was all of these things that were changing. And so now at least there's guidance from the CDC that says in order for schools to open, they have to do the following things. And so that's number one. Number two, to answer your question, it's why we're staying with the group of 9,000 individuals and not expanding from that, because we want to start small. We started with the regional centers that had about 600 students that were going to be exposed in those centers. Now we're moving to 9,000. We want to see how we do with those young people and make all these things public, like the thresholds and the testing protocols and all of the other safety protocols in place before bringing back more students to do that, and making those criteria clear and where we are in relation to those criteria, I think are really important.
So I want to thank you, Superintendent Hite, and for your team for being on. I know that we've been on for almost 2 hours asking you questions. I think one of the things that it underscores is that, and we have dozens and dozens of testifiers. We have over 50 testifiers, probably another dozen who submitted written testimony. I think what this underscores is the hunger and need that people have for this kind of public forum. And again, as I know you've done a tremendous amount of work on your end to try and lay many things out, but at the end of the day, many of these questions do come down to a relatively granular level. And ultimately, I hope that school reopening is not just about the physical reopening of a school. It's about helping communities that have just felt really left behind in the health disparities issue, on economic injustice, and on longstanding educational disparities, that we have to be able to find a means to engage, to build support, and to collectively learn together. We don't actually do this by writing something out. We do this by working together to open schools safely, to take care of our young people, and to meet the bigger injustices that, to end the bigger injustices that have gone on. We don't want a new normal. We want a better future. So I want to thank you for this time and look forward to working with you. We'll be sending the questions on behalf of the entire committee and hope that you'll consider having your team and yourself listen in to principals and other staff and community and school leaders who are on, who also have urgent questions too.
Yeah, no, I appreciate that. And I will also add, Madam Chair, that we can commit to a 24-hour turnaround on the hotline. So not 3 days, 24 hours.
Thank you very much. Thank you very much, Superintendent Hite.
Thank you.
Mr. Spiva, first of all, I want to thank everybody who has been waiting for so long. Again, as we said, I hope this demonstrates the importance of all these questions. Our public testimony that is forthcoming also reflects many of the questions and issues that are being driven by our communities. And we look forward to hearing from everybody. And I will be here, as will members of our City Council committee, listening, documenting, and we will make sure to communicate all your questions over to the district and get answers back to you directly as testifiers. So, Mr. Spiva, will you please read the next panel to be testifying?
Yes. Next we have Jerry Jordan, President, Philadelphia Federation of Teachers, Ernie Bennett, SCIU, 32BJ, Jerry Roseman, Environmental Director, Philadelphia Federation of Teachers, and Dr. Robin Cooper, President, Commonwealth Association of School Administrators.
Good evening, everybody. Thank you so much for your patience. We look forward to hearing your testimony. Mr. Jordan, could you state your name for the record? And you may proceed with your testimony, and then we'll continue in order as was read. Thank you, everybody.
Good afternoon. I'm Jerry Jordan, President of the Philadelphia Federation of Teachers. Thank you, Chairwoman Gem, Chairwoman Keone Sanchez, and all members present for this important hearing to discuss the safe reopening of school buildings. I emphasize buildings because, make no mistake, schools are open, buildings are not. And let me be really clear, educators and students should be working and learning in school buildings because we know it's where the true magic of education happens. There's so much about in-person learning that simply cannot be replicated in a virtual setting, no matter how hard teachers and students try, and trying they are. Our educators have embarked upon Herculean efforts to ensure that the needs of their students are met, and students and parents, too, have doubled down and really given their all. We know that remote learning will never replicate the in-person experience, but we also know that we're in the midst of a global pandemic, the likes of which none of us has ever seen. A global pandemic that has taken the lives of 3,000 Philadelphians. A global pandemic that, like so much in society, disproportionately impacts Black and Brown communities. And we know that even before the pandemic hit, a deeply inequitable system rooted in systemic racism, time and again, shortchanged the children we serve. The facilities crises in our schools is not new. It's exactly why we formed the Fund Our Facilities Coalition, which many of you are a part of, to identify real workable solutions to the decades of neglect that have left toxic conditions plaguing our schools. Decades of neglect that led to SEIU worker Chris Trankimas to lose his life after a boiler explosion at FS Edmonds. Decades of neglect that led to then first grader Dean Pagan to suffer lead poisoning after eating lead paint chips from his desk. Decades of neglect that led to a devastating mesothelioma diagnosis for PFT member Leah DeRusso, who spent her career teaching in buildings with known damaged asbestos. Decades of neglect that led Chelsea Amongo, then a fourth grader at Cassidy Elementary, to write to her state senator and ask why the color of her skin impacted how her school is funded, and shared with him that she feels like she is in prison or a junkyard when she is in what is supposed to be a sacred place of learning. I bring all of these searing examples up because we know how woefully our society has fallen short. And when COVID hit, these inequities were exacerbated even more. For wealthier, whiter school districts, a reopening plan that is contingent upon unsafe toy fans held in place by plywood and duct tape would simply never, ever fly. And unfortunately, the district has done little to engender the trust of educators, students, parents, and community alike. So when they say, trust us, you'll have to forgive us for saying, show us. And what we've seen of their reopening plan all three times has caused deep concern. That's why after negotiating a memorandum of agreement, we triggered a clause asking for the intervention of a neutral third party. That process is underway. I want to reiterate our overall concerns with reopening buildings. We do not yet believe that the district has shown us that buildings are safe for reoccupancy. Let me be very clear. This union has never and will never stand in the way of student progress or access to education. We very, very much want schools to be safe for reoccupancy. We hear a lot about children falling behind during the pandemic, and it's exactly why our educators have pulled out all the stops to reach their students. I have seen virtual culinary lessons, science labs in kitchens, experiments taking place on a back porch. I've seen teachers delivering learning materials to their entire classes. Believe me, our educators are working harder than ever. What we're actually trying to do is make it possible for buildings to reopen in a way that keeps students and staff safe. And quite simply, we do not yet have the information that is needed to make it so. We cannot and will not abide by a plan that relies on promises of safety, incomplete ventilation reports, and fans that in fact pose an electrical hazard and potentially spread the virus. Further, by the district's own assessment, nearly every classroom in some buildings are deemed as being suitable for zero occupants based on airflow. In addition to ventilation, I want to address another key layer of mitigation, the vaccine. As you know, we have been pushing for educators and school staff to be prioritized for vaccines. If we as a city, a Commonwealth, and a nation are truly committed to a safe reopening of school buildings, then we know that vaccination must be a key component. We commend the partnership between the mayor's office, the district, and CHOP to get vaccines into the arms of educators and staff. We know that time is of the essence, and we are glad that signups for this endeavor will be underway shortly. I'd like to provide one more example that really illustrates the distrust of the district's safety protocols. In their recent procurement of various materials needed to prepare buildings, they purchased tape to mark off social distancing measurements. And as it turns out, that tape has lead in it. Lead. In an explanatory memo, the district blamed the supplier, but I am including a photo of the tape attached to my testimony. And you will see very clearly that the tape is marked with a contains lead warning. Perhaps you've even seen photos of this tape up in schools. Enclosed is a photo of a fan at Patterson Elementary. And you'll notice in the room and around the fan, there is a lot of yellow tape. We can presume that this is, in fact, part of this order and may contain lead. While the tape has been removed, I find it so upsetting that once again, the district has chalked up a really serious error to something done in good faith. I use this example because it's emblematic of so many of the concerns we have regarding reopening school buildings. Our students and the educators who serve them deserve a truly transparent process, and most importantly, they deserve to be safe when they re-enter school buildings. I wish I could report to you that if doors to buildings reopen today, that our students could enter and learn safely, but I can't, and that's the truth. It does not mean that we are holding anything up. We are trying to save lives. You'll hear shortly from our Director of Environmental Science, Jerry Roseman, who can share with you some more of the science behind our concerns around reopening of school buildings. I'd be very happy to answer questions you may have, and I thank you again for holding this important hearing today. Thank you.
Thank you.
Thank you. Next, we have Dr. Rubin Cooper.
Good evening, everyone. Let me first start by saying that I applaud every committee member for convening this hearing. Next, let me be clear in my assertion that members of Teamsters Local 502 CASA are dedicated to returning to in-person learning because we know that it's best for students. Lastly, let me please understand that my testimony is not an indictment on the School District of Philadelphia. Rather, it is an indictment on a much larger issue of addressing systemic inequities as it relates to educating Philadelphia's urban children. When discussing our school reopening, we tend to do it in a vacuum by comparing Philadelphia to other districts that do not have the multitude of issues that are unique to Philadelphia. However, we use the comparison without informing stakeholders that in most cases, we are comparing apples to oranges. Our children and our communities deserve more. We have seen for far too long how neglected our school buildings have become, yielding problems of lead, mold, and asbestos. Heating and cooling systems have failed and are failing. Philadelphia is not taking into account the aforementioned outliers that are cautioning us to slow down and get it right. Why get it right? Well, because we just can't keep getting it wrong. We got the lead issue wrong, asbestos wrong, mold wrong. We can get this right if we take our time and make it our focus to get it right. Our only focus is to get it right. We can do it. I mean, after all, we're Philadelphians. We can do anything. How do we do it correctly the first time? Vaccination, ventilation, and vetting of those ventilation reports. Properly vaccinate every employee with both shots, not one, with both shots. Why? Well, because it's now available. The vaccine is available. So why half-step and get one shot, get both shots, and we would be sending our employees a strong message that says we care enough to get you inoculated against those who may be carrying the virus. We know that schools without proper ventilation will become a petri dish of particles flying around. Only 2 weeks ago, approximately 40% of our principals had not received comprehensive air balancing assessment reports. Added to this is the concern that many schools do not have adequate air handling systems to effectively provide proper air exchange. We do not believe that the installation of residential, non-commercial window fans attached to plywood that are not intended for constant use or constructed to withstand the elements over time to be a sufficient remedy. Further, there is a problem with fans, with the screens, and when you remove the screens, you are now blasting the room, which is circulating and blowing the same air. We need completed ventilation reports for the entire district, and those reports should be vetted by a third party to ensure that we are not misstepping. The district needs to provide its administrators nothing less than a clear and up-to-date, easy-to-follow protocol that directs for a clean and safe school, a plan that provides ventilation that exchanges air regularly, massive PPE, adequate classroom space for distancing, as well as COVID testing and contact tracing strategies. It should not be where restaurants are going through more comprehensive safety strategies than schools where children are placed. Let me be clear. Our administrators have not yet received that detailed protocol plan to date, yet we are scheduling to send our youngest students and their staff back to school soon. This is critical and will go a long way to build trust among our stakeholders, parents, teachers, administrators, community members, city officials, and more. Let's use this moment to do what we have not done for many years in our neediest schools. Let's invest in our facilities and fix inadequate ventilation. Let's arm administrators with data and strategies to reopen safely and responsibly. Let's build trust with transparent facility reports from the PFT environmental director to the outside mediator to all other experts. This endeavor is going to take all of us to get it right. Let's vaccinate, ventilate, and vet the reports. Every child, parent, staff member should feel confident that their school administrators have all of the necessary resources to open safely. CASA, we stand with all Teamsters Local 502, CASA, we stand with our other union partners here today who are advocating to slow down so that we can once and for all get it right. Thank you.
Thank you so much, Dr. Cooper. Thank you.
Up next, we have Ernie Bennett.
Good evening, Mr. Bennett. If you could just state your name for the record and proceed with your testimony.
Mr. Bennett, I believe you're on mute. We can't hear you quite yet. Mr. Bennett, we still can't hear you. A small microphone button that you can press to unmute yourself on the screen.
Maybe we can come back to Mr. Bennett.
Yes, Mr. Bennett, we'll circle back to you. For now, let's turn to Mr. Jerry Roseman.
Good evening, Mr. Roseman. If you could just state your name for the record and then proceed with your testimony.
Of course. Can everybody hear me?
Yes.
Okay. Good afternoon. My name is Jerry Roseman. I'm the Director of Environmental Science for the PFT. I want to thank the City Council as well for providing me an opportunity to testify here today. As the PFT's Environmental Science Director, and consistent with my role as the Environmental Science Advisor for the Philadelphia Healthy Schools Coalition, I've been tasked with conducting a data-driven, evidence-based review of the district ventilation status and conditions needed for safe reopening of our schools. This is a joint PFT and district effort through the mediation process currently going on. When considering the importance and use of ventilation as one of the layered mitigation strategies Dr. Rubin mentioned, 3 specific issues should be considered. First, specific local school conditions and situations do and should play a major role in how important ventilation control would be. Second, each mitigation layer we use provides additional control for COVID-19 transmission and spread, not only increasing public health protection, also signaling district commitment to policies and controls that are more rather than less protective. And 3, with respect to providing robust ventilation control and not inconsistent with what I heard earlier from Dr. Rubin, existing ventilation in so many Philadelphia public schools is so compromised that if not everywhere, then at least in our schools, ventilation improvement is crucial. Although there are many important layered and interlocking considerations necessary to ensure safe school opening, I'd like to dive right into the ventilation assessment the PFT has been engaged in with the district and the mediation team. The PFT has put together a small team to develop a database for aggregating and analyzing data, entering and reviewing data, and for communicating back and forth with the school district and mediation team to verify schoolroom safety. Using the 150 school list with about 8,000 individual spaces provided by the district for schools with pre-K to 2 second grade students, we've been working full time over the past week and a half to evaluate and analyze the large volume of information the district provided. We were first given up-to-date information and data for all the schools on the 11th of February, with an update given to us on the 14th following our initial review and follow-up request for additional data. Partial information had been provided previously by the district, but until 6 days ago, we did not have an up-to-date and every school set of data for the formal review process now underway. In agreement with the district and mediation team representatives, we began analyzing data from the 23 youngest district schools, those built from 1970 to 2008, assuming that these schools were the most likely to have the fewest problems with ventilation and effective usable space dimensions. We used a 3-step process as part of our review. Step 1 involves looking at each room in each school to verify that all necessary basic data about outside air measurements, ventilation types, space dimensions, and occupancy was present and accurate. Where we identified missing data, the district is notified, questions are forwarded to the district for answers. Step 2 involved careful review of all relevant documents and data to make sure that there were no asbestos issues or concerns specifically impacting and potentially contaminating ventilation systems. 3 involved a similar type of document review in order to determine if there were any mechanical problems and issues, including those identified by the district and their air balancing and testing consultants. This is being done to assess the limitations on the ability of our systems to provide fresh air and to ensure the repairs needed are made. As the room and school level issues, questions, and further needed documentation are identified, we aggregate them, summarize them, and provide them to the district as requests for specific follow-up response. As soon as the district provides the requested information, further review is performed, and this process continues until we can jointly verify individual spaces and schools as, quote, cleared for occupancy. In addition to the review scope that I just described, there are 3 other specific and critical issues being evaluated. First, the window fan situation, a solution we consider to be ineffective and unusable in its current form. There are several reasons for this, some of which were mentioned earlier, and I can try to address them if there are questions later on. But as the CDC noted in its new guidelines, if fans are to be used, they should be positioned and located properly and placed to exhaust air to the outside, not facing inward. Secondly is the importance of assessing all exhaust fans and ensuring they are fully operational. This issue, too, was addressed by the recent CDC guidelines in calling for constant and adequate exhaust in all bathrooms and all spaces at all times. And third, we've highlighted the need to conduct an on-site walkthrough inspection, evaluation, and verification process as a real-time, in-place check of current conditions prior to occupancy. The formal review process has only recently started, but we have already identified a number of serious problems in some schools, including possible asbestos-related concerns, again, directly associated with ventilation systems. These findings have highlighted the urgent need for careful scrutiny and additional and clarifying data and information to be provided by the district. During our data review, we discovered information that pointed to suspected asbestos problems inside the ventilation systems in 2 schools. In the first case, the district provided information to confirm and provide some information that asbestos problems in the old original house fan system in the school we pointed out had been present but were now addressed. Review and verification in that situation is ongoing. In the second instance, we identified possible asbestos contamination in a school with classroom unit ventilators. They're in each room, which we brought to the district attention. This issue is still being looked at and identified. Our data has also identified some major mechanical issues and concerns impacting ventilation system operation generally, problems with window and exhaust fans, a lack of specific information about the list of rooms to be used for PK-2 instruction. We don't have that list yet. And hundreds of rooms without outside air ventilation measurement data or square footage yet provided. This data is needed, of course, to define maximum room occupancies. With the help of the mediation team, the process between the PFT and district has been moving forward over the past week and a half. As the deputy mayor said, we have been working together in an urgent and diligent manner. And despite the challenges faced in implementing an effective, coordinated, and cooperative effort to date, we are pushing ahead, continually trying to find better and more efficient ways forward. I'll conclude my remarks by saying that while the work of the mediation team has been extremely helpful, we are asking for as much additional assistance as possible Now, to help ensure the full cooperation of the district throughout this ventilation review process in which we're engaged, so we can reopen our schools as quickly as possible, but safely, equitably, and with public confidence and trust in school safety in the process. Thank you so much.
Thank you so much for your work, Mr. Roseman. It's greatly appreciated.
You're welcome. Thank you.
Mr. Ernie Bennett.
Good evening, Mr. Bennett. If you could just state your name for the record and proceed with your testimony.
My name is Ernie Bennett. I'm the district leader for District 32 for District 1201, 32BJ, SEIU. I'd like to say to all members of City Council, good evening, to my labor leaders and brothers who just spoke, and to parents and stakeholders. The Philadelphia School District members of 32BJ, SEIU, we have been on the front lines of keeping our schools safe for the last 11 months. Throughout this COVID pandemic, our essential workers have never had the luxury of staying home. Schools couldn't open safely without our members showing up every day to maintain and secure the safety of school district buildings for everyone. I understand the concerns of parents and teachers at this moment. Our main concern is that the members that keep our buildings safe have access to regular testing, contract tracing, and adequate PPE gear. And as the vaccine rolls out to the district employees, that our frontline essential members are at the front line to receive these vaccines. Philadelphia School District 1201 members need immediate access to vaccination to continue to do the critical work necessary to reopen school buildings to teachers and students. We aren't going to commit on what another union should do, but I know the support I've always gotten from Jerry. I applaud you on your opening statements as well, and Dr. Cooper as well. But we're very frustrated that our members are risking their lives every day, like all essential workers in this pandemic, to make these buildings safe for reopening, while the conversation continues to focus on workers and who aren't in the buildings. I know virtual learning is very difficult for everyone, but our members are here. They can't drive buses, clean schools, maintain school buildings from home. If we didn't think the buildings were safe, our members wouldn't be in them. We're just going to keep fighting for testing, contract tracing, PPE gear, and when it's possible, vaccinations for our members first. Because we can't keep our jobs and healthcare if we stay home. The part that we play is vital to the safety of all our schools and our communities. I thank you, and this is my testimony on behalf of my membership.
Thank you so much, Mr. Bennett. And I hope that you heard from our earlier testimony with the focus on ensuring that there was a commitment from the School District of Philadelphia that all school staff would be prioritized on vaccinations as well as testing, and that vaccinations would start with staff who are currently in the school buildings, which certainly includes your members, among others. It's important for us, and we really appreciate your members' service and dedication over these long 11 months when things were most uncertain as well. So thank you.
Thank you. Councilman.
Are there any questions for this panel from our committee members? I had just one question for Mr. Roseman. And first of all, I just want to thank all of the testifiers for your work in ensuring that your members, as well as the students and families that you serve, are safe and are well cared for. We know that you are on the front lines, and it's incredibly important for us, and partly why we had so many questions of the district was largely driven by many of the questions that you all directed to us to ensure that some of these questions could be answered, and we'll continue to be in partnership. But for Mr. Roseman, really quickly, because I know you work with the City of Philadelphia, you are not just working with the PFT, but have been working as well with the city One of the questions that's been a little bit confusing about ventilation is the district standard of using 15 cubic feet per minute as a measure around ventilation, and whether you know how you consider that standard in light of the fact that there are, for example, city regulations on 50% occupancy requiring 15 air changes per hour. And if you could maybe comment a little bit of that, and you know how you're thinking about encouraging, you know, ensuring that we're meeting the standard that we set out.
So thank you. 15 cubic feet per minute is a very basic kind of adequate minimum kind of a standard. It's a standard that, most of the engineering authorities who deal with this will talk about as a minimum. It is not designed to protect from pathogens. And it's nowhere close to 15 air changes per hour, but that standard I'm not familiar with. My understanding for the city is that they have been looking for about 5 air changes an hour. But whatever those numbers are, and other districts have more aggressive standards, one of the most robust parts of what's happening here in Philadelphia is that we're talking about not opening the rooms unless they meet this standard. So could it be better? Yes. Is this adequate? Given where we started? Yes. And as we can see, this is the kind of standard that in and of itself is quite hard to meet. And it's one of the reasons I think that we're kind of still out of school. So better, the best standards right now would peg schools and other sites like schools at 4 to 6 air changes per hour. But one of the ways you work around that is, as Dr. Rubin said, from a slightly different end, you use other mitigation strategies in a layered way. So that's our situation here.
Okay, we appreciate that, and thank you so much for all your work on this. Are there any other questions for this panel? Thank you, everybody. Thank you so much. Mr. Spiva, could you call the next panel of witnesses to testify?
Yes. Next, we have Brandy Stewart, Claire Murphy, Stephanie Marrero, Nadine Taylor-Lee, Layla Falcon, Regina Fagan-Drock, Reverend Robert Collier, and Anna Pern.
I believe Reverend Collier is not able to testify, but we welcome everybody else. And thank you so much for your patience tonight, and especially for devoting your time to this very, very important conversation. So if I could ask Ms. Stewart to just state your name for the record, and then you may proceed with your testimony. Good evening.
Good evening. My name is Brandy Stewart. Thank you for allowing me to address you today. My niece is a second grade student at Samuel Powell Elementary School, where I serve as the president of the Home and School Association. Last week, I sat in 2 90-minute virtual meetings for Powell School students to learn about reopening plans. There were a lot of questions and concerns, and the answers seemed to lead to more, not fewer, concerns. There is a lot to be said about the safety issues in Philadelphia schools. If asbestos and lead has been an ongoing problem, what would make anyone believe the district would construct a good plan to combat COVID-19 outbreaks? The window fans alone prove that this reopening plan is a half-baked attempt. Fans blowing cold air directly on staff and students in the dead of winter would only cause more harm. For instance, anyone that struggles with asthma triggered by cold air would have issues. Are teachers expected to concentrate on teaching and learning in mask and full winter gear? To me, this is circulation of cold air full of impurities, not ventilation. Most staff are not vaccinated. There will be no daily screenings, and there are no plans for regularly scheduled COVID-19 testing. Everyone is therefore at higher risk of contracting COVID-19 during in-person learning. The safety guidelines dictate maintaining a distance of 6 feet at all times. This seems unrealistic in a pre-kindergarten through second grade learning environment. What happens when a child falls while at recess? Can a staff member meet the needs of the child from a distance of 6 feet? If students get into a disagreement during recess, how is the staff expected to resolve that situation from 6 feet away? What will the teacher tell a 5-year-old who doesn't understand why they can't just walk over and help them with issues that they are sure to have while their classwork on their computers? While we all want our children to return to school sooner rather than later, we are not willing to sacrifice their health and safety to give them a false sense of normalcy. The disruption of virtual learning process at this particular time would also prove to be more damaging than beneficial. The staff at Powell has worked extremely hard to make virtual learning a positive experience for students and their families. Our school's attendance is good and most students are making academic progress. Synchronous virtual learning has already been disrupted due to staff training for the hybrid model, a model in which students will continue utilizing their computers in the same way they do now. The difference is they will have to do so in a classroom where teachers will essentially have to teach two separate groups of children, those in person but still using their computers and those learning online. Class would have to stop for mass breaks and bathroom breaks, and teachers would undoubtedly have to interrupt the class to remind children to keep their mask on. And wearing a mask means students will now not be able to see their teacher's mouths forming words, something that is key to teaching, reading, and writing. Finally, altering schedules and routines any further would create anxiety and stressful situations. Do not harm should be the top priority for schools reopening. This reopening plan is the complete opposite. I believe Philadelphia schools should remain virtual until proper safety measures, a clear and concise plan to address mental health brought on by the pandemic, and a plan for smooth transition of instruction are in place. Thank you, Madam Chair.
Thank you so much, Ms. Stewart. Just one quick question. I know you, as the president of Home and School Association, are you aware of how many students opted in for hybrid learning at Powell Elementary School?
I don't have the numbers in front of me, but from what I last heard, it's less than 10.
Okay, thank you very much.
Thank you.
Mr. Spiva, could you call the next witness?
Yes, next we have Claire Murphy.
Good evening, Ms. Murphy. If you could just state your name for the record and then proceed with your testimony. Thank you.
Good afternoon. My name is Claire Murphy, and I'm a parent of a kindergartner at Houston Elementary. Thank you so much for the opportunity to testify before the committee today. I'll begin by acknowledging that we've signed my daughter up to participate in the hybrid plan. She's currently scheduled to be in a cohort of 6 kids. 12 out of the 17 kids in her kindergarten class chose hybrid, and I think it's 23 per day in total in the building. Our family feels that with the added safety measures, masks, social distancing, testing, and keeping cohorts as separate as possible, that it is a safe plan for that small number of young children in a large building. And I'll just say that our 5-year-old has gotten very used to a mask. I wasn't sure about it over the summer, but they seem to be doing very well with it. Our teacher has been absolutely amazing, but my very social 5-year-old is honestly really, really struggling emotionally with staying home, not being able to go to school. Like so many other people she knows at private schools, suburban schools, and friends a few months younger that are in preschool that are all open. I really don't think we can make it until next fall and miss kindergarten completely. That being said, I understand that teachers don't feel completely safe returning in person, especially if the district ramps up to older students. I was glad to see that CHOP is helping vaccinate teachers next week. I think they should have mass vaccination events for only Philadelphia public school K-2 staff so they can have their first dose as soon as possible. And we need to have an urgent plan to repair or replace the ventilation before the fall in at least the 32 schools that have been mentioned as not having mechanical ventilation. And I worry that if Philadelphia public schools have to stay closed all this year and through the fall while every other school is open, it could lead to a steep decline in enrollment and confidence that we might never recover from. But fixing the ventilation is going to cost a lot of money. I haven't seen an estimate, but I found my school's facility condition report from 2017, and it gives a lot of details about the state of the old house fan system, which doesn't bring in outside air. It recommends replacement and lists the cost for just that at $3 million. That's for one school, so the district would need over $96 million, not including more repairs to newer schools. I don't think we can keep schools closed until that's all done, but there needs to be a plan. And how are we going to get this money? Why does our city not fully fund our public schools? It's another symptom of our community not prioritizing our schools. We've allowed restaurants, gyms, salons, private schools, anything that makes money to open and drive up community spread numbers while our kids are stuck at home. It's time to figure out where the money needs to come from to fund our schools. I think that's up to City Council. The federal funds for COVID relief might help this year, and maybe the state fair funding reform will help, but those sources are only a fraction of where our funding comes from. Suburban districts fully fund their public schools with higher property taxes. So is there a way to raise property taxes and demand full pilot programs without pricing out lower income residents of the city? Are there other revenue sources that could be found? I know that it might be very difficult, but not paying for basic building maintenance, lead and asbestos abatement, and safe ventilation during a pandemic is not an option anymore. Thank you for your time.
Thank you so much, Ms. Murphy. Thank you for your testimony.
Next, we have Stephanie Marrero.
Good evening, Ms. Marrero. If you could just state your name for the record and then proceed with your testimony. Ms. Marrero, are you present? I think we can proceed with the next witness and we'll seek to get Ms. Marrero back online.
Ms. Nadine Taylor-Lee.
Good evening, Ms. Lee.
Sure. There you go, you go.
Good evening. I want to say thank you for holding this forum and allowing me to speak. And I will read my testimony. I have a granddaughter who is in the second grade in the public school system.
I'm sorry, Ms. Lee.
Yes.
Apologies. If you could just state your name for the record, and then you may proceed with your testimony. Thank you very much.
Okay. My name is Nadine Taylor-Lee. I have a granddaughter who is in the second grade in the public school system. She stays with me when she's doing remote learning. She currently attends A.B. Day Elementary School. I am absolutely not against the schools reopening, but I think that the schools need to reopen safely. I have an underlying condition, which is asthma. This makes me more at risk for COVID-19. If my granddaughter returns to school and comes in contact with someone in school who is sick with COVID-19 or tests positive for COVID-19, what protocol would be put in place to notify families that their child or children have been exposed while in school? How quickly would families be notified about children's contact and exposure to someone who is sick or tested positive with COVID-19? I would be so totally mortified if I send my grandbaby back to school. She gets COVID-19 while in school, comes home and passes it to me or my husband or my 70-plus-year-old mother-in-law. We have taken so many precautions to keep her safe and remain safe ourselves. I am aware that not everyone is taking the same steps to remain safe. However, I would like the leadership of the Philadelphia School District and the leadership of the City of Philadelphia to take this into consideration. Lastly, I heard what Dr. Hite said, but there are text alerts that go out to college students when there is a problem. Why would we have to wait to receive a letter in the mail if someone tests positive versus receiving a text alert? In addition to that, thinking that fans are safe when we're not talking about air purifiers, we're not talking about thermometers. I just don't understand that. I am a committee person, I am an education advocate, and I am a safe school reopening advocate. And I really wish that these things are taken into consideration. Once again, thank you for allowing me to speak.
Thank you so much, Ms. Taylor-Lee, for that powerful testimony. And we will try to get some of these answers back to you as well. Thank you.
Next, we have Layla Falcon.
Good evening, Ms. Falcon. If you could just state your name for the record and proceed with your testimony, and feel free to turn on your video.
Okay. Hi, I'm Leela Falcon. Good evening, council members. My name is Leela, and this is my 13th year teaching art in the School District of Philadelphia. I'm speaking today because I believe the district's plan to open schools during the peak of a global pandemic is reckless endangerment. They are risking the lives of our students, staff, family, and community members. We closed school on March 13th when there was one confirmed case in Philadelphia. As of today, there are over 100,000 confirmed cases and over 3,000 deaths in our city alone. There are 27 million confirmed cases in our country, and almost 500,000 people have died. With 2 new variants of the virus that are both shown to be more contagious and more dangerous for children, we are at a greater risk than we have been since the start. If the School District of Philadelphia opens schools right now, people will get sick and some will die. Many children in our district live in multi-generational homes with family members who are at high risk. Our children will survive a few more weeks or months of virtual learning. They will not be the same without their loved ones. None of us will be. If the district waits to ensure each classroom has proper ventilation and every staff member and guardian has the vaccine, many lives will be saved. As a teacher and single parent, I understand the challenges with virtual learning, but I value the lives of my children and students more. I don't know one teacher who prefers virtual over in-person learning, but we are doing the best we can and are constantly growing. We all came out of quarantine. We will all come out of quarantine better educators. We are proving our flexibility, dedication, and the ability to learn and adapt to new technology while raising our own children at home. Last year, our district school buildings closed one after the other because of asbestos and mold. I have taught in classrooms that reach temperatures over 100 degrees and some that fall below 60 on a regular basis. If our buildings were not safe and comfortable pre-COVID, how can we trust that they will be safe and comfortable now? With a cheap household fan blowing throughout the winter months? I want to see evidence from professionals that each room has proper ventilation. Many of the classrooms at my school were listed at 0 occupancy in the district's ventilation reports. After being recently retested, they all jumped to 18, and there is no evidence that anything was done in any of those classrooms to make them safer. Children will not be going back to school. They will be sitting 6 feet away from each other, wearing masks, and spending the majority of the day on their computers. They cannot get out of their seats, drink water, have snacks, or use manipulatives. As a parent of a 5-year-old, this plan sounds absolutely miserable and it won't work. The plan requires teachers to teach students at home while we teach in person. How will our students at home understand what we're saying over the background noises of a classroom while we're wearing 2 masks? How will children in our classroom get help if they can't log into their computers or forget their materials at home? This is a time for the school district to create a plan that does not require kindergarten to 2nd grade kids to be in front of their computers all day at home or at school. I want the district to buy individual supply kits for students to be able to work at their desks with hands-on materials. It seems like we're ignoring critically dangerous issues in reopening. What do we do about siblings who attend different schools across the district, or children who go to childcare centers the days they don't come to school? Does every school get notified when a family member of your student is sick? In the new plan, specialist teachers will be required to teach every student that comes to school. That means every student will be exposed to multiple teachers who have been exposed to every student in that school. On top of that, there is no plan for COVID absences for teachers. If we get sick or quarantine, we have to use our own sick days, and we only get 10 per year. Individual schools cannot determine whether or not to close based on COVID cases. We would have to wait to be shut down by the health department. That means many teachers could be forced to continue to teach even if students in their class have tested positive. And specialist teachers would have to continue teaching in one classroom after potentially becoming exposed in another classroom. We all know that the virus is very contagious before symptoms even show, and that many people are asymptomatic. That means any of us, teachers and students, can be exposed to a carrier at any time. It is not a question of whether schools will close again. It's a matter of when. What is the plan for when schools close again? Why waste valuable time, money, and resources on a plan that clearly won't work? We have an effective vaccine that should be available for thousands of teachers and staff members in our area in a matter of weeks. Why not wait to open when our cases are down and every adult is vaccinated? We need your help to put a stop to the district's dangerous plan to prematurely open schools. It's cruel to make us choose between endangering ourselves and our families or resign with no income. Before the district makes the students, parents, teachers, support staff, and administrators risk their own lives and the lives of their loved ones, please advocate to protect us. Thank you.
Thank you so much, Ms. Falcon. I know that there aren't enough answers right now. We'll seek to get as many as we can and keep pushing, but thank you for your testimony.
Thank you.
Next, we have Regina Fagan-Drach.
Good evening. If you could just please state your name for the record and proceed with your testimony, and feel free to turn on your camera as well.
My name is Regina Fagan-Drach, a district teacher for 28 years. As an art teacher, I have woven my art expertise into my testimony, providing the reopening plan is neither safe nor responsible. To create a work of art, the artist first primes a canvas. Imagine the canvas being the school building. It is the art of illusion that the district has painted for the public. Before the pandemic, many of the buildings were menacing, from mice droppings and cockroaches to leaking ceilings and bathrooms, from freezing to sweltering temperatures, growing mold and looming asbestos, all sketched an accurate description of the conditions of many schools. But yet, we still taught. Ventilation issues not addressed, dust caked into vents and no airflow evident, but yet we still taught. And then the pandemic hit. The district scurried to solve the problems to get the schools open safely, or so was claimed. I believe that safety is not their first priority. The ventilation issues that have devastated our schools for years, according to the district, are fixed. One plan, the infamous fan, just another cheap Band-Aid to solve a major problem. Dr. Hite, using the art of illusion again, took reporters on a tour last week, exhibiting the landscape of what a typical classroom will look like. A classroom of 4 tables, each equipped with a plastic desk shield so that each child sits in comfort behind a cube safeguard. However, the truth of the situation is that each classroom is only receiving 4 desk shields in total. If the class has more than 4 students, not every child is getting one. Second on the tour was a table display of PPE equipment. Paraded were face shields, masks, and hand sanitizer. The impressionistic look enabled the public to assume that when students and teachers entered, each would be able to pick up a face shield for protection. This, again, is not the realism of the picture. The district purchased face shields for only the autistic support classrooms, custodians, nurses, and transportation. Grade teachers and students are not being equipped with the facial shields, but Dr. Hite made it appear as if these shields would be available to all. And the yellow tape debacle. The district purchased tape to section off areas and create directional arrows. It was reported the tape is contaminated with lead. All the tape had to be ripped up, the exposed areas cleaned, and now the work to reposition new tape has to start. Surprised? Not if you teach in the district. A painter coats the background with color. The classroom. The regulation requirements for the classroom are dismal. No rugs, no curtains, no stuffed animals, no comfy chairs, no shared manipulatives, nothing hanging from the ceiling, nothing hanging from the walls. Items can only be hung from a corkboard, and that is it. A bland, unstimulating, uninspiring background to teach in and thus learn in. Remember, primary students are returning. Primary students in which research states need stimulation, visual and tactile learning materials, and a welcoming, enriching environment. But that is not what they are returning to. More like a blank piece of paper. The main subject of the painting, the academics. Parents are expecting school to be just like it was. That, too, is an illusion. Students are separated from each other 6 feet apart and thus separated from the teacher. This setting does not allow for socialization. The in-person students will compete for attention against the virtual students as the teacher stands close to the computer the entire time, taking on 2 jobs, basically teaching 2 classes. Teachers are not to touch students, so gone are the days of hugs, tying shoes, zipping jackets, and on and on. All as our 6-year-olds are expected not to get close to their friends or their teacher. Students returning still submit to using their Chromebook, but at a school desk now. How is this better? Finally, the details to complete the painting. This is the science. Many speak that children are at low risk, but children are not the only ones entering the buildings. Adults are returning, and in some schools, more adults than children. Some schools have 30 or less children signed up, and yet every staff member associated in any way with pre-K through 2nd grade is to return, putting adults at risk. How much of a risk is acceptable? I believe putting anyone at risk is too much. The vaccine is within reach. Waiting for the vaccination of all staff members would be the responsible and respectful thing to do. And so the district has created an abstract painting that, when examined, does not make sense on many levels. A safe return is a guarantee that no one will contract the virus from being inside a school. Teachers want to return, but when it is safe for all stakeholders. The distrust of the district makes it extremely difficult to believe the reopening plan to be safe. The finished reopening picture will be displayed for all to judge, especially if one person gets sick or worse, a life is lost because of this reopening. Thank you.
Thank you very much. Thank you for your testimony.
Thank you. I'd just like to appreciate all participants and remind everyone to please keep your testimony to 3 minutes. And we have a lot of people still to get through, and appreciate your time and consideration. Up next, we have Anna Pern.
Hi, good evening. Hi, Chairwoman Yim and Council Member Quinones Sanchez, and members of the committees on Children and Youth and Education. My name is Anna Pern. I'm the co-founder of the Chinatown Disability Advocacy Project. I'm a district parent and chair the Education Committee for the Mayor's Commission on People with Disabilities. Thanks to the advocacy of the Teachers Union, elected leaders such as Councilmember Kim and Brooks, families, advocates, and teachers and staff who serve students will get vaccinated. The district has now pledged to provide PPE and rapid testing. Despite these victories, which will benefit everyone, people commenting on social media have accused our teachers union and advocates of being anti-science, emotional, lazy, and opportunistic for calling attention to longstanding unsafe school learning conditions. I want to share with you a snapshot of what these conditions are like. In December 2019, I testified to the Philadelphia Board of Education about conditions at my son's school, Stephen Girard Elementary. At Girard, just 3 rooms have air conditioners. One of them is the library, and that's only because the books began to get moldy from humidity. The school used box fans for cooling, and at back to school night, my son's teacher gave me a class schedule which listed cool down as a 20-minute scheduled activity. The teacher explained that the school gets so hot, the autistic kindergartners must be taken to a conference room where they literally cool down. The fact that my son and his peers and his teacher missed 20 minutes of instructional time every day to literally cool off is unacceptable. Well, Girard never received the updated electrical wiring to enable a modern HVAC system to be installed. And when it was time for families to select hybrid or remote learning options, our ventilation reports were not completed. School team members had no information about mitigation strategies for our students who are simply unable to wear masks or social distance. Now, the Philadelphia Department of Public Health has data on neighborhoods and zip codes with the highest incidence of COVID-19 disease and death during the pandemic. Girard is in one of those zip codes, 19145. So when Black, brown, and disabled adults and students are more likely to die from COVID than others, context does matter, and we must use all the data available to work towards equitable and safe school reopening. Dr. Hite has stated that students with complex needs learn best in person. There's no question that remote learning has been difficult for historically excluded students. After schools closed due to the pandemic, the Mayor's Commission on People with Disabilities, in partnership with the Mayor's Commission on Asian Pacific American Affairs and the Mayor's Commission on African Caribbean Affairs, convened a town hall on educational equity, where we heard from students and families about their challenges with remote learning. Students with disabilities who normally received one-to-one aids could not get them in person. Essential worker parents had to serve as their students' aides. Speech and language pathologists and other related service providers had sprawling caseloads of 60 students. English learner students and families could not understand changing learning platforms and English-only school documents, and they reported receiving less synchronous instruction than schools with more white students. Parents with disabilities did not know how to make reasonable modification requests, as the district hasn't articulated its ADA policies beyond requesting ASL interpretation. These problems persist. Students with disabilities and families are told that there's simply no data available about their students' progress, or in some cases, they're told that the data shows their students did better than ever under these conditions. Worse, we're hearing from families that they are being marked truant and reported to DHS, which puts families of color at risk of family separation and the school-to-prison pipeline. Although remote learning has had its pitfalls, it is troubling to see students with complex needs used as a wedge between teachers and families. We should all question why students with complex needs must return to potentially unsafe learning conditions and risk exposure to the virus in order to receive the same educational opportunities as other students who can choose to remain fully virtual and safe from the same risks. Is this equity? What is the district doing to improve and individualize learning for students with disabilities and other groups? While federal funding may address COVID-specific issues, it is vital that we work together to address longstanding equity issues which do stem from systemic racism and ableism. And instead of gaslighting school communities, I ask health leaders, elected officials, nonprofit leaders, and other experts to center the school communities closest to the problems, including those families and advocates, and amplify our demands for a more transparent process and plan to create equitable capital investments across our district. Thank you.
Thank you so much, Anna, for your powerful testimony. I think we really appreciate all the work that you do on behalf of multiple communities and also naming a lot of the issues that I think many communities have struggled with in terms of getting answers and ensuring that their children are cared for, whether learning remotely or in person. We're pushing forward on a bigger vision for what our schools can be, and we just really thank you for all of it. I want to thank all of the testifiers. I'll ask if there are any questions of our committee members from this panel.
We also have Stephanie
Morera
has reconnected, chairperson.
Yes. My apologies, Ms. Morero. Please, if you could just state your name for the record and continue with your testimony. We look forward to hearing it.
Hi, my name is Stephanie Morero.
Good evening. Please proceed with your testimony and feel free to turn on your video if you feel comfortable.
Hi, how are you? So, I'm a mom of 3, and my youngest son Parker is 7, and he goes to Richmond Elementary. He is also autistic. So, my whole concern is the ventilation and the one-on-one that he's going to need, and trying to decipher the ventilation report is so mind-boggling because I can't get answers, for all this. But when my son started in kindergarten, he already had the difficulty of social anxiety and his sensory disorder. He slowly learned how to get into a routine, and then it was abruptly stopped because one of the asbestos and lead, and the school's closing down now because of COVID, and he's been home. He has digressed so much. I am all for the kids going back to school, but only when it's safe. Safe for the children and safe for the staff and educators. Now, you know, putting in these $10 window fans isn't going to do the job. You know, Jerry Roseman had stated that these fans are not for commercial use by any means. They're not supposed to be running in the rain or the snow. Now they're held up by plywood and duct tape. In what universe is that acceptable for our children and our educators to do such a thing? Now, the classrooms are reading 43 degrees and under, which is terrible. So the children who aren't allowed to wear hoodies and jackets in class are going to have to. And what are the classrooms going to read after they're at their desk? They can't hug their friends. They can't really talk to anybody because they're wearing a mask. They can't get up from their seats, as, you know, another parent had stated. And it's very frustrating. You know, now I'm immune compromised because of my health. Now, what happens if my son comes into school and he may test negative, but somebody else tests positive? I still have to quarantine. My son's going to have to quarantine. My other children are going to have to quarantine. I don't have a big enough house. My husband still has to work. And it's very frustrating, you know, that you can't get answers from anybody. And I feel like I keep saying, oh, it's a temporary fix. It's a temporary fix. Well, how bad is doing these capital projects? You put a halt to that and you put proper ventilation systems in these schools and just do everything all at once and open all at once and just get the job done the first time and make it right, and not just keep closing down. Oh, 1 week here, 1 week there. No, just keep us closed, get the work done all in one shot and open in September and call it a day.
Thank you so much, Ms. Marrero, for your testimony. It's so important, and we appreciate it very much.
Thank you.
Thank you. For our committee members, are there any questions for this panel? Hearing none, thank you everybody, to all of our parents who spent time and waited to make sure that your voices could be on the record. Mr. Spiva, could you call the next panel?
Yes. Next we have Richard Gordon, Sharon Marino, Lauren Overton, and Michael Roth.
Good evening, principals. Thank you so much for your patience. We appreciate it so much, and really appreciate your voices to this conversation. Mr. Gordon, Principal Gordon, welcome. If you could just please state your name for the record, and you may proceed with your testimony.
Principal Gordon, I believe you are muted currently.
I am. My apologies.
And feel free to turn on your camera. Wonderful. Great to see you, Principal Gordon.
You as well. Richard Gordon, Principal, Paul Robeson High School. And again, thank you, Chairperson, for this opportunity. Thank you to all the members of City Council. Since it was noted that high school reopening is problematic at this time, I'm here in support of my K-2 colleagues who have some clear concerns regarding school opening plan and how it's being rolled out. It is so great to hear City Council's focus on ensuring that the public trust and transparency is to be shared with all stakeholders. It's always been the concerns of all of us about the poor working conditions that we work in every single day, with documented problems of our buildings that have a corrective cost in the billions. But today, our central concern for the principals of the School District of Philadelphia is that it's been very difficult for us to trust the process and have confidence in the plans that are being developed, given the conditions on the ground. And the only way we will be able to properly address this matter is to clear up a lot of the miscommunications, the misinformation that continues to exist as we navigate these issues. Please allow me to give you just a few examples. Dr. Rubin indicated that the worst is behind us, yet we hear from the Biden administration and from the CDC that this fight for control over the virus will continue until December. Athletic seasons have proceeded. I have a report for my own school building that currently rates my building as having zero occupancy, meaning that nobody's really supposed to be in there. But because the gym is the main location that was cleared, we now been directed to move forward with sports. Additionally, we are performing sports without rapid testing right now. Even though Dr. Rubin indicated that high contact sports like basketball provides high risk of transmission, but we are now in a position to do rapid testing for schools, for school reopening. And if I understood Dr. Rubin correctly, he indicated that ventilation systems are important and helpful, but not a non-starter for reopening buildings. However, he also indicated that other mitigating standards have to be confirmed, other mitigating circumstance standards that he has presented have not been confirmed nor guaranteed or available to city schools. In my recent work with the Environmental Protection Agency studying air quality in schools, there are serious concerns about the appropriate air changes in schools. How are restaurants required to have 15 air changes per hour, but with our current school conditions and the fan system that we're looking to implement, that will probably yield maybe 2 or 3 air changes in an hour. Pathogens will still circulate in the rooms up to 30 and 40 minutes. Now, I'm not a scientist, but I do know that there are a number of open questions about a number of legitimate concerns on all sides of this issue. CASA Local 502 does not wish to arbitrarily stop the school reopening plan just on a whim. We just want to acknowledge that we have an obligation to see that schools are open safely and responsibly. We cannot do this with so many open questions and concerns that prevents all interested parties in trusting this process. I believe in this I believe that in the planning and mitigating process, not only would we like to be more interactive with the scientists involved in this debate, we also believe that we should have more interactions and conversations with the principals regarding our position with regards to the conditions on the ground. CASA Local 502 would like to have more direct, robust collaboration with all decision makers to help us address numerous questions that have been raised by this process. As much as there are phone lines and websites to provide families and staff members with information, I can assure you that the principals at the schools on the ground will be the central and the most convenient hub of information for our staff members and our families. CASA Local 502 would like to ensure that we are well-versed and well-informed of the plans that we will be responsible for executing. We would like to have more input in a lot of these decisions. We would like to be more informed of the timelines regarding vaccinations. And we would like to be briefed on the clear science around reopening and how that science specifically applies to each and every one of our schools before we open. Whether it's a K through 2 or other grades, we want to have all this happen before schools are open. I can assure you that all the principals at CASA Local 502 do not have a preference for this virtual online learning platform. It's probably one of the most difficult tasks any of us had to engage in our careers. We would like to be with our students, and we are dedicated to them. However, we must insist in doing it safely and responsibly. We ask this body to please support us in helping us trust the process. Thank you, Chairperson, and thank you for this time.
Thank you so much, Principal Gordon. I just had a quick follow-up question. You said that your students are asked to be in high school, as high school students, they're allowed to participate in sports. Is that correct?
Correct. We're currently participating in sports.
Okay. And which sports are you playing?
Currently right now, basketball and track are currently practicing in the buildings.
Okay. And those are both indoor sports?
Well, unfortunately, because of inclement weather, track has to practice indoors because of the cold weather. And basketball, yes, of course, is an indoor sport.
Right. And you're saying that there's no offer or no plan in place for rapid testing of these high school students. Is that correct?
There is no plan for testing at this point. And to be honest with you, some of the testimony that I've heard this evening talked about students with asthma, and I'm concerned about the fact that students are being required to wear masks 100% of the time, even while they're playing.
Okay. This is very helpful, and we'll be sure to follow up. I also just want to acknowledge what a privilege and honor it is to have you on this call. I know as National High School Principal of the Year, it means a lot to have your voice, and we're just lucky to have you as an educational leader here in the city of Philadelphia. So thank you very much for your testimony.
Thank you as well. Thank you for all the support.
Thank you.
Next, we have Sharon Marino.
Hello, Principal Marino. Thank you so much. And if you could just state your name for the record, I look forward to hearing your testimony. Thank you.
Sure, thank you. Hi, my name is Sharon Marino. I'm the proud principal of McClure Elementary and a member of Teamsters Local 502 CASA. So good evening, everyone. And thank you, Councilwoman Quinones Sanchez, for your kind words earlier. That meant a lot, so thank you. My purpose for giving testimony today is to share my perspective of how we open schools safely and responsibly. About a year ago, McClure had just reopened after a long month of being closed due to imminent hazards of asbestos. After the closure of all schools in March, McClure was one of the few fortunate schools, because of the advocacy of the entire McClure community, to have all known asbestos removed, a lead-safe building, and our air filtration system cleaned and now fully operational. Our new tagline is that we may be one of the oldest buildings in the district, but we are certainly one of the safest. Unfortunately, my colleague just a few blocks away can't say the same. His building still has potential hazards and a dysfunctional vent system, meaning his entire building has the window fans that, when operating, make the classrooms 55 degrees. How is his community to return in a week? And sadly, his story is more common than mine. There is great concern amongst principals that we have reports where occupancy numbers are not aligning with spaces, that there are rooms missing. There are questions around the science behind the fans, and if the air balancing was done with the screens on or off, and if the fans should blow air in or out as an exhaust, the positioning of the fans in terms of circulating the virus versus circulating airflow, and so on. We need to understand what happens if there is a working exhaust system in the bathrooms versus when there is not, and what should the occupancy be for the bathrooms. We need to know that the guidance that's being used to reopen schools is considerate of the local conditions and challenges our schools face. We need clarity. We need time. We need our rooms that were packed away for projects to be unpacked. And we need our dedicated and possum staff to support this work, but only once we have a full understanding of the reports, the fans, the ventilation systems, and the spaces we are working with. Principals and communities need more transparency from independent experts who can come into our buildings and help us to understand what these reports mean, work with us on viable solutions, and come up with contingency plans when there isn't one. That is what we need to reopen safely and responsibly. Thank you.
Thank you so much, Principal Marino. And thank you also as well for just laying out some really clear guidelines that help so much. Thank you.
Next, we have Lauren Overton.
Good
evening. Thank you so much for having us here tonight. I have been really excited to hear from other folks, and I think that this has been so drastically needed. So thank you, Helen, and to all of the committee folks for putting this together. That really means a lot. So my name is Lauren Overton. I am the very proud principal of the Sadie Tanner Mosel Alexander University of Partnership School, better known as Penn Alexander. COVID-19 has exacerbated the longstanding systemic racism that has negatively impacted Philadelphia's children and families for generations. Before the pandemic, access to a free and appropriate education comes at a risk to our children and staff due to the presence of asbestos, lead, and mold in conjunction with decades worth of deferred maintenance. I am far too familiar with this risk as one of my dear colleagues was diagnosed with mesothelioma after being exposed to asbestos for years in the William Meredith School. Before moving to a safe opening, we need clear, concise, transparent, and timely communication regarding each school's status. We are currently asking staff and family to adjust at a minute's notice in regards to childcare and work schedules, where suburban districts and counterparts plan longer onboarding that allowed for families to make such arrangements in a timely and considerate fashion. At Penn Alexander and many other schools across the district, we continue to have questions about the safety of specific rooms as the reports list inconsistent variables. You know, it's one of the things that we teach our children in third grade science, that when you are measuring for outcomes, you have to keep the variables consistent. We need to understand the collective data from each of the individual schools, and we must invite all stakeholders to the table when planning the return. We need the support of not just the medical professionals, but also environmental scientists like Jerry Roseman, who can weigh in on the intersection of safety protocols and school conditions. Currently, there are no studies of schools or systems that match our circumstances. When we point to studies in Europe and the affluent suburbs, we cannot logically make the connections given the circumstances needed to gain the public's trust. I encourage us to look deeply at the data of who opted into this model. Overwhelmingly, principals have seen that most of our marginalized families have not chosen to send their children back to school. So in that regard, I have to ask, who are we opening for? We need to center our most vulnerable and design with those at the margins in mind. When we design for folks at the margins, everyone benefits. We need to fix our schools and take a genuinely collaborative approach moving forward. I also want to just add that there's discrepancies across the board when it comes to some of the things that were mentioned tonight. For instance, our sinks are not touchless. You have to turn them on. What we do have that is touchless in the building is water filtration systems. And so the variability from one school to another really makes mitigation efforts difficult to keep consistent because of the differences amongst the buildings. So I thank you for your time tonight, and I appreciate your advocacy for safe and healthy school reopening.
Thank you so much, Principal Overton, and thank you for your leadership.
Thank you.
Final testifier on this panel is Michael Roth.
Good evening, Principal Roth.
Hello, City Council and all members of this hearing. My name is Michael Roth, and I'm the proud principal of Olney Elementary School and a member of local CASA 502. In addition to being the principal of around 900 of the most amazing students in the world, my own 3 children also attend Philadelphia Public Schools. As I look at our school's stagnant data and hear from my wife on the daily, I know how important it is that we get schools open as soon as possible. However, I also know that this is something that we must do carefully and safely because the cost of getting it wrong has consequences that are too dire. I'm not an expert on ventilation, epidemiology, or virology. However, I do know that the fact that we need to have a hearing today about getting proper ventilation for our precious 5- and 6-year-old children here in Philadelphia borders on criminal. Criminal because we are the richest nation in the world. Criminal because improper ventilation is just one more insult in the growing list of educational inequities in our nation. I will admit, probably like most of you, proper ventilation was not at the forefront of my mind when I thought about the resources we need to help close educational achievement gaps. However, after the asbestos and lead issues we experienced over the last few years, and now COVID, proper ventilation should now be high on the list of all educators who care about educational equality and educational justice. I cannot help but wonder now how many educational school days were lost for students in our city over the last 5, 10, or 20 years because of poor or no ventilation in some of our schools. I have been back in the school building over the last few months and desperately want to get our children back. At the same time, I think we need to sympathize with the frustrations and anxieties of our staff who have experienced firsthand some legitimate safety issues around asbestos and lead. My ask to this council, our elected officials, and school district leadership is that we make sure we get this right, that when we send staff and students back, we can say proudly that we would feel okay with our own children or family members going into that space. The last thing I want to say is this: good principals take the safety of their school communities very seriously. During a recent union meeting, the principals took a vote, and the overwhelming majority of school leaders felt that schools should not reopen until we can provide all staff the opportunity to receive a vaccine and have that layer of protection for themselves and their families. Chairperson, thank you. Thank you for your time today.
Thank you very much for your leadership, Principal Roth, and have appreciated your call for us to really live up to our highest standards for young people. Thank you so much. I just did want to ask whether there are any questions from the committee for this panel. Hearing none, I want to thank all the principal leaders who are on here for your tireless work, and look forward to continuing to press the district on your questions and making sure that we have clear protocols and a safety standard that we can all be proud of. Thank you, everybody. Mr. Spiva, can you please call the next panel of witnesses?
Yes, on the next panel, we have Shakita Gaines, Stephanie King, Priscilla Lowe, Krista Wilson, Shauna Williams, Jennifer Lehman, September Fisher.
Good evening, everybody. Thank you so much for your patience. If Ms. Gaines, if you could just state your name for the record, and you may proceed with your testimony, and feel free to turn on your video camera for the public. Thank you so much.
Shakita Gaines. Good evening, everyone. My name is Shakita Gaines. I am the president of the Philadelphia Home and School Council. I am a mother of 4 brilliant children. One that has graduated from a Philadelphia public school, another that has graduated from Cyber Charter. For full transparency to my parents, my 10th grader receives his education at a Cyber Charter, and I have a restart button who is 7 years old, who was supposed to be registered for public school this past fall, but because of COVID-19 and my mistrust with the district, he currently remains in homeschooling and will do so until September, but only when it's safe. Please note that I believe in our public schools, but not in their systematic racist practices that happen in urban communities because people believe that we are going to take it. I believe in public school teachers, but not in their curriculum pushed down by the government that calls for more standardized testing and not actual learning. I believe in Philly, but the way these Family Dollar household fans were placed on cheap plywood, you're leaving me with no choice. I must fight, and trust me, it's not going to be pretty. I'll be here for at least another 12 years. My reason for testifying today are simple. Our schools are unhealthy, and it has been since I went to school here in Philadelphia, and the silencing of parent voice and parent choice. These things are not uncommon in Philadelphia schools. But now that we have an extra layer of uncertainty caused by this pandemic and plastic fans and windows during the winter, Philly is exposed and the country is watching. Even after rallies, the marches, the protests, the School District of Philadelphia decided this morning that they will push back the hybrid date to March 1st. Again, we say no. Their numbers are wrong. 9,000 children may have registered for hybrid in November, but we are now in February, and their Philly special has gone viral. Parents have changed their minds. Even if the numbers were right, the idea that it's okay to skim back only 6% of students and not 100% doesn't look right to the outside world, nor does it feel right to families in need. It begins the conversation again here in Philadelphia about the haves and the have-nots. Doesn't it go against the goals and guardrails outlined by the district? The reason why certain schools couldn't get playgrounds after they raised the money for it? Because all students could not benefit from it? I'm confused. CHOP has done a job coming in, giving data, changing their mind, giving data, changing their mind, etc. My question to them is simple. Have you seen a decline in children being rushed to the hospital for asthma-related symptoms since schools closed? We need that true data, not COVID-related. In closing, many schools have zero ventilation. And since the last couple of snowstorms, some of those fans may be broke. Ventilation testing was not conducted in bathrooms, attics, or boiler rooms in any school. These are the same spaces not tested for asbestos, mold, or lead. I stand with the 81% of parents who say no to this reopening plan and want to continue to find ways to service the families who have no other options. Thank you.
Thank you very much, Shakita. Thank you, Ms. Gaines, for your leadership as Home and School Council leader. We appreciate you.
Next, we have Stephanie King.
Good evening, Ms. King. Thank you so much
hello.
for your patience. Thank you.
Sure.
Welcome.
Good evening. My name is Stephanie King, and I'm the president of Kearney Friends, part of General Philip Kearney Elementary School in Northern Liberties, where my son is the first grader. I want to thank you for holding this session, and I want to thank the teachers at Kearney who put out a superhuman effort this year. I want to ask the members of council, would you go skydiving with an instructor who had lied to you and ignored your safety concerns over and over again? Would you trust him to take you up in a lead and asbestos-filled plane that was piloted by people who turned off their headsets whenever you questioned them? Yet this is what the Philadelphia School District is asking us to do, to entrust the health and safety of our children to a plan given to us by a superintendent who is known to sweep safety issues under the rug, and a school board who is determined not to listen to our voices. The fundamental issue in school reopening is that parents' trust in the district is completely broken, and Superintendent Hite wants to break that last fragile thread for a reopening that almost no one wants. Maybe the janky fans stapled to plywood are sufficient for ventilation. Maybe the district has finally learned how to supply classrooms with supplies and bathrooms with soap. I don't know. What I do know is the district can't be trusted as far as I can spit. They couldn't even manage to get the tape right, somehow finding the only rolls of lead-infested tape in existence. Parents are telling you what they want. They're speaking with their feet by declining to sign their children up to return, and they're speaking in the street, standing with their teachers across Philadelphia. The school board says they don't need to revote on a plan that was already approved, as if the date of implementation is not a major detail of any plan. They didn't ask because they only want to hear the voices that agree with them. They want to pretend that this is an overwhelmingly popular demand, but only 30% of eligible parents signed up. They say we need more voices or to prioritize new speakers, but when we deliver those new voices, they don't like what we're saying. The voices elevated at Hite's press conferences keep coming from people wringing their hands about learning loss or achievement gaps. But I never saw them worried about my school when we were having our teachers cut from us every year, or I was fundraising for paper the district failed to supply. Now they want to march our teachers into the building for only 20 students. And my son stands to lose his teacher to reassignment that has to take place for adequate classroom coverage. I have never, in the whole time I've been doing this, seen principals, teachers, and parents so united in agreement on anything. This reopening plan is unsafe and rushed. We need to do better. Thank you.
Thank you so much, Ms. King, and thank you for your work at Kearney. Thank you.
Priscilla Lowe.
Good evening, Ms. Lowe. Thank you for your patience. If you could just state your name for the record, and feel free to turn on your camera and proceed with your testimony.
Good evening. My name is Priscilla Lowe, and I'm a parent of a fifth grader at McCall School in Center City. Thank you so much for the opportunity to testify before this committee. There seems to be three stakeholders in the school reopening conversation: teachers and staff at the school district, taxpayers who fund the schools, and children who attend the schools. The union represents the teachers and the staff, the mayor represents the taxpayers, but who here represents the children, arguably the most important of the three? Why are parents the least important stakeholders in these conversations when the sole purpose of schools is to educate our children? Children are bearing the brunt of the pandemic due to prolonged school closures and now suffering academically, mentally, and physically. The number of failing students increased by as many as 2 to 3 times. A McKinsey report found that full-time online learning does not deliver the academic result of in-class instruction. The toll on our children's mental health is staggering. The CDC found that the proportion of ER mental health visits were up 24% for children 5 to 11. School closures are linked to an increase in anxiety and depression among children. Pediatricians continue to advocate for in-school learning and warn that virtual learning puts young children at significant risk of obesity, type 2 diabetes, and asthma. Families with resources are fleeing to private schools in the suburbs where schools are open. Remote learning is not effective and is widening the disparities between public and private school students. Studies have also shown that students of color, economically disadvantaged students, English learners, and students with special needs are suffering the most from school closures. At McCall, which covers Chinatown and 2 homeless shelters, 60% of students are economically disadvantaged and 21% are English learners. Most of these children have parents who cannot work from home to support remote learning. They are either staying at home without any adult supervision or placed at daycare centers. Failing grades are also concentrated among these students. McKinsey found that Black students will average 2 to 4 months behind white students and stand to lose up to $87,000 in lifetime earnings because of this learning loss. So what message are we sending to our children when restaurants and casinos and other discretionary businesses are open, but schools aren't? Why should we value our children any less? Look, my husband is an essential worker, and he's been working throughout the whole pandemic. So I appreciate the anxiety and fear that the teacher and staff are feeling. There is an inherent risk in everything we do, but the benefit of opening schools substantially outweighs those risks. There is overwhelming scientific consensus that it is safe to reopen schools. Let's not forget the multi-layered safety strategies that Dr. Rubin talked about earlier today, where ventilation is only one of them. 57 out of 61 school districts in the Philadelphia area are open for some form of in-person learning despite having infrastructure issues. Remote learning should be Plan B, not Plan A. No plan will ever be perfect because COVID will not go away and we will need to learn how to live with it. We cannot let our most vulnerable children and their future to be another victim of COVID. The sooner we open our schools, the faster we can close the equity gap in education. Thank you.
Thank you so much, Ms. Lowe. Thank you.
Krista Wilson.
Good evening, Ms. Wilson. Thank you for your patience.
Oh, thank you. My name is Krista Wilson, and I am a first grade teacher in the Philadelphia School District. And currently at this time, I do not feel safe returning to the building. So the district has decided to put in fans, open the windows, and crank up the heat, and this will keep us safe. The district has stated that the classrooms will be between the temperatures of 64 to 68 degrees while implementing this plan. Many of us that worked in the district, we've experienced classrooms that do not maintain these temperatures before COVID. I've worked in classrooms that read 104 degrees when I walked into the classroom. So how can we expect this to be achieved now? I'm not an expert in airflow, but I do know that running a fan in the wintertime will make our classrooms cold. The transparency of the district plans are very limited to teachers. We learned that we would return to school back when we were originally told to go back on February 8th from a Facebook. The district informed the public before we were officially informed. We also need to search for updates on the news and social media as opposed to having a clear, concise explanation on building conditions from the district. On February 11th, Dr. Hite stated in the Philadelphia Inquirer that I can confidently say that our schools are ready to open with our proper safety protocols in place. On the same day, Chalkbeat noted that Dr. Hite suggested that some school buildings could open to students, while others may need to improve their ventilation systems and will remain closed. It's now February 17th, and the staff, the students, and the families are still not aware which schools he's speaking about. Where's the transparency from the district when it comes to what buildings are safe? So basically, we were told by the district that all K-2 teachers and staff members that support them were expected to report to our buildings on February 8th. And a few days later, he's saying that some schools may not be able to reopen. If our union did not tell us to stay home, would the district have sent us home if we were reported to an unsafe building? We can't be sure of that. So the concerns and the health of the teachers and the students that report to those buildings without proper ventilation are very up in the air. I feel that the city of Philadelphia has stricter regulations for restaurant openings rather than our schools. Ventilation is restricting a restaurant where you spend an hour or two to eat one meal for indoor dining compared to a classroom that a child will spend 7 hours a day in and eat 2 meals in. So according to 6 ABC News on 2/16, the city will only allow 25% occupancy to restaurants and have only approved 5 out of 41 applications to open fully due to ventilation issues, yet the city's fine with fans as ventilation for our students and staff. So where's the consistency and the science in these two matters? Additionally, comparing Philadelphia public schools to wealthier suburban districts that have opened to a hybrid model is not fair to our students and staff. Other school districts have installed air purifiers. They have newer buildings, newer HVAC systems. They did not have existing issues such as asbestos, lead paint, and mold. And comparing our district of installed residential fans to move the air compared to other districts and their opening plans is not equitable to our students. Lastly, the district is now looking into getting the teachers vaccinated, and this is greatly appreciated, but there is the wonder of why this was not a priority before on the many times that we've been pushed to go back into the building. We've waited this long for a vaccine to become available. Why are we now rushing to get the K-2 back into schools when we haven't been vaccinated yet? Less than 20% of my school's K-2 students are returning. None of the autistic support students or the special ed students have opted to return to the building due to safety concerns. We have teachers that are coming into the building to literally sit on their computers and teach children at their homes. Pre-K-2 teachers and families are concerned that we were chosen as the target sample group to see how the district does with dealing with COVID and opening schools. Why should we be the test subjects and the district not have a clear plan that keeps us safe? In addition, teaching 2 separate groups of students, hybrid, in person, and then we also have our students that remain digital at all times, seems to disrupt the learning more than returning before a vaccine. The district hasn't even thought about the fact that teachers spend an awful long time putting in procedures and routines into place when children return to school. We'll be doing that with a small group of students while also trying to teach digital students at home. Students are going to be very disappointed when they arrive to school and find that it's not going to be what it was when they had left last year in March. They'll have to remain in their seat in a cold room. They're not allowed to leave. Their specialists will come to them. They will eat their breakfast and their lunch in their rooms. And I'm truly worried that students will begin to not want to attend school, and they're going to lose their love of coming to school. Lastly, I just feel that it's very disrespectful that a vaccine is out, but the district will not wait until we get ours and allow us to return safely and more normally. Thank you.
Thank you very much for your testimony. Thank you, Ms. Wilson.
Thank you.
Next, we have Shauna Williams.
Good evening, everyone.
Good evening, Ms. Williams. It's such a pleasure to see you.
It's a pleasure.
Thank you so much.
Thank you. I think I brought my camera on. I don't know if I did or not, but it's okay. If you can hear me, that'll be fine.
You look fantastic. The glasses are fabulous. If you could just state your name for the record and proceed with your testimony.
Yes, and again, thank you all. My name is Shauna Williams, and thank you for taking the time to hear what we have to say, especially going over our time. I will make sure that I will adhere to the time. Thank you again. I come before you not with just the why, but with a thought-out solution of until. I am Shauna Williams. I'm the representative for the Paul Robeson High School for Human Services, parents, community, and friends. We stand firm as we say it's premature to open the buildings if it is unsafe and unstable to return until the transmission rate of COVID-19 has dropped significantly and vaccines available to who wants it have been made available to all school district employees and staff. Lest we not forget, buildings remain unsafe with widespread asbestos, lead, mold, and poor ventilation. These toxic working conditions have yet to be meaningfully addressed, and with a fan in a window not being the answer. In addition, taking testings once a week with medical concerns of issues are we going to create as doing that by taking a stick for testing weekly to the staff. What our students need most is for the pandemic to end. The COVID-19 pandemic has been devastating to poor and working class communities. As government responses continues to fall to address working people, systematic racism has forced our city's Black and brown communities to bear the brunt of these failures. We need a government response that keeps people in their homes, kept people fed, and keep people paid, instead of relying on schools to address this multiple crisis caused by COVID-19 on their own. A premature, unsafe reopening the schools, keep in mind, to adhere to abiding to the rules of safety and health to avoid spreading COVID-19, instead of prolonging the suffering of staff, students, and families. We should take it seriously, the duty to protect our students, families, and staff from the coronavirus and environment hazards. If the city government can make preparations to what is needed to reopen their restaurants and companies for the safety of the public, in addition, even considering staying home is best, why can't we have that same support, drive, and that same passion and care for our educational system? Reopening schools, meaning students, parents, families, members, and educators will, unfortunately, pass away. We support any individual who chooses living over dying. Therefore, refusing to return to school buildings and expecting the school district to not retaliate and its district avoid the crisis in the makings, we need to ensure the vaccines are made available again to all who wants them to have that provided and available to them before they reopen the school is considered. And the only question that I really wanted to ask to them, if I may quickly ask, is we want to make sure that we don't blame that COVID is the reason why the rate crimes is going up because people are home. We have to also still consider the situation at hand where the community is at hand and they're home, unbeing able to take care of their homes, that is causing this pandemic, not the virus. The virus is the pandemic, but the conditions that is causing it. We're not working, we're not feeding our families, we're not receiving the money that we need to do what we need to do, and you keep coming back and forth with the, okay, we're going to do this, okay, no, we're not going to do this. That's what's causing the issue, and we need to take that into consideration and not make that the school's priority to take care of. Secondly, we do not want to make it the fact that we're sending our kids back to be guinea pigs on what to be done. You sit here and you say we start off with 900, then we're going to build up to 1,000. What happens when somebody does come back positive? That person has to come back positive. They're going to go back home. Those people got to be contacted. The people that they were with have to be contacted. It's going to cause a domino effect that is going to be very deadly, and we do not want to do that. So again, I thank you so much for your time and staying late with us. Again, Madam Chairman, thank you.
Ms. Williams, you've been a wonderful supporter. Robeson High School is lucky to have you, but I appreciate your testimony and for putting all of this on the record. It means so much. Thank you.
And you guys mean so much to me, and always know once a Husky is always a Husky, and we're always available and ready for you guys to assist, because it's not about us, it's about our children.
That's right. Thank you so much. Thank you, Ms. Williams.
Bye-bye.
Thank you. I would just like to reemphasize for future testifiers, please keep your testimony to 3 minutes. I know you've been waiting a long time. We have a lot of parents who still are hoping to testify, and just by keeping to 3 minutes, you help ensure that everyone will have an opportunity to share their piece. So thank you for that. Up next, we have Jennifer Lehman.
Good evening, Ms. Lehman. Thank you so much for your patience. And please state your name for the record and proceed with your testimony.
Sure. Good evening. My name is Jennifer Lehman, and I serve as the coordinator of the Carnell Family Resource Center on behalf of the Oxford Circle Christian Community Development Association in Northeast Philadelphia. I just wanted to add my voice to the many voices that are speaking out about the current decision facing the school district. My brother is an educator in Pittsburgh School District and wrote these words to his union leadership this morning, and I echo his sentiments. I am encouraged by the progress in Chicago. As of now, it appears that they have worked out the return or option to return to the classroom for all K-8 students by March 8th. I know that was a challenging and lengthy process, but in the end, all sides agreed to the terms. I also know that the city, the board, and the union all had to give to get that done. I know that took courage from our brothers and sisters at the Chicago Teachers Union, who both won some things in the negotiations and lost some things in the process. This is a hard time, but I'm encouraged by everybody who is fighting forward through this hard time. This week, I read the piece in the Times magazine about Rhode Island's decision to stay in school this entire year. The challenges are absolutely real, and they are many. The fears are real, and the anger is real. I also read about their union boss and her belief that we can do this, and the growing pile of evidence that comes from the health community that we should be back in school, or at least provide the option to families. While my kids are finished at Carnell, I am still a parent of 3 school district students. I know there is nowhere near unanimity of opinion among district parents about whether or not it is safe to return, and in writing this, I'm speaking for myself. But in operating a learning pod for our elementary students since September, I've seen firsthand the effect of virtual learning, and my question is it safe to not return? The educational losses that have happened over the past 11 months are monumental, and many of our students were already behind academically before the pandemic began. We've seen private and parochial schools in Philadelphia return to in-person learning with some success, and I wonder why that can't be the case for our public school students as well. No time or place will ever be fully safe to return, but the science seems to be clear about the relative lower risk of returning to school. Frankly, I find it exhausting to hear the dichotomies being put forth by the teachers union right now, as if there are no middle ground, as if there are not tens of thousands of residents all over the city who have been working in person since the pandemic started and for whom the childcare dilemmas brought on by school closures have been impossible. I also think someone needs to be talking about the inequity that's happening on a national level with what this pandemic has illuminated in education. That white, largely suburban kids have choices and Black and brown kids in urban districts do not. So my question is it safe to not return? I believe our road to recovery will be a tough one, but I believe there's still time. With committed teachers and parents, this work can be done. I am sure you've heard all of this, that although virus cases may be dropping and vaccinations are slowly happening, this will not completely eradicate the virus. So we must make some hard decisions for the benefit of parents, our children, and teachers. I think we need to choose our hard. The fear of returning to schools, spread of virus, less than perfect ventilation systems is hard. The amount of academic and emotional distress and the ever-widening disparities between students who have returned to in-person learning and those who have not is hard. We need to choose our hard. I just want to again add my voice to the group of folks that are saying, let's stop with the reasons why we can't and look more at the larger pile of reasons why we can. Thank you.
Thank you so much, Ms. Lehman. Thank you for taking the time tonight. We appreciate it.
September Fisher.
Good evening, Ms. Fisher. Thank you so much for your patience. And if you could just state your name for the record and proceed with your testimony, and feel free to turn on your camera as well.
Hi, good evening, everyone. My name is September Fisher. I am a mother of 2 school district children that attend Salas Cohen Elementary. My name is September Fisher. I'm a wife of 2 school-age children. My daughter is in the 5th grade and my youngest son is in kindergarten. Like most parents, 2020 has been a turbulent year for our family. We are a 2 working parent household. When the pandemic hit, like most parents, it was a struggle to maneuver our kids around. Since the 2020 school year started, we have tried several avenues to help both of our children with virtual learning. It has been a very stressful year for the both of them, especially for my youngest son. We have tried many options in an attempt to help him adjust. I have adjusted my work schedule to work from home to help my son. We have paid for aftercare services at his previous preschool. Also, I have had a family member come and sit with him. Nothing has been successful because it all comes down to my child's needs as an individual. My kindergartner is doing his best to adjust to virtual learning. However, it is a true struggle to get a 5-year-old to sit in front of the computer like an adult for 6 to 7 hours a day. It is imperative for his development at this age to have in-person learning. For my family, having my child attend school is not only imperative for his learning and development, it is necessary because my husband and I are both working parents. My job will no longer allow me to make any more adjustments, and my husband does not have options to adjust his schedule. My son is 5 years old and in kindergarten, and he has had a breakdown crying on several occasions. He is very bored on the computer and it's very hard to get their attention to just sit. He does know the basics, ABCs and 1, 2, 3s, but he needs in-person learning now. Not only for his learning and development, but for his psychological development as a human being. I am finding it very hard to believe that other school districts can make it work while teachers within this district has been discouraging families from sending their children back to school for face-to-face learning. I feel like his teacher has been trying to discourage us from letting him come back. I have several messages go back and forth with her, and she says, oh, well, it's only going to be one in his class. Do you still want him to come back, yes or no? Or he's only going to be the only one there. Everyone else changed their mind because they don't feel safe. Do you still want him to come back, yes or no? His teacher does not get the fact that he needs independent learning, and her job as a teacher is to be concerned with the student's needs. At this stage and phase in his life, it is very imperative to have face-to-face learning, and what other parents decide in his class should not be discussed with me. My husband and I have thought long and hard about our decision about letting him come back because he has a mild case of asthma. So there is a risk that we're taking, but we agreed for his learning development, he needs face-to-face learning, and I don't want him to fall behind. Regarding my oldest child who's in the 5th grade, she's been going through stress and deserves to be in school too. But the difference is my 10-year-old is an independent and smart enough to tackle the things she has to get through. This whole situation is forcing me to figure out another option for my child for the upcoming 21-22 school year, because like most parents, I want what's best for my children. I'm going to be forced to send my children to private school, and the thought of this frustrates me. Why do I have to find another option for my child? I'm a Philadelphia native. I grew up in Philadelphia. I work and I pay my taxes. So if I'm paying taxes, why do I have to find another avenue to get proper education for my child? I feel as though it's a slap in the face because the taxes are coming out of my paycheck every 2 weeks. If this still carries on throughout the school year for September 2021, that's a problem for me. This is all to say I can teach my child at home. I can help him, but I am not a teacher. I'm his parent. And the goal for me is to reinforce what he learned at school. But if he's not getting what he needs at school through a computer, where does that leave me as a parent? I can only do so much.
Thank you so much, Ms. Fisher. Thank you for taking the time and especially for waiting this long to put your testimony on the record. It's extremely important. And we also will be prioritizing your son's learning and his health and well-being as well. So thank you very much.
Thank you. Thanks for having me.
Thank you. Mr. Spiva, are there any questions for this panel of witnesses? I want to thank all the parents who testified tonight. We have plenty more. But I do want to thank this group of parents for your diversity of voices and opinions on this important issue. So thank you. Mr. Spiva, could you call the next panel of witnesses, please?
Next, we have Raymond Jackson, Tanya Edmonds, Kiara Coleman, and Maura McInerney.
Good evening, everybody. Thank you so much for your patience. We look forward to hearing from you, and thank you for being willing to put your voices on the record. Mr. Jackson, thank you so much for your work, and we look forward to hearing from you. So if you could state your name for the record and proceed with your testimony, and feel free to turn on your camera if you feel that you're able to.
Okay, thank you. Good evening, everyone. How you doing? My name is Raymond Jackson. I'm a building engineer and member of 32BJ District 1201, as well as an instructor for 32BJ Thomas Shortman Fund program. I and other frontline essential worker and members like myself are building engineers and cleaners in the school district. We have been in the buildings every day of this pandemic, keeping them maintained, running, heated, and safe in preparation for reopening. In my opinion, there are 4 things that are necessary in order for the school district to fully reopen safely during this pandemic. There needs to be a well-planned sanitation program with clear guidelines consistently followed. The clutter needs to be cleared from many buildings in order for anyone to properly and safely distance and disinfect the classrooms and common areas. There must be a full vaccination program that prioritizes the workers that are in the buildings every day or serving the buildings every day by interacting with students, teachers, and administrators. The building equipment and boiler and ventilation systems must be fully and properly operational for buildings to be ready for full reopening. In some buildings, this will mean building maintenance upgrades, buildings being fully staffed with enough maintenance, cleaning, and engineering staff to properly maintain each facility. Most importantly, for all members to work together each day and to make our buildings safe and clean for everyone. I believe my membership have been working hard, and I believe the Philadelphia School District will work just as hard with us to make it happen. Thank you.
Mr. Jackson, thank you so much for your powerful testimony. We really appreciate it. And I assure you, all members of our city council body are going to make sure that all staff members are prioritized. And we feel very strongly that, especially for all the work that you've put in, we appreciate you so much. Thank you.
Thank you.
We feel very strongly that, especially for all the work you put in.
Ms. Tanya Edmonds.
We appreciate you so much.
Hello, everyone. Thank you for giving me this opportunity. My name is Tanya Edmonds. I'm a daughter, a mother, and a grandmother. I have been a food service worker for 23 years. I live here in the Winfield Heights, and my grandchildren attend the school district of Philadelphia schools. This pandemic has changed our everyday activities for sure. As a food service worker for the Philadelphia School District, I have been going to work since the end of August. I protect myself every time I leave my home. I hear people saying that the schools are not safe. I'm a prime example. I go to work every day and then come home to take care of my daughter that has cerebral palsy. I follow all the CDC recommendations, and I have been fine. It irritates me that the people we, Unite Here, Local 634, have voted into office, or the school district do not talk about the food service division and how we are feeding thousands of families while giving out meals. We are also giving them activity sheets and learning package during the height of the pandemic. We are always left out of the conversation, but here we are very important people and are going to work every day to make sure our kids are fed and taken care of. We are here and have been here. We deserve to be heard and not left out of the conversation. We have families like everyone else. Our children attend the schools. We want to be safe. We want safe schools, and we want to be treated fairly. Thank you so much.
Thank you so much for your tremendous work, Ms. Edmonds. And as you said and pointed out, at such an early stage in the pandemic, you were delivering food to young people. We know what a journey that was, and so thank you for testifying. We have a very quick comment from Councilmember Gilmore Richardson. Councilmember?
Yes, thank you so much, Madam Chair. Thank you for the latitude. I've been here listening to all the public comment, but I wanted to take a special attention and say hello to Tanya Edmonds, my Winfield Heights neighbor. I'm also in Winfield, and I just wanted to thank you so much for your service and for the constant juggle you have dealing with young people in the district and working for the district. So I just wanted to thank you for your service from one Winfield neighbor to another. Thank you very, very much.
And I thank you for your remarks. Thank you so much, neighbor.
Yes, ma'am. Thank you. And thank you, Madam Chair.
Thank you very much, Council Member. Thank you very much, Ms. Edmonds. We appreciate you.
Next, we have Kiara Coleman.
Good evening, Ms. Coleman. If you could just state your name for the record and proceed with your testimony.
Hi, good evening. My name is Kiara Coleman. I'm with Unite Here, Local 634. So I live in West Philly, and I am a mother of 2 daughters. I have been employed by the school district for 6 years as a food service worker. When the pandemic happened, we were all confused and scared for ourselves and our family because no one wants to get sick from COVID. But unfortunately, I know firsthand how bad it feels to get COVID because I am a survivor of it. When the school district called us back to work in August, I went to work because I have to provide for my daughters and myself as a single mother. I had no choice. My fellow coworkers in food service have been serving meals since last March in school buildings when everything was closed down. We were also giving out learning packets to families when they picked up food. We want schools to be safe, and our union has been an advocate for safe schools. We again have been in these buildings doing our job because we know that we don't have a real role in virtual learning. We can't supply food from our homes, and we can't monitor children from our home. We know that without us, some students will go hungry. We had student climate staff in the building giving out laptops and learning supplies since school started. We go to work because we have to support our families. We adhere to CDC guidelines and take all precautions necessary to protect ourselves and our households. Food service workers and student climate staff are often forgot about in the eyes of the media and elected officials. We deserve not to be an afterthought when it comes to protecting workers. We all want schools to be safe and free from environmental hazards, but we also need our jobs. So like other workers across the country, we go to work, we mask up, and we remain socially distant, and we wash our hands because we are in a building.
Thank you so much, Ms. Coleman. And I'm so sorry for, I think that your testimony shows how serious we need to take all of this. And I just want to say thank you. Could I just ask a few very quick questions?
Yes, ma'am.
Did you receive, did your contract cover the sick leave that was required when you contracted COVID?
Yes.
Okay. And could you share a little bit about what your pay range is, the salary range for your position? You can speak generally. You don't have to speak specifically.
Well, for my specific food service or my specific position?
Food service or, maybe generally about where you are. I don't want you to feel obligated to share your salary, but maybe if you could just tell us a little bit about the range so we understand.
Well, our lowest paid work, I'll say that our lowest paid worker in our bargaining unit makes $14 an hour or $14.50 an hour, and our highest paid worker makes $20 an hour.
And how many hours a week are you obligated?
I work 6.5 hours a week.
Okay. I just want to express my gratitude again was a tremendous sacrifice. And again, I think your testimony is very moving, and we are taking it very seriously. And I appreciate you waiting this long to testify, because it's extremely important for all of us to hear. So thank you very much, and thank you for all the work that you did to keep people safe, and we'll be looking out as well. Thank you, Ms. Coleman.
Thank you. It was my pleasure.
Yeah, thank you. I'm a little bit floored, but again, with Ms. Coleman, it feels just very unacceptable that had to happen. And so, just again, appreciate it.
Next, we have Maura McInerney.
Good evening, Ms. McInerney. Thank you for being so patient, and we look forward to your testimony. If you could just state your name for the record and then proceed with your testimony.
Thanks so much for this opportunity. My name is Maura McInerney, and I'm the legal director at the Education Law Center, a statewide nonprofit legal advocacy organization dedicated to ensuring that all of Pennsylvanians have access to a quality public education. We advocate on behalf of students who are most underserved, including children living in poverty, children of color, children with disabilities, English learners, those in the child welfare and juvenile justice systems, LGBTQ youth, and students experiencing homelessness. Our advocacy aims to ensure that decisions made by policymakers, particularly serve the needs of all children, including those who are marginalized by racism, poverty, and academic needs that often further widen inequities. While the focus of this hearing has been on reopening schools, we also want to address the city's role in bridging the digital divide for children and families during this school year, which was also referenced in the resolution. This is and remains a critical issue that demands further attention, as currently a majority of children in the district, particularly youth in middle and high schools, may continue to be educated virtually for the remainder of the school year. And many of these students, particularly those living in poverty, children experiencing homelessness, English learners, students with disabilities, are continuing to struggle to access remote learning, communicate with teachers, receive the differentiated services and supports that they need. And we know students living in Black and Brown communities are bearing the brunt of these educational deprivations caused by COVID-19, as well as suffering from the severe impacts of the pandemic itself. The digital divide includes not only unequal access to computers and remote learning, but unequal access to the internet. It also encompasses information gaps on how to use technology and educational platforms, unequal technical support, the absence of caregivers to support remote learning, and the failure to provide differentiated support for limited English proficient parents, English learners, students with disabilities as well. We also know that there is a high degree of social and emotional stress and health issues that are being experienced by children engaged in remote learning and living in poverty. And we know that there are great disparities in the academic gaps between Black and Brown students and Latinx students. And one study indicates that while the average student could fall 7 months behind academically, Black and Latinx students are likely to experience even greater learning losses of 10 months and 9 months. First, Philadelphia has the second lowest internet access among the 25 largest cities. This issue has still not been fully addressed. We know that Black and Brown children are least likely to have the means to receive internet services, and ELC continues to receive calls regarding students who cannot participate online due to lack of high-speed internet and hotspots. It is a common problem for students experiencing homelessness, particularly those living in shelters and students who are doubled up. For example, one family shelter in Philadelphia serves over 200 people, including 100 students. And children are struggling to access remote instruction. 5 children, 6 children are sharing one hotspot, even though the recommendation calls for 3 devices per hotspot. And children who move around and live in different locations need additional hotspots or free internet services at each of their locations. It is an untenable situation that is leading many children to be pushed out of learning entirely. In addition to these access barriers, school discipline policies must change. Children cannot be punished for the noise in the background that they cannot control, and families should not be facing potential referral to family court due to COVID-related absences stemming from remote learning. We urge City Council to ensure the need for additional internet resources is being identified and that all families are provided with sufficient, sustained, high-speed internet access so that children can access remote learning. In addition, English learners are facing unique barriers, from logging on to navigating digital portals to meaningfully engage with the curriculum and receive effective language instruction in a remote environment. Too many of our English learners are still not getting through the virtual schoolhouse gate and are receiving no benefit and are not progressing. Moreover, following multiple absences, some of these students have been removed from the school district rolls. The most common barrier we are seeing is still that English learners remain to lack communication with schools. English learners are unable to overcome technology and language barriers, and they are navigating an English-only digital platform. Multilingual families are left in the dark with no coordinated plan from the district. Families receive different levels of information depending on their school building. There must be a common district-wide communication plan that applies to all schools to support English learners across the city. City Council can play an essential role in facilitating linkages between community-based organizations and the district to support better communications, ensuring that community organizations and the district are collaborating to resolve the problems that community members are reporting to these organizations. This type of coordination with community stakeholders is essential for students and families who do not speak the 9 most common languages of greatest diffusion. We still need more district translation, access to language line, and bilingual counseling assistants who can assist families with access to remote learning. Third, the city needs to expand eligibility criteria for access centers to include automatically English learners and students experiencing homelessness. The current requirement that access centers are limited to families who have no caregiver at home ignores the reality that many English proficient parents lack the support to navigate digital platforms that are entirely in English and classes that are entirely in English. It also ignores the reality that students who are in shelters and experiencing homelessness commonly lack any quiet place to learn. The requirements further exclude students who have caregivers such as grandparents who may need support and access to technology literacy in order to facilitate learning. Many of these concerns can be addressed by expanding access to eligibility to access centers. Fourth, we must address the needs of students with disabilities who continue virtual instruction, in some cases due to health and safety concerns stemming from their disabilities and may not be able to return to school. We commend the district for developing individualized digital learning plans for many students, but these individualized plans need to be completed and revisited and fully implemented for all students with disabilities. We now have several months of data on remote learning, and these plans need to be modified, and we need to learn from the evidence of what children need going forward. In addition, the district must systemically plan for how it will remediate the failure to provide virtual instruction and the support necessary for students with disabilities to receive a free, appropriate public education and to make meaningful progress this year. In sum, the district needs additional targeted support to support its students who have specific learning needs and who continue to lack access to resources needed to engage in distance learning, including sustained access to the internet, support for teachers and counselors and staff to serve those who are most marginalized, including students who are English learners, and expanded access to school counseling and other social emotional supports. We urge City Council to provide these needed targeted resources. Thank you for considering these recommendations as part of a citywide plan to address ongoing barriers relating to the digital divide, which have continued throughout the pandemic and continue to leave our most underserved students far behind. Thank you.
Thank you so much, Ms. McInerney. And as always, we appreciate the recommendations and especially your continued focus on the digital divide. We'd like to follow up with you, especially on the Access Center questions and the limitations there. But thank you very much.
Thank you.
Are there any questions for this panel from from committee members? Hearing none, that concludes our panelists for this hearing, and we will now move into public comment. Public commenters will be given 3 minutes to testify. We ask that you stay within those timeframes as people have been waiting a really long time, and really appreciate both your patience and your investment in this process. Your public comments are deeply, deeply valued, and we look forward to hearing from you. So I will turn this over to Mr. Spiva.
Thank you, Chairperson.
Okay. Now.
Miss Linda Waller-White. I now know your middle name.
I decided to increase
Time.
So when you.
Thank you. For public comment, the first speaker that we have is Diane Payne. Please state your name and begin your testimony.
My name is Diane Payne. Thank you for holding this hearing today. You have heard testimony about what is unsafe about opening our schools, the fears about ventilation, the fears of death and long-term critical health complications, the fear of community spread, both in school and outside of school, the fear of unvaccinated staff, the fear of conflicting science, even as new science information is hitting the media. And yet the district has continued to pursue a rushed, incomplete, and untruthful district reopening plan approved by the school board. But another sinister component to all of this has occurred simultaneously. The Board of Education made drastic changes to the public speaking policy, altering decades of precedents and stretching the limits of the Sunshine Act. These changes were made without public input, public notice, board debate, or board vote. And most alarmingly, they were made in the middle of a historic health crisis. And they went into effect the day after the announcement of Superintendent Hite's unsafe reopening plan. As much as the board would like to point to other means of engaging the public, what is at stake here is more than seeking other avenues of public input. We welcome all increased efforts at including the public, but silencing people in their capacity as citizens to engage with their school's governing body is toying with the Pennsylvania Sunshine Act's protections. This is at worst a failure to follow the legal mandate of the Sunshine Act, and at best failure to follow the spirit of the law. I want to know if City Council supports the board shutting out of the public by capping speakers and reducing speaking time when the public most needs its ability to engage. Will you support public efforts to restore public speaking at the board action meetings to 3 minutes of speaking time and removing the cap on speakers? Do you acknowledge that speaking at a board meeting is civic engagement protected by the Sunshine Act, and curtailing decades of this precedent is a chilling silencing of the public's right to engage? Thank you very much for your time and for holding this meeting.
Thank you. Thank you, Ms. Payne. Next, we have Dana Carter.
Hello, everybody. Well, my name is Dana Carter, for the record. Before we get started, I would just like to say this meeting went a little long, so if I have stuff in my teeth, it's because I was eating. I have braces, so I apologize beforehand. And I just also want to tell City Council, all council members, that the testimony from Kiera Coleman was tremendous. I would like for you all just to go back and revisit everything that she said. Okay, here we go. Good afternoon. My name is Dana Carter, and I'm the policy advisor for the Racial Justice Organizing Committee in the school district. For the Racial Justice Organizing Committee. The School District of Philadelphia is planning to open schools for K-2 instruction in less than 2 weeks. Prior to schools opening, I'm requesting the following. But as a little sidebar, did anyone consider that K-2 children might not be the best population to start with, because in order to teach phonics and letter sounds, the students have to see their teachers' mouths, which won't happen for any child if the district switches to hybrid, because the teachers and students have to wear masks the entire time. Anyway, I ask that every School District of Philadelphia staff member and household member of students have the opportunity to be vaccinated. The School District of Philadelphia began sending emails to teachers today with vaccination information. Today, the Pennsylvania Acting Secretary of Health Allison Beam, stated that some vaccination providers accidentally administered the second dose of the Moderna vaccine as the first dose. I don't know if y'all saw that because you all were busy on this. That came out, breaking news not too long ago. But because of this misstep, some will receive their second vaccination within 42 days instead of 28 days. This information means that if a person has not received their first dose as of today, they will not be fully vaccinated for a month minimally. Can we stop with the narrative that virtual learning is the reason why children are suffering emotionally and academically? COVID-19 restrictions are why children and everyone else may be suffering. Whatever issues children are experiencing academically are the same issues they experience every other year, not due to COVID, but due to fiscal mismanagement and underfunding, systemic unchecked racism in schools, passing children along to the next grade when they can't read and write, and neglecting neighborhood schools. COVID-19 restrictions just put a magnifying glass to already existing school district of Philadelphia issues. I'm almost finished. What we are seeing in this particular city is different than any other city because these schools are historically toxic. This is a special situation. The CDC guidelines are for schools that have kept up regular maintenance, and that is not the school district of Philadelphia. Especially as of 2 weeks ago, only 40% of the air balancing reports were complete when they have had years to complete these reports. Proper ventilation is needed in all schools, including hallways and bathrooms. Please check the ventilation information for the bathrooms. There are major missteps in execution of SDB projects, but results of those missteps are normally financial. The results of this one could be someone dying. Finally, the School Board of Philadelphia, this is an important piece. The School Board of Philadelphia approved a contract with DoneSafe Corporation on June 25th, 2020 for $173,000. DoneSafe has collected, organized, and created a cloud-based management system containing the building conditions in all environmental health and safety information for all school district of Philadelphia schools and buildings. The information collected by DoneSafe is kept private. I'm asking City Council to ask the district to make this information public and explain to each school community behind every coronavirus total case number is an actual life. Perhaps the news should scroll names instead of numbers so we realize that this is someone's child, someone's mother or father or brother or sister or teacher, real people. Please do not add to this list by opening these school buildings for in-person instruction until they are safe. Thank you.
Thank you. Next, we have Dr. Rhea Powell. Please state your name and begin your testimony when you're ready.
Oh, sorry. Hi, can you hear me okay? Hi, my name is Rhea Powell. I'm a physician and a parent of two children who attend the Meredith School in the School District of Philadelphia. And I am deeply invested in safe reopening for schools. These 11 months have been challenging and painful for students, school staff, and families across the city. And while I know that we are all eager for students to return to in-person learning as soon as safely possible, I question a decision to ask school staff to return to the classroom when we are weeks away from being able to offer them the COVID-19 vaccine, which we know would give them the best protection against infection. I'm glad that the district has partnered with the Children's Hospital of Philadelphia to commit to vaccinating all school staff. However, vaccination of district staff is slated to start only 1 week before schools are supposed to reopen for hybrid learning. This plan does not protect our teachers and school staff to the best of our ability. We know that the current vaccines offer the best protection after both doses have been administered. Moreover, we also know that even though rates of COVID-19 cases are declining, they are still objectively high, and new variants of SARS-CoV-2, the virus that causes COVID-19, are circulating in Philadelphia, which raises the possibility of new rises in COVID-19 cases. Vaccinating our teachers and school staff will offer them the protection that they need as we ask them to return to school buildings. And by making sure that school staff are able to be vaccinated before reopening school buildings, we can also reduce further school disruptions. New CDC recommendations advise that individuals who have been fully vaccinated do not need to quarantine after exposure, so long as they have received both doses of the vaccine and had adequate time for the vaccines to be effective. If teachers and school staff are fully vaccinated before returning to school, it lowers the chance that classrooms will be disrupted if and when COVID-19 exposures occur in schools. I recognize the hard work and investment that many have put into planning for a safe reopening. I've read the CDC's guidelines for reopening schools and paid close attention to the plans put forward by the district. By adding to that plan the vaccination of teachers and all school staff before reopening school buildings in Philadelphia, we can keep our teachers and school staff safe and ensure that when schools reopen, they stay open. Thank you.
Thank you, Dr. Powell. Next, we have Amy Henderson. Please state your name and begin your testimony.
Hi, I'm Amy Henderson. I'm a parent of a 4th grader and a 6th grader at Meredith Elementary School. What has become clear to me since I've been a parent with a child in the school district is that the school district does not really care about children. I've sat in a meeting in the auditorium at Meredith while Karen Lynch feigned surprise that the school is overcrowded, when in fact the school has been overcrowded for several years. I've seen the ways that parents and teachers have had to band together and fight hard to get asbestos removed from 100-year-old school buildings. That asbestos wasn't going to get removed without parents and teachers protesting, begging, and without a teacher getting seriously ill. This is evidence of how the school district ignores problems that are right in front of their face until they are screamed at to do something, and then we watch them do the absolute bare minimum. This school reopening plan is the latest evidence. I'm not going to get into the Walmart fans. We all know how ridiculous they are. And watching Dr. Hite keep talking about them as if they were actual ventilation would be funny if it weren't desperately heartbreaking. I don't have much hope for this school year. What I do want to talk about is September. A little more than 6 months from now will be the start of the next school year. This is what I'm concerned about. COVID isn't going to disappear. Hite has had a year to do something, anything, and we've watched him do not very much. The district might be getting money from the federal government soon, and I'm scared. I'm scared that that money is going to be wasted. I'm scared that we're going to be having the same conversation in 6 months. And I'm scared that our children are not going to go back to school 5 days a week in September. We need a plan today for September, a plan that includes all stakeholders, parents, teachers, community members, city council, a plan that is creative, one that accounts for buildings that don't have any ventilation and of classrooms that weren't designed for 30 students, but must hold 30 students nonetheless. We need money to enact the plan, not just from the federal government. We need more pilots from Penn, an institution that sends its teaching students into our schools, but pays no money to the city that it inhabits and feeds from. We need to end the tax abatement. We needed to end it a long time ago. I've spent my life in the hospitality industry, and I've watched this city grow into a top-notch food destination. The fact that people move here, eat amazing meals, enjoy the culture, arts, and walkable streets of our great city, and then go home to their condos that they pay zero tax on, while our children go to overcrowded schools filled with asbestos and lead is disgusting. It doesn't have to be this way. The money is here. We just need to get some of it, apply a little creative thinking, and get all of our kids back to school in September 5 days a week. Thank you so much for letting me testify.
Thank you very much. Next, we have Michael Gorman. Please state your name and begin your testimony.
Thank you. Good evening. My name is Michael Gorman. My wife, Jessica, and I are parents to a wonderful 5th grader at the Girard Academic Music Program. To share our experience, first, I want to read my daughter Abby's reflections. Quote, I am a virtual student and I need to be back in school. Kids who can afford a private school are in person. Why aren't we allowed to be in person too? Virtual school doesn't work in the long run. I've found myself zoning out and getting distracted by things that would never distract me in person. Sometimes it's impossible for classmates to participate because their microphone is broken, or they can't hear, or they can't see the screen, or the mouse is broken. Multiple kids in my class, I barely know what they look like because their camera is turned off. Please, we need to be back in school in person. End quote. It has been 337 days since Abby set foot in a classroom. Now, to be clear, we are lucky. We have access to good technology. We have family support. We have supplemental educational opportunities outside of school. It still doesn't work. Communication is terrible. The technology is complex and hard for kids to navigate. Lessons simply do not have the same impact. Teachers are burning out. Kids are burning out. Parents are burning out. We empathize with teachers who are doing their very best, but virtual school is not school. It just isn't. The learning loss is staggering. We know that. The mental health challenges have been talked about a lot here. We know that they're staggering. The inequality is inexcusable. And the question is, what is the city doing? For students and parents, we're staring into the abyss and hearing nothing back. Guidance from the CDC that was just released highlights masks, cleaning, and distance when possible. What is the holdup? For all the discussion on ventilation, the CDC has been clear here. Quote, improve ventilation to the extent possible, such as by opening windows and doors, unquote. They also do recommend window fans. It's not about what looks sophisticated. It's about what works. Philadelphia sits within the CDC's moderate transmission. So what do they recommend? Again, quote, K through 12 schools open for full in-person instruction, physical distancing of 6 feet or more to the extent possible, unquote. In Philadelphia, you can eat inside, gamble, go to the gym, go shopping, but public schools? How does that reflect upon us as a city and on our values? They're right. The nation is watching. You can look at the studies out of states, out of countries, out of other municipalities and see that schools are not a significant risk of COVID-19 transmission. Or as Abby said, look at the thousands of privileged kids at private schools in and around Philadelphia that have been in person all year without extensive upgrades to ventilation systems. Let's be honest, rich kids are going to school, underprivileged kids are not. The kids of PSD are alone and being held hostage by our civic institutions. Tweets and grandstanding about otherwise good faith efforts to get our children back is not a plan. Demanding potentially billions of dollars in capital projects that even if we have the money will take years to finish is not a plan. Virtual instruction is not a plan. The CDC, the majority of the public health officials and physicians say we're ready. So if the PSD, the city, and the teachers can't come up with a plan to get our kids back now, I would like City Council to give each family the right to take their budget elsewhere so that every child has the option of an in-person education like the rich kids have right now. Otherwise, you're left to answer the question, under what circumstances do you tolerate a segregation in in-person educational experiences? These are our children that you're destroying, and the parents are not going to forget. Thank you.
Thank you, Mr. Gorman. Next, we have Eric Tars. Please state your testimony.
Thank you to Councilmember Ginn's office for inviting me to testify today. My name is Eric Tars, and I'm here on behalf of myself, my wife, Melissa Escobar, and our children, Mona and Opal, in 4th and 1st grades at C.W. Henry Elementary in Mount Airy, where I've served on the school advisory committee for the past 3 years. Also, my day job is as the legal director at the National Homelessness Law Center, and I just want to underline Maura McInerney's testimony on homeless students in the digital divide. But as a parent, I start by acknowledging our privilege of working from home with help from my kids' grandparents and with the financial resources that make it easier for my family to live with the pandemic. We also appreciate the city and the school are in an extremely difficult situation with no easy answers, and we've tried to give as much grace to the district leaders as possible. But grace must end with safety and health of teachers, staff, and students. We are deeply concerned that teachers and staff are 1, being rushed back into a deficient hybrid situation, 2, without vaccination, or 3, adequate ventilation infrastructure, particularly in light of the new, more contagious COVID variants. First, why this rush to hybrid? It's been a difficult year for all, but teachers have been making the best of things in virtual classrooms. Disrupting patterns teachers have worked so hard to establish in virtual school and move to a model where a handful of students are only receiving 2 days of in-person instruction, and teachers will have to manage both in-person and online classrooms that they've been given minimal resources to adjust with, won't serve anyone's educational needs. Second, thankfully CHOP is starting vaccinating teachers on February 22nd, but by March 1st, when teachers and staff are expected to return, they won't have full immunity to the virus. This occurs 2 weeks after the second dose. Teachers and staff not having vaccinations before return is unethical, short-sighted, and dangerous. It undervalues them and makes them seem like nothing more than a commodity. Third, while we've seen reports that say classrooms are theoretically adequately ventilated, at Henry, staff offices, including the school nurse's office, are conspicuously absent from the air quality reports, likely because they do not have any ventilation infrastructure. They've been promised plastic box fans, a Band-Aid solution at best, but those haven't even arrived yet. District leadership is aware of these gaps, but teachers and staff has essentially been told to pretend it's all fine. Masks and ventilation prevent COVID. Closing our eyes and living in a fantasy world does not. It is truly tragic that elected officials at all levels have neglected our schools' infrastructure for years, and it is now inconvenient that those years of neglect are hindering the safe return to school. But now, when lives are on the line, is not the time to be putting on Band-Aids. Unless the district can truly guarantee that all spaces where students and staff will be present are safe, we should not be sending any people back. With nearly 60% of the students who are BILPOC, the environmental impacts are and will be disparate, and without full environmental safety, it's not a question of if, but when transmission will occur. The ethical underpinnings of this crisis planning tells us that one aim should be to take action that improves disparities and that certainly does not make them worse. To personalize this, our daughter Opal's teacher, Meredith Schechter, won the Lindbeck Award just last year. She has not yet been vaccinated. While her classroom has been tested for air circulation, she, her students, and school staff will be interacting with each other in untested, unventilated spaces. It is a grave injustice to put her and our other senior teachers and staff at risk of illness and death when vaccines are right around the corner. Why would the district risk losing someone as valuable as Ms. Schechter, either to extended illness, which will disrupt her current students' education, or worse, removing her gifts from future generations of CW Henry students over a few more weeks until everyone is vaccinated or until air quality is fully assured? We're all tired of the pandemic, but the human rights to health and education must not be sacrificed. The teachers and staff of Philadelphia are here to serve our students, but we must serve them first. If the district wants to reopen, it must prioritize safety and aim to limit further trauma to all those in its service and all the students in its care. In sum, no return without 1, adequate support for teachers in a hybrid environment, 2, 100% vaccination, and 3, 100% air quality safety. In all spaces, district employees and students will be present. Thank you.
Thank you, Mr. Tars. Next, we have Linda White. Please state your name and begin your testimony.
Good evening, everyone. My name is Linda Waller White, and I'm a grandparent. I'm a community advocate and a member of Northwest Neighbors of Germantown. And I know that everyone that still remains on this call is either a parent, a grandparent, an aunt, an uncle, a friend, or a neighbor. And we all have one thing in common. We want the safety for our children. And one of those common areas happens to be, and we know that returning to school will be the best solution for both families and children. I live in 19144 zip code. And that zip code, the school that's closest to me is John B. Kelly School. The maintenance is not optimum there. Our library, I'm talking pre-pandemic, our library is funded and staffed by volunteers. There is no outdoor activity at all, no playground. We've been fighting for years to have a playground there. It's a whole entire city block, one of the largest parcels of land in our community. And the Black doctors have identified 18 zip codes, one of which is mine, 19144, that has one of the highest death rates and the highest incidence of COVID ID. And there are 18 zip codes like that. What I would suggest is, and my suggestion first is vaccinate, vaccinate, vaccinate. Let's think out of the box. We all have a consensus here. We all want the safety for our children and the people who are teaching our children and for the families that are trying to support that. Why can't we think big? Earlier, they talked about vaccinating a children's hospital. Why not look at Wells Fargo Center? this can be done quickly, and this can be done in a large scale. Let's all think about not the what, but the how, and think creatively about how to return ourselves and our children to some normalcy. With the city plan, one of the things that exists today is the fans in classrooms as well as in windows. And my question is, how is it for the quality of instruction and learning for young children over the sound of fans and an open door? So how is that going to increase the quality of education? Certainly is this an option, but I have to say that it is not, in my opinion, the best option. And I don't see how any teacher or any student, particularly young children, can even learn in that kind of environment. We know that I know my school probably has issues with the maintenance. If you look at the school budget plans pre-pandemic, there was nothing planned for the maintenance. Let's look at how to start now to maintain our schools. Our African-American children and children that are living, and people of color, they had problems, systemic racism and poor quality education before the pandemic. And this has just exacerbated that problem. So I say, let's look at what we agree on and work from that point of how we can work to get our children back to school. There is a lot of consensus, a lot of passion around this. We should be able to solve this. Thank you, Madam Chairman, and colleagues of the committee, and all the passionate people that feel strongly about this. And one other suggestion I have is to ask the school board to come out to the communities. Many people are not on these calls because they're essential workers. They're working 2 jobs. The only thing they can do is either take their children to an access center so that they can get benefit of the remote education, or they're living in multifamily homes. Let's look at this problem from, as someone said earlier, from those who are truly suffering in different ways, as opposed to looking at, and the schools that they use as examples are not schools that represent any of these problems. So thank you again for your time and attention, and I'm hoping that through this committee that you will look at solutions.
Thank you, Ms. White. Next we have Meenal Lele. Please state your name and proceed with your testimony.
Hi, my name is Meenal Lele. Can you guys hear me? Okay, cool. Sorry, my name is Meenal Lele. I'm a parent of a child at John Moffett Elementary School and soon to be another child in the coming year. I'm not entirely sure, actually, after listening to all this testimony, what the goal is at the end of it. But I think one thing that's been apparently clear, and I apologize that this testimony might not be terribly useful, is that a lot of the disagreement here is about a longstanding distrust of the district that's coming from the teachers, from some parents, and whatever else. I personally don't happen to share that distrust of the district. My personal experience has been that the school seems to be trying hard, the teachers seem to be trying hard, and it's a lovely environment for my child to be. Sure, could buildings be better? Could situations be better? Obviously, but I think that's the case almost everywhere in the country and not unique to this. One thing I think is important for us to all remember is a lot of the opposition to children going back to school is based in fear. Dr. Rubin, when he first started speaking, said he gave out guidelines that are very achievable. Distance as much as possible, give everyone masks. He said that ventilation is not necessary, and yet almost every argument has been one about ventilation. And it reminds me of a point I read somewhere where somebody said their fear of COVID was like when they went bungee jumping and they just couldn't bring themselves to do it. They had this fear of heights, and no matter how many people they saw before them jump off this ledge or whatever, safely return, and no matter how much data effectively was put in front of them, they were just scared. And that fear overtakes their brain to a place where they just couldn't have a conversation anymore. So it feels like all of this, the COVID is basically amplified and festering, causing an anger to fester that's been there forever. But what hasn't been clear is from the teachers union or anyone else is what is the line? I think one of the most frustrating things for parents, and myself included, is that every couple of weeks the goalposts move. First it's we want one thing, then it's we want something else, then it's we want this, then we want 100% vaccination, then it's we want all the kids to be vaccinated, then it's we, and it keeps moving to a place where we're never going to actually get there. So I feel like what has to happen, I agree with a lot of people that have said, look, maybe it's not right for us to rush to hybrid.
Ms. Lele, are you there?
Sorry.
We lost you for a moment.
Sorry. I think you can hear me again now. I think a lot of people were saying that I think that maybe there's no rush to doing hybrid, that maybe, that's making teachers work twice as hard but not really gaining value. I really feel like what parents are asking for, the parents who want their children back in school are asking for a real school experience, 5 days a week, in person, where the teacher is there and able to give them support. So if that's our goal, then everything we should be doing should be about how do we get to that point, right? What do the teachers need to get to that point? And we need to put that line down and then not move from it anymore. Because what is that? Is that 90% vaccinations? Is it everybody who wants a vaccination gets vaccinated? Is it a particular case rate? And it all does need to be grounded in science. So we can't have the teachers one day saying, we're going to follow what CHOP says. And the next day when CHOP says, hey, it's safe to go back to school, saying, no, we don't trust you, CHOP, right? So we got to pick something and just stick to it. And I think it's going to take courage, honestly. And I think, for the organizers of this panel, that's the one thing I would say here is, look, we're never going to get rid of people's fear. Fear is just one of the strongest motivators humans have. And you're never going to get rid of it. You're never going to get rid of the distrust. So at some point we have to have the courage to say, what is our line? And when we get there, we're all going to agree to change the situation to full diet, 5 days a week, full time in person. And, again, I do appreciate all the hard work my child's teacher has put in. I understand that she feels at risk. I understand all of these things. And yet, for all the grocery workers and every other essential worker that's been at work this whole time, and some of them have testified here, they're not getting any buys. The rest of us aren't getting any buys. So we need to just pick a line and stick to it. Thank you.
Thank you, Ms. Lele. Next, we have Amina Malik. Please state your name and proceed with your testimony.
Hi, good. Sorry, I'm trying to get my kids together. I apologize. Hold on 1 second. Say that the agony of sending your kids to schools that may no longer be separate but are far from equal. And I was listening to Dr. Hite, and he said, not all or nothing is not a proposition. But however, I feel like as a parent of 4 children, of which 3 are in the school district of Philadelphia, I have a son that's at Anne Frank. I have a daughter at Baldy. I have another daughter at Swenson Arts Technology High School. I grew up in Philadelphia. I attended the Morrison, Solace Cohen, Wilson Middle School, and Northeast High School in the 80s and 90s, and I have yet to notice any new upgrades to these schools. As I drive past, actually, when I attended my daughter's field hockey games at Northeast High School, the grounds were not even kept up, trash around all the bleachers and on the field. When I attended meetings and conferences in my children's schools, I have not seen any upgrades. My son used to come home on a hot summer day and complain he couldn't focus on classwork because it was so hot in the room. These are the same conditions I endured as a child. I never thought nothing of it, but now, during a pandemic, these issues are extremely problematic. There was never proper ventilation when I was a student, and there isn't any now. Windows can barely open. The heating system used to be too hot, and from what I hear from my children, things haven't changed. Now, during a pandemic, where I already feel our government and the CDC has not protected its people, and yet districts are trying to open schools that may cause my child to have life-threatening consequences. Even one COVID case is one too many, and the chances of that happening in the conditions and the state that we are in is very likely. Can the district or the city promise that no child or staff will be infected? Not one single person? Are you okay with one person being infected in our schools and then dying? Is that okay? One is too many. One is not a number or risk I'm willing to take. I don't want to be the mother of that one. Now, if your answer is yes, 0 people will be infected and 0 people will die of COVID, then I will send my child to school tomorrow. But the way our situation is looking, I find that hard to believe. You would be telling a bold-faced lie if you say no one can get sick in a place we know breeds infections and viruses. Thank you so much.
Thank you very much. Next, we have Mary Beth Morgan. Please state your name and begin your testimony.
Good evening, everyone. My name is Mary Beth Morgan, and I thank you for the privilege to speak tonight. I'm going to take a little bit of a different approach with this and focus on our youth and young adults. As we have all experienced this past year and on a continuous basis through COVID-19, there has been an infringement on our civil rights and equal opportunities for students with disabilities. As the Philadelphia school system is proposing a hybrid model to resume teaching, I would like to remind you of the benefits of mentoring transitioning voices and that MTV offers to students with different abilities. The transition skills that MTV promotes includes how to develop and maintain relationships, build self-esteem, set personal goals, communicate with others, deal with conflict, and live in an active and healthy lifestyle as adjusted to COVID-19. Concentration will be placed on working with parents and professional teams as personal goals may need to be adjusted and finding out about jobs in our new virtual-based world, to name a few. All of this can be completed in the framework of Liberty Resources, the Center for Independent Living in Philadelphia. Our core services, information and referral, peer support, skills training, advocacy, youth and nursing home transition will be intertwined as the sessions are taught, as they help to provide a smoother transition for the young adults to adulthood, and as they're going through these changes. Regarding Resolution 200630, I am offering services to students virtually. This will allow discretion for students to learn to work with the changes they are experiencing and ask for the help that they need. MTV provides enforcement to the social emotional wellness plans that the Philadelphia School District is enacting. Thank you, and I appreciate the work that is being done to provide our students and teachers with the necessary resources to be successful. Have a good evening.
Thank you. Our final member registered for public comment is Orlando Acosta. Please state your name and begin your testimony. Mr. Acosta, I believe you're on mute currently.
Can you hear me now?
Yep, can hear you loud and clear.
Yeah, okay. Hi, my name is Orlando Acosta, community advocate, and also parent, on-time parent of Philadelphia in the Philadelphia School District. Thank you, Councilwoman, for this hearing today. I find that I'm really at a loss for words because it's so many issues that are addressing parents and children in this pandemic issue. Now, the first and foremost situation is this. First, we have to understand what causes COVID. Okay. Now, even though the CDC and different things are given medical knowledge on what goes on with COVID. COVID and every virus is mucus based. So although we're giving out vaccines, there's multiple vaccines and people are dying from even the vaccines. So you have to be very careful. I'm not saying don't take care of your health and different things of that sort. What I'm saying is we have to look at all elements of things to protect our children. Because if we're talking about sending our children back to school, first of all, there is ventilation because viruses carry a situation of they mutate in close environments, no air, different things of that sort. So that's very important. So when I'm very disturbed when the doctor says, don't worry about the ventilation. You know, you can send a child back without ventilation. No, you can't, because anytime that you have a virus sitting around a area and you have a cluster of people gathering together, even if you're talking about social distance, when you're talking about 2-year-old and 5-year-old children, they're not gonna know how to social distance. They're not gonna do it. So we have to be mindful of that. And we also have to be mindful of understanding that, because when you can also detox. Detox means you can clean your system out, vegetables, foods, different things to fight viruses, to clean the mucus out. Viruses live by mucus. So there's other doctors outside of what you hear today that'll say that these basic things that don't cause side effects. Because also with vaccines, it suppresses your immune system at the same time. Now, yes, it may help some people in regards to that, but do we want to risk children going back in the building? Like many people said, one death is too many. And then let's ask the question, then what is the liability to the district? What's the liability to the city? Can we really risk one child or the liability? Because then you're opening the floodgates of massive lawsuits. But let's really look at that comprehensively. And we have to have parents at the table when it comes down to real decision making. Because if we get one death in this city, you're going to have massive lawsuits in a matter of 24, 72 hours, one child's death. And then once you open that floodgate, you can't close it. So we have to really think about this, because you're walking around dangerous tread waters. Now, I understand everybody wants to go back, but we have to do due diligence of research, different things like that. And I have other means that can show how to clean the system out naturally, that'll get that out. Now, if people want to do vaccines, that's their choice. I'm just saying all of it's dangerous, because most of the time vaccines take 10 years to produce. When you're talking about, so this got rushed. So you also have to wonder, is that if that's the route you want to go, then that's your choice and you have the right to do that. But we have to be mindful of that. Give other people options so they know it's not just one option on the table. So and I'm willing to share any information with any council people to show the data from other doctors that show other meaning of protection, with boosting your immune system and keeping everyone safe. Because at the end of the day, we can't lose any children. Thank you.
Thank you, Mr. Acosta, for your comments. That concludes our list of registered individuals for public comment. Chairperson Jeremy.
Yes. Are there any questions or further questions from members of the committee on of any of the commenters or previous testifiers? There being no questions from members of the committee and no other witnesses to testify,
Madam Chair?
Yes.
Pardon me, my apologies. I just wanted to thank Mr. Acosta for his testimony and to let him know that I miss seeing him in City Hall. I really miss seeing you, and thank you so much for your advocacy.
Thank you. I appreciate you.
Yes, thank you.
All right.
Yes. Thank you so much, Councilmember Gilmore Richardson, and ditto, Mr. Acosta. We appreciate you and all the other testifiers as well. So I'll just ask if there's anyone else present in this hearing whose name we have failed to call and that wishes to offer testimony on the resolution that was considered today. Hearing none, I just want to thank all the panels and witnesses for your participation tonight. We had 40 plus speakers, over a dozen submitted written testimonies, 200 plus respondents to a survey, 3 hours of questions for CHOP Policy Lab and Superintendent Hite, and 6 hours of public testimony. Tonight, we reaffirmed that our public schools are rooted in public trust, public engagement, and an intrinsic relationship between our schools, our children, our homes, and our neighbors. Our education, the education of our children, is tied up as much in our public health and our well-being, our economic security, and our vision for our futures. First and foremost, I want to thank all the parents, all the educators, school staff, principals, community members, some of whom waited hours to testify. Thank you for adding your voices tonight. I'm so deeply moved by the passionate testimony we heard this afternoon and evening, from comments from our principals, whether they were talking about the confusion around testing protocols, from parents like September Fisher asking questions about how long this would continue. Raymond Jackson, a building engineer who laid out clear guidelines and recommendations about everything from longstanding issues of boilers to basic cleanliness and cleaning out of crowded classrooms to ensure that he could meet the standards that had been laid out for him by the district. I want to thank all of our teachers. I want to thank Kiara Coleman, who as a single mother working less than full time, was serving students, contracted COVID, and continues to care for our children's needs, including ensuring that they are healthy and well fed, that they had their information packets when they needed them. I want to thank parents like Amina Malik, a parent of 4, who talked about generations tolerating poor conditions within our school buildings and asking that there be no more. If there's one thing that we know, the education, care, and keeping of our children could not be more important, and it must call us to action. We had a clear goal tonight: to arrive at a place where our constituents felt heard, respected, and responded to. Public health cannot exist as orders on paper, delivered on websites, and expected to be translated by the hundreds of school members and school community members who must execute on the public health and care and keeping of our children, especially in communities that are our most vulnerable, in Black and Brown communities that have suffered from the disparities of economic injustice, of health pandemics, and of educational disparities. We could hear the pain and the frustration and the anger and the distrust that's rooted when we leave our communities behind. And we also heard an equally loud calling that we all want a safe and responsible return to school. And that starts with ensuring that communities have a voice at the table, that we collectively figure out how to ensure the health and safety of our young people, and that as we work our way through this pandemic, that we understand that schools are so much more than just what happens within the building. They are so much about the life and vitality of our own families and of our communities and neighbors. Today is about the importance of communication and trust as we work towards that full reopening of schools that all of us spoke about tonight. No matter what, a partial reopening of schools still would have meant that more than 90% of young people would still be learning at home. And what we need to be working towards is that full and confident school reopening, where our schools are better, that they are safer and they are healthier than they have ever been before. On behalf of our city council committees, on the behalf of the City Council Committee on Children and Youth, on behalf of the City Council Committee on Education, and on behalf of our broader City Council, I want this public to know that we are committed in that journey. We will seek to get you answers that were asked tonight, and we will work to hold our district and ourselves to a higher standard than what you have seen before. I want to thank everybody for watching, and I look forward to continuing this work with everybody. If there are no other comments, this concludes the public hearing of this committee. We will now recess this joint hearing until the call of the chair. I want to thank our City Council staff, many of whom are here at 8:30 p.m. in City Hall with me, and I'm incredibly grateful for their dedication, for their hard work, and for their commitment to ensuring that Philadelphians are always heard. Thank you all very much for your attendance.